Thanks, Amy. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 20 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department, in just one 24-hour period.
Camino. Everyone should walk through an emergency room at least once in their life, because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Trauma red phone 6 minutes. Trauma red phone 6 minutes.
Stabbing. Yeah. You know, used to be Saturday night, it's all right for fighting. It's obviously Thursday night, it's all right for stabbing. It's sad the way things are going. The fact that a lot of people don't have anybody to look after them, to love them. I think that's sad. I think, you know, I think everybody deserves to be looked after and loved. Stabbing.
35-year-old Colin has been stabbed. He has knife wounds in his arms, chest and liver.
OK, it's Colin.
Hello, mate.
Stabbed with a small knife
That's it.
4 times.
Pop your thumb back if you can, darling.
GTS 15-year-old
Good
time,
lad.
moving on
Good
4 limbs.
boys.
IV access to oxygen, no other interventions. Even out stable.
Take some nice deep breaths, all right? We're going to get you some painkillers shortly.
A stab to the liver can be fatal. The team need to assess him as quickly as possible. His 19-year-old girlfriend Esther was with him during the attack.
His name is Colin. He's our gentleman who's been stabbed. He has got pneumothorax and a liver laceration. Yeah. He has got a chest drain in. Cheers, Gordon. Thanks, mate. Bye.
Come here. Oh. I want to see you do that, please. I told you I needed to move out of there anyway. Yeah, I'm blaming the council though for leaving my entrance door open for so long, you get me? And not giving me a key, you get me? It's their fault. Yeah, me, they're getting blamed for it. They have to pay me for me getting attacked on my property, you get me?
We were just asleep in bed. I didn't hear anything until the door was just completely broke open and some just peeked up and some people were standing above his head and my head with a gun, with their face masked, saying, "Where's the money?" and all sorts of crap.
I ain't had no argument with anybody. I ain't beef with anybody, I ain't trouble with anybody, anything. I ain't done shit. I've been with you most of the time, you get me? You And it's basically just came to my house to rob me, like.
So why don't you move somewhere?
Babe, you know I've been trying to move for ages now. I've asked you to get me out of there ages ago, you get me? You know I wanted to move.
I live in Brighton. I live with my mum, my 2 sisters. He's come from London, where loads of crime sort of goes round. So I've sort of seen a different aspect to life now I've met him. He's got a certain aura to him, where it's a bit bad, bad man, sort of. But that's not what I'm attracted to. That's a little part of it.
Hey babe. Colin is in hospital and someone broke into the house and stabbed him. He's got a punctured lung and punctured liver. They said we'll tie him up, and they were going to tie him up. And they kept whacking around him with the gun and stabbed him 5 times. If he hadn't jumped out his window, I don't know what would have happened.
The girlfriend looks quite alright. Do you think the girlfriend looks alright?
It's got a lot of tattoos and things, so.
So what do you mean by that? I got tattoo as well.
Well, no, so have I. Oh, nice bit of chocolate though, keep me sweet.
I feel sick. Does that make you feel a bit queasy?
Babe, don't look at it then.
Joking. Really joking.
We don't need 2 casualties.
I want to get a chair.
1 hour after arriving in resus, Colin's condition has stabilised.
It was the last thing in my whole life of expecting to wake up and find 2 masked persons in my home. I thought that was the safest place to be.
Your breathing looks fine. We met a girl called Faye's house. I didn't completely attract to him that time.
A few weeks later, I got hold of her number, went for a few drinks, meet up a few times, and ever since we've just been close friends, and then we got together.
You've got a nice, kind job.
Oscar.
She's well-spoken, she's polite. Just everything about her is just perfect for me, I believe. That's what attracted me to her.
I love how he looks, I love how he dresses, I love how he speaks, I love how he smells, I love how he makes me laugh. I love how he makes me feel like secure, and I love how he makes me sort of have a sense of direction and help me when I'm feeling low.
You'll be all fine. You will be fine.
Just saying that.
No, no you will.
Oh, I'm gonna kiss and hug, please.
I just felt like he was so, like he just needed hugs and like smiles, and just me telling him he was going to be okay. I just felt like I had to really be there for him when that happened.
A little bit.
So is it okay to have another cup of tea?
3 weeks, yeah.
Thank you.
In 3 weeks' time.
So what's been happening with you?
My memories is just going.
Is it?
I don't know why. Oh, I know what. Around to tell them I wasn't feeling well, you know, I have this phone that I can ring.
Yeah.
And they sent an ambulance. They said, wait a moment. They went off. They came back and said, we're sending an ambulance.
That was kind of them, wasn't it?
87-year-old Nancy has been brought in after collapsing at home on her own.
All right, my darling.
Yeah.
Is that all right? When you see older people when they're on their own and they really haven't got anybody, you do think how hard it must be for them not to have someone who's looking out for them, you know, and we probably are the people that are looking out for them. And, you know, I do a job that is very, very stressful, and I'm lucky enough to go home and have an amazing life and a beautiful family and a supportive family to be able to come back the next day feeling like I hadn't worked a horrendous shift the day before, you know. It's important to me. I mean, I don't know if I'd be able to do it with such vim and vigour if I didn't have them supporting me, to be honest.
Let me have your arm, my love. Oh, and you've had a blood test recently. What was that for?
Oh, I know, I went on a cruise and I felt sick after it. I had a kind of sick feeling. And,
yeah. Right. Where did you go?
We went to Southern Ireland.
Oh, lovely.
Spain and France.
Oh, lovely.
It was very interesting.
So do you live on your own?
Yeah, yes, I do now. I'm just beginning to feel the disadvantage, you know.
Yeah.
I was all right for quite a long time. I was used to it.
Yeah.
Yeah. If you're happily married and got a family, you know, it must be very, very nice for people. I've always thought that. Yes. When I would have been courting, the war was on and all the men were away, so we never got a chance to know them. And by the time they were back, it was probably too late.
Okay, let me just have your arm. I'm just going to pop a little line in and take some blood from you.
Yeah.
Oh, you've got very good veins.
I come from a long-living family, though.
Oh, do you?
Yes, and I've never known anybody be in a home.
Well, that's brilliant. That's really, really good. Really, really good.
Oh, yes, I get around as well. And I like living independently. I wouldn't want to go into a home. And kind of have your books and your music and your things around you.
Of course.
Yeah. Should have got too many things around me.
You're a bit of a hoarder.
I think, yeah, that's right. Don't get rid of anything.
Isn't she gorgeous?
She is gorgeous.
I know. She's had hip replacements. She's just been on a cruise. Yeah.
Oh, brilliant.
And she is 86. I'll be a cantankerous old bitch, I think.
86. Mother of mine. I'm still in here. They said I got a 2.5 hour wait. Yeah, and then my doctor called me back. I'm saying to her, both of my ears leaking. She says, what, both of them? I said, yeah. She said, both? That's very dangerous. And she's saying to me, well, I think I'm going to set you off with antibiotics because I think. I'm saying, you know, doctor, to be honest, think isn't good enough. And then I'm saying to the doctor, when I said to the doctor, to be honest, doctor, I don't feel comfortable with you saying you think. She's like, well, I'm just trying to do my job. And when people are being aggressive, something, I said, aggressive? I said, I'm not being aggressive. I said, I can be aggressive. I'm not being aggressive. I'm saying I do not. All it is that I don't think that your ethics of working right now is right. When people come to the hospital and the doctor says, well, we think it's this and that, and then they go home and then they die the next day, it's because you think. Do you understand? I said, you haven't even asked me to come in. Mum, they're more than careless. They're moving whatless.
The results of Colin's scan are back and reveal the extent of his internal injuries.
Obviously the scan shows that this wound here particularly has gone into the liver. I don't think it's caused any major injury that needs operating on, but we need to keep an eye on you, so I think you will be in over the weekend. Okay, all right. I'll let you eat and drink as well.
I haven't been in trouble for the last 5 years or more now. You know, and my history has nothing to be proud of. You know, I'm really disappointed of my past. You know, that's why I try and make, you know, the future better.
It's made us quite a bit closer. Just because he almost died, I realised when I thought that he was going to die how much I cared for him.
She did save my life. She actually made a phone call to actually get me to the hospital. You know, and I believe that she played a big part in saving my life. She did save my life, yeah. Yeah, I do love her 1,000,000 times, I do. She knows that. I tell her that every day.
What would you say to people that will say to you, you shouldn't be with him, he's bad news?
He's not bad news. He should be being cared for, not being thought of as, you know, some horrible man and horrible villain, because that wasn't him, was it? That was other people breaking into his house. So that's what I'd say to the people, and I say I love him, and that's fair enough for you to say that, but I'm staying with him. So if you want to have a problem with me about that, that's your problem.
And then they said they ain't got no appointment, so they do that phone consultation thing. And I'm saying to her, I've got a lump on my neck. She's like, I think. You see, babe, thinking doesn't work for me, because Sandy's ex-boyfriend, yeah? His ex-girlfriend went into hospital with a headache, you know, babe? They sent the girl away. The next day, the girl died. Do you understand? Like, come on, man. These people are slacking. And even my mum said it, because they're not getting paid what they want to get paid, they're just taking a piss. Oh, I'm gonna get upset, you know. Oh, this wait is too long now. Oh, I'm in pain, oh God. So, how do you feel right now?
Well, I feel fairly all right, really. I feel better with it.
Okay, and at home, you're completely independent? Do you have any carers coming to help you?
Well, I've got someone coming to do my housework, and
okay.
Yes, although she's not been very satisfactory, I'm actually changing at the moment.
She's once a week, isn't it?
Well, it's twice a week.
Twice a week. We've got social workers in the department who will be able to see whether they can organise some care if you so need it, okay?
Being on your own at night is probably the most difficult time. There's loneliness, for instance. Well, you couldn't expect a friend to be coming round. Well, I wouldn't worry somebody in the night.
We have some volunteers from the Red Cross Society. What they do is they go home with people such as yourself, just to make sure you're comfortable at home.
Well, when they came to pick me up, they said, oh goodness, you need to tidy your sitting room, need all the books around. I've been trying to do it, but it's not easy on your own.
No.
Yeah, so...
No. Don't worry, they'll be very helpful.
Yes, all right,
okay,
yes.
Okay,
yes,
thank you.
Yes, thank you. Yeah. when you had no experience going to hospitals, you could feel frightened, and the sight of an ambulance used to worry me. But now, I'm really grateful and pleased to go there, and that there really is nothing to be afraid of. They really do look after you well.
You ready to go?
Ready, steady. You just take your time. You're welcome.
What would we do without them? I think it's a shame when people don't appreciate what they do. Yes.
Oh. So you're not coming no more? Oh, do you know, she'll probably say that because I got seen. You know, I was saying I wanted you to come in with me. They've given me some stuff here. The man's had a look in my ears. He's saying to me, basically, if I carry on cleaning my ears, I can kill myself. Carry on cleaning my ears, I can kill myself because I'm pushing the infection into my brain, yeah? Yeah, he said my ears are infected, and I'm pushing the infection into my brain. Yeah. I've got to go, and he's booking me into a specialist GP because they said I need to go to get counselling and see a psychologist or something. He said I've got compulsive disorder, something like that. Obsessive compulsive disorder. Because I do my ears, I clean it too much. Because you see, if I don't have a cotton bud, I get angry. Yeah. When I don't clean my ears, you know how I get funny. You get me? Bye. Thanks very much. My drink, how you keep leaving? I'm going to look for you.
Be good next time.
I will. Bye. Bye.
Get in there. Get in there. Daniel, get in there.
Susan's been brought to A&E by her partner Gordon and children Alfie and David. She's been suffering from a pain in the neck.
The two doctors says in the ambulance, it might be cramp.
What? I told him, I said it might be gallstones again.
Yeah.
So he goes, yeah, she suffers them a lot, don't she? Gallstones.
You know what you do be thinking, don't you?
What? Supposed to be going out tonight.
Hello.
Sit down, kids.
My name's Giles. I'm one of the nurses on today. What's brought you into us today?
I'm getting pains on my side.
OK, whereabouts in your side?
Right there it is, where my finger is. I had it last night.
OK.
I didn't get no sleep, and the pain is getting worse and worse and worse. I need some tablets. Look, I'm getting pains right near my neck. It's all the way down.
It's a microphone.
I don't know where. It's all on one side. It is this side.
So it's from your neck down, but it feels like it starts in your...
Yeah, my neck. It started from my neck first.
One of my colleagues will come in just a minute. I just want to do a quick scan of your heart. It's nothing to worry about. It's something we do on the majority of people. But at that point, just a good opportunity to take your kids down to the Pediatrics department. One of my colleagues will show you the way. You can get some toys or something to keep them occupied. But we'll just, and then I'll do the scan whilst they're down there.
All right.
OK?
What?
The scan, I don't like scan. It's going for a little while. I eat it. It used to look like going for a black tunnel. I don't like scans.
Leave things alone.
With a scan, they tell you to out away. That's the problem.
So they might think it's serious. Oh, love.
Might be anything.
Fucking hope not.
Hello. Again.
Come here.
This is Hilary. She's going to just take you guys down to find some toys and things.
You two, go on.
And then...
No, you can't come with me. No, you can't come with your daddy. Just I'm waiting.
Just for a few minutes.
Oh, for a minute. I'll be back. I won't take long. No, you can't. I'll be all right. Go on.
Oh,
I'll
come
be here
on,
when you come back.
darling.
Daddy.
Daddy will come.
Yeah, Daddy, come. I'll be back in a minute. Go on, quick. Come on. I'll be back in a minute.
Daddy will come, yeah.
Good boy. Yeah, he's coming. Go. I'll be back in a minute. Yeah, don't cry. I'll be back in a minute, yeah?
Daddy will be back.
I won't be long.
Sorry about that. Okay, I just need to do a quick scan of your heart.
Yeah.
So if I can just get you to pop your T-shirt off underneath there.
Yeah.
I'll keep you as covered up as I can, but unfortunately I do need to expose you slightly. Okay. Just keep you as covered up as we can.
I'm sorry. I'm a 54-year-old guy, and when I listen to you speaking about yourself, I just think, my God, what is that woman up to? You should not have so many problems with when you're such a young girl. That's my opinion.
54-year-old Robert was found drunk in the street with a hand injury. It's his 5th visit to A&E this year.
Yes, thank you.
What is it that you're drinking? Is alcohol?
What?
Is it alcohol?
Yes, of course it's alcohol.
You're not allowed to take alcohol.
Oh, sorry. Yeah, I'll put it away. Sorry.
No, you have to bring it outside.
I have to drink it outside.
Yeah. Can you take it out, please?
Yes, of course. Yes, of course I can finish it outside. No problem. I didn't realize it was such a scary offense.
My name is Robert. I'm 54 years old. I came originally to do a postgraduate law degree in international law topics. And I stayed because on the 5th of March 1984, I met my beautiful wife. I became an alcoholic because I was spending a lot of time away from my family. And I drank because I wanted oblivion. I spent much of 2010 very angry and saying to myself, pour me another drink.
That's me. Oh.
You all right?
No, it hurt my finger.
I think what we need to do with you before we look at your hands, Robert, is get you into a cubicle and give you some fluids. All right?
Yes.
Because I think you're a little bit too drunk for us to assess properly at the moment. Is that all right?
I don't really know.
Never mind, just leave it to us. I'm going to try and find a space for you, okay? And then we'll sort out your hand.
Do you know what? I think you're the most wonderful woman that I have ever met in my life.
A lot of people say that, Robert. Thank you.
Right, the doc hopefully won't be too long. I'll have a look and see roughly how long the wait is for you.
Leave it. I took all my clothes and I put the bucket in Robert. It's on the bottom.
What?
Oh, for fuck's sake.
Was in here when you took it off?
Yeah.
When you took your T-shirt off?
Yeah.
He shouldn't be in here. I'm going to end up hitting him.
What?
I will, I end up hitting him.
Why, the doctor?
It don't matter, he shouldn't be in here.
It's fucking nice. I don't mind. Give me my doctor anyway, mate.
Yeah, I'll be kicking his head in.
There we go. I'll just go and dip that urine for you.
Oh, I've got one of my... Oh, ow.
Don't like that prick.
Susan, is it?
Yeah.
Hi, Susan, I'm Amanda, one of the technicians. Has anyone taken a blood sample yet?
Yeah. Doctor did, yeah. Yeah, he done it.
What doctor saw you?
No, it was that geezer who's there. Just walked out of
One
here.
with a blue suit on. The blue suit on.
The idiot, man.
Is that idiot, man? That's
He
nice.
is, yeah. The idiot. Oh, I wouldn't mind kicking his head in.
What is your problem?
Don't like him.
Because you don't like him. I like him.
Don't like him. It don't mean like that, Susan.
You don't mean that.
But he's touching you.
Yeah, he's
I
a
don't like
doctor.
it. I don't care shit.
He's a doctor.
Shut up.
Oh, one there.
Susan is suffering from an undiagnosed pain in her neck.
Dan, can you pull a cane, please? And can you stop what you're doing, please?
Don't touch the computer. Leave it.
I know what to do it.
No.
Next time, you're not coming up here, Daniel.
Leave the computer,
You're getting really
Daniel.
bad now.
Leave the computer.
Hello, my name's Malcolm. I'm one of the A&E doctors. How do you do? Pleased to meet you. Right, we've got to go in order here. Hello, sir. Young ones?
Daniel, yeah.
Good stuff. Can you describe the pain for me? Is it like a stabbing pain or pressing pain? Maybe a burning?
Do you like having a baby?
No.
Or worse?
Worse.
Worse, right.
It's worse,
yeah.
that.
Wow.
It's
Okay.
worse. Tell you.
We gave you some painkillers earlier. They helped at all?
No.
No?
Nope.
Okay. So listen to your chest. Are you able to sit forward for me, do you think? That's gross. Any change in your weight recently?
No.
Wait. I think she's put on a little.
Yeah, I put on a lot, yeah.
You
Well, I
smoker?
think- Sometimes, not a lot.
Alcohol?
No.
Are you working at the moment?
No.
Looking after the kids?
Yeah.
Full-time job, isn't it?
Yeah. They're at school at the moment.
Okay, good. Can you think of anything you've done differently in the last few days? Have you done any lifting?
No.
Picked anything up?
No.
She just sits on the sofa watching TV with the kids.
But no change from normal. That had been what you'd normally do.
Yeah.
I think this is going to be a muscular pain. Certainly up in the neck there,
Yeah.
and where your tender here, we can press just over where the ribs are.
Yeah.
There's a lot of muscles, 3 sets of muscles attaching all these ribs, and all these can get inflamed. I see you've had some codiagamol already. It's a pretty good painkiller.
Yeah.
What we could do on top of that is give you an anti-inflammatory.
Yeah.
So like ibuprofen, we give you something called diclofenac, which is it's kind of a little
Yeah.
bit more punch to it.
Yeah.
All right.
All right. then.
Good stuff.
Thank you.
Any
All right.
questions at all?
Yep.
Thank you.
All right. What's your
All
question,
right.
young
Where's
man?
the pen?
Where's the pen? My pen's here because I've lost my top and I can't put it in my pocket.
Oh, yeah. That's all right.
I'll see you later. Thank you.
All right.
I'm starving.
So am I starving?
I am too.
45 minutes, they're going to give me some more medicine. In 45 time, you're going to come back. Then I can go on. I'm going to pop out fish and chips. Or McDonald's.
Yeah, Dad, give me McDonald's. I want McDonald's.
After an hour on a drip, Robert is sober enough to be examined.
Hello? Sir?
What?
Have you been in hospital recently?
Yes.
Which one?
Lewisham.
Lewisham. With what problem?
I'm drunken alcoholic asshole.
Did you fall over then?
Yes.
Did you bang your head? You got some scars on your head then?
Yes, I have several scars on my head. I was in 5 different A&Es over the course of 2010. I was really in a bad way, very underweight, and having seizures in the street in Lewisham, falling flat on my face and waking up in a hospital bed, and King's was one of them. I did it about 10 times.
How are you feeling now?
To be honest, fuck.
Do you remember me?
Yes.
Okay. Do you remember how you got here?
I know that I was brought here by ambulance. I don't know how I actually physically got here.
What happened to your hand? This one.
Which one?
This one. This is all very swollen.
I think I punched somebody.
Okay. Is it painful?
Only when it hurts them.
Only when it hurts.
The other guy.
Okay. Can you make a fist? Okay, and does the thumb move up and down? This one on its own?
Yes.
I was always a loner, and like a lot of addicts, I thought that that was just me and I was just different. I've lost many hundreds of thousands of pounds. I've lost the love of my wife and my children.
Didn't you put your shoes on?
I couldn't be bothered.
Okay. Your hand's fine. You've got no fracture there.
Mm-hmm.
Do you want to go?
Do I want to go?
Are you ready to go home?
I don't have a home. It's a flop house. Yeah, I don't have a home. The bed in the hospital is actually the nicest bed I've been in for a long time. I'm sorry, but that's the state of Robert.
Okay. We'll come back in as soon as you finish that.
Thank you, dear.
Of course, it's a wonderful thing to wake up in a nice, clean bed and have a person there to take care of you. It's fantastic. If you sleep rough or in hostels which don't have any heating, actual physical warmth is extremely nice, but also personal warmth of the staff, people who care about you. I did tend to think rather paranoically that people were often kind to me because they wanted something from me. And here in emergency, that's clearly not the case. They just want you to get better.
Cardiac arrest, that's all we know. CPR is in progress and full protocol.
I had these dreams and hopes that I was going to leave at 10 o'clock tonight. It didn't happen.
Can't miss at 10.
No, it had just gone a bit tits up at 10.
9:59?
9:59.
A patient has been brought in by ambulance after suffering a heart attack.
Okay, we can do CPR, please. That's wonderful. Thank you very much.
Thank you.
Okay, lovely, thank you.
She's had one shock in manual mode. 8 adrenalines. She must have been down at least 6 minutes before we got there.
Can you do a rhythm check, please?
Yeah. She's got a pulse with that.
Yeah, I agree. We've got a pulse.
Brilliant, good news.
Get off the scoop. She's had 8 milligrams of adrenaline in total. She's had nothing with us. She had an output on arrival here, but she did have an episode of VT. Yeah, but with pulse still. I suspect as the adrenaline wears off, it's all going to wear off. And so I just want to have a chat to the family now before we get to that point. Where's Malcolm?
No output.
No output. Restart CPR.
Will be in 4.
I think there are days when what happens will bring tears to your eyes. You're faced with people who are having life-changing or life-ending events every day, and on some level it must make you appreciate what you've got, what you're capable of doing. And so, you know, I think you're mad if you don't take the opportunities that are presented to you to enjoy life while you've got it, because unfortunately, one day you can be crossing the road and it can all be over. I think the adrenaline.
I think it's adrenaline. It's an adrenaline-dependent rhythm, isn't it?
Hey? Yeah, exactly. So the adrenaline wears off.
And she's got a pH of 6.9. It's not going to be salvageable.
No. So we'll just press on until you come back. I've had instances where I will go and get the family, and essentially it's the point at which you've realised it is futile and there's, you know, it's a non-recoverable situation. And then the family gets to be there when she, I guess, officially passes away. And the heart stops, and that can be quite comforting for people.
The majority of patients who have heart attacks away from hospital do not survive.
It is very emotionally draining to have to break that kind of news to people, and to be witness to that last moment that loved ones have together. How was the son?
Oh, good. He was emotional.
And talking to the family is the hard bit, and getting them on board.
Yeah, I don't mind breaking bad news, actually. Because I think if it goes okay, it's good. At the end of the day, it has to be done.
And we've all seen people who do it badly, and I don't think I'm a world leader at breaking bad news, but I think I'm definitely in the fair to middling ground. And I've seen some people who are shocking at it, so I think I'm better than that. In some ways that's harder for the family, I think, if they get something back. To think, oh, bless, poor thing. It's not how he thought his night was going to go.
No.
Mind you, I'm quite happy with the idea of, you know, just going like that. If people are jumping up and down my chest when I'm dead, not bothered.
So I explained to her, I said it was very quick, whatever it was. Don't think she felt anything.
As long as there's nothing heroic done to bring me back to some vegetative state.
Tell Dr. Teresa to see any patient, please.
Oh, God. Okay. All right, well, thank you, Malcolm. I'm sorry you had to stay so long.
No, thank you very much. I'm more than happy to stay, as you know.
Talks are coming your way.
Coming back tomorrow, you know.
I'll go and see what that patient is.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
When you work at King's, you see everything.
2 stab wounds to the legs, small one on the left, big one on the right.
I witness more violence here than I do in Jamaica.
No trouble in here, do you hear me? It's a hospital.
It is a dangerous environment. It is.
Do you think... Listen to me! All right, it's a hospital, for Christ's sake.
You don't have to watch the television to see what's going on in Britain. Right here at King's, it takes place right before your eyes.
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Try to call them a bit, 20 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Camino.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Is that Facebook?
Yeah.
Oh, I'm going to check in at King's Hospital.
Nearly 3 million people come to A&E each year after accidents in the home.
All right, now what we need to do is just take both arms above your head.
The most common body part to be injured is the finger or thumb.
Singe, I will be able to use my finger, won't I?
I'm sure.
Do you know, I did tell you what happened to Odette, didn't I?
What?
She blended her finger away. Did I not tell you that?
I think you did, and I think I had that same
Baby
reaction.
brain. So she was cleaning around the inside.
Baby brain?
Yeah, because she just had 2 children, baby
Oh,
brain.
right,
It's
okay.
like a real phenomenon. Yeah, you haven't got enough brain cells just fuck off and deplete once you have birth,
Really?
once you give birth. There was a bit of food left on the inside of the blender, so she just cleaned away her finger and it was still on and she switched it on. So if she can get over that...
Yeah.
Hello, Jack speaking. Yeah, not bad. They say I've basically damaged my spleen, so I'm in hospital at the moment.
Hello, King's College A&E. Thanks, bye-bye.
Stroke team to resus, 20 minutes, please.
89-year-old Peggy is unconscious after a suspected stroke. King's is a specialist stroke centre, treating on average 3 stroke patients every day.
A stroke means a blood vessel supplying a part of the brain gets blocked. As a result, that part of the brain loses its function.
Okay, so Malcolm, what's the chest like?
She's got some crackers on the right base, but otherwise you've got bilateral air entry.
It can cause a severe disability, and if it affects a big blood vessel, it can also kill.
3. Pupils are 2 millimetres not reacting. Not making even the slightest response to pain. Suction, please. Wherever Tim's put it. That's it, lovely. Thank you. Hello, Tim. How's it going? Yeah, lady had all the symptoms of a stroke earlier on, but fitted in the ambulance, not maintaining her air on arrival, put a Goodell in, breathing rather slowly, around 6 to 8 per minute, not particularly adequate breathing either. Yeah, pupils are fixed but very small.
Yep. She hadn't been very well for a long time. We've had various troubles, and so it was not really unexpected. Of course, it's probably about the 3rd time she'd been into hospital.
What we're going to have to do, which is probably going to have to be achieved for scan, because she's not really reacting at all.
One of the worst things, though, when she said to me, "I'm dying," she knew that she was going.
So you Peggy's husband?
Yes.
My name is Malcolm. I'm one of the A&E doctors. This is Leanne, is our sister here. My colleague, my consultant is just with...
not very good.
OK. My consultant is just with your wife at the moment.
Yes.
And we just wanted to come and find out a little bit more about what had happened to her this morning. Is that OK?
Yes.
So what happened this morning?
Well, this morning, you see, we got a routine. I get up about 9 o'clock, I go in to wake her up, then I go down and do the breakfast.
Mm-hmm.
Well, I go in this morning and she's slumped
yes.
over the side of the bed. Couldn't do anything with her, so we phoned the doctor said phone the ambulance, and that was it.
OK. Was she responsive to you? Was she talking to you this morning?
Inaudible.
Right.
She was mumbling, I don't want to go, I fear he's coming back in the hospital.
OK.
I don't want to go.
Obviously, your wife is quite unwell at the moment.
Yes.
OK. She's not really responding to us.
No.
What we want to do is take her to the CT scan and do a scan of her head.
Yes.
OK. We want to see whether or not anything has happened inside
yes.
to make her so drowsy.
Yeah. Mm-hmm.
OK. She is very unwell, and I don't want to give you a false impression. I hope you don't mind, sir.
No. We realise that. We're both of us will pass our sell-by date. There's no doubt about that. It's got to come sometime.
OK. Well, we're going to do a scan of the head, OK? We'll see what's going on, OK? And obviously we'll get you through to see her as soon as we can, sir.
Yeah.
OK?
Yes, thank you.
Working in an emergency department changes your views on life and death. You can realise how fragile things are. We know that not everybody can be saved or can be helped. And we give it a good go, but we can't always help everybody.
Jonathan Goodall. Ooh.
No, we just hop along.
Doing a good kangaroo impression there.
Like everyone else is being seen before us.
Well, in a way, that's probably a good thing in that it proves that yours probably isn't that serious.
Sally has sliced her finger opening a jar. Her husband is away for work, so she's called on ex-boyfriend Ben for support.
See you again.
No, you're not.
What?
You're not even thinking about it.
Why did
I
not tell you?
I said, have you had sex? You sound in a good mood. And you said no. You dirty little bugger.
It was quite good.
What makes her good?
It's just a bit dirty, really. Quite fun and bad. But she's quite annoying, so I think...
She's quite annoying?
Yeah.
The propensity for men to put up with annoyingness for good sex is what most marriages are based on.
Charlie Brown? I say, how the fucking laugh, and ain't Charlie Brown? That's not a real name.
60-year-old cabbie Charlie Brown has been brought into King's by his daughter-in-law Zena and his sister Pat.
Can I have a receptionist Teresa to book in a new patient, please? Thank you.
This is his second visit to A&E after crashing his cab earlier in the week. He's been feeling confused ever since.
Can you tell me what happened again, sir?
I was involved in a car accident on Tuesday.
Okay.
I'm a black cab driver.
Right. So what happened exactly?
What actually happened was Saturday evening, it was raining quite hard.
Tuesday night, Charlie.
Tuesday night it was raining quite hard.
Yeah.
What I've been told since the accident, and not the evening that it happened, when the fire brigade come, was my cab went into a crash barrier on the side of the road, got jolted forward, and the ambulance crew told me what I actually had done was what you classify as I had bullseyed my head on the window screen.
Yep. Charlie Brown had been a taxi driver for many, many years and was very experienced in driving. No one quite sort of worked out why he crashed his taxi.
Did they take you to the hospital that time?
Yeah, straight here.
In here?
Straight.
Oh, okay. Doctor won't be long.
Oh, right, no problem, no problem.
Normally when someone has a trauma, crashes a car, they got aches and pains, but they're back to their usual selves. But Mr. Brown went home and was confused.
We didn't know what was wrong with him. We just knew that he wasn't Charlie as we knew Charlie before his accident. We didn't know what was going on in his head or what was going on in his body. We just don't know.
Sally is still waiting with her ex-boyfriend, Ben.
Oh, I've got a mint. These are from Thailand.
I need a wee.
Okay, I can't help you with that.
No, but you might have to.
Oh, God. Do I really need to? Can you do
No, I just want you to see my front bottom fall last time.
I've seen you having a wee before.
I used to go out with Ben when we were at college together. He was a shy teenager. Back then, he was really grateful to meet someone friendly and outgoing, and very over-generously, he credits me with his awakening. Oh, I really need to go to the toilet.
Do you generally need some help?
I really am not going to ask you to help me go to the toilet. I'll just have to do it all one-handed.
And can you...
It's just because I've got tights on, it's just a bit of a faff.
Yeah.
I guess she was the dominant one. yeah, she was, definitely. I mean, there's no doubt about it. I certainly wasn't her first boyfriend, so she'd had a more varied and fun youth than I'd had.
He did admit that he wasn't exactly worldly wise when he met you.
Oh my goodness me. No, Ben was very naive when I met him. Yeah, I think he was very pleased to meet me. Oh, I'm feeling a bit sick.
What, after that chocolate? Is there anything I can get you that would make you feel better? Like food-wise or drink-wise? Or... a little hug?
I just feel a bit nervous in my tummy.
Yeah.
Like butterflies.
Awesome.
Like the sort of butterflies that make you want to do a poo.
Really?
But look, you've run up.
Sorry, just leave my child in the middle of recess. Hiya.
You are?
Daughter-in-law.
Okay, so I didn't get your name.
Zena.
Zena, very nice to meet you. My name is Tian, one of the A&E doctors.
Good morning, Olga.
I know a little about you. I know that you were in a car accident. What's happened since then?
My coordination seems to be going funny.
He's got no coordination whatsoever. Like he does smoke, so trying to get a cigarette out of the packet, he couldn't.
I was having problems.
He can't get himself dressed. He can, but the clothes are around the wrong way.
Yeah, well,
he tries to read the paper upside down. Charlie doesn't really talk a lot, but now we can't show him up. But the things that he talks about aren't right.
They are right in what I think.
They're right in what he thinks, but the things that he's going on about, like, he thought my dog was a horse.
Oh, no, that's a joke, though, that is, isn't it?
Even today, I took him for a walk around our little block, me, him and the baby, and...
I tried to go in the wrong street door.
Yeah.
Instead of my own, I was trying to go in the next door.
Do you guys live together?
No, I live opposite.
Opposite.
So you kept a close eye on him?
Yeah.
How's your vision been since you've been at home?
Tell the truth.
Have you been able to read things clearly, watch TV clearly, see things clearly?
Well, not as it's... Not 100%, I wouldn't say, no.
Okay. I'm now going to get you to take your finger
Yeah?
and point to your nose.
Yep.
Then point to my finger. Touch it. And then to your nose. Back again. And again.
I'm just going to take the right side.
All right, mate.
Keep on doing that. To my finger, sir. Okay, keep on doing that. Okay. Look at me, sir.
Yes, sir.
Tell me which finger I'm moving, okay?
Right. Right.
I can remember thinking this is quite interesting, but I quickly worked out that it was something neurological, meaning something maybe wrong with his brain. And the things that we worry about after trauma is if there's been a tear in the lining around the brain, which causes bleeding. I'll have a look at the blood results, see what we've done. I'll come back up and chat with you. Is that okay?
Thanks. Sit back then, mate.
Right.
All right, mate? Just
Yep.
going to make sure the baby's all right.
Yeah, of course.
Just waiting. But his left side, he can't see out this eye. No. When he stood there and done this to him, he's saying that the right side, like his right side is going, but there's nothing on the left, and he was moving that. I've got a feeling he's got brain damage in his left side.
What's your speciality?
Well, I'm a member of the black cabin fraternity.
What's that?
I've done the knowledge of London.
Okay. Yeah.
Become a black cab driver. But in my
I'll do your job next.
yeah, I wouldn't mind that at all, young lady. Especially if you've got a young family. Becoming a black cab driver is an absolutely brilliant job for a person like you.
As long as I can have a sat nav with me.
Once you've done the knowledge, young lady, they say all cab drivers
I've got a sat nav up there.
are like a donkey, they never forget.
I'll forget everything.
No, you won't, young
I'll
lady,
get to your
believe
job
you
next.
me. But I must admit, although I'm saying that to you now, young lady, our job recently has been made a lot harder in the fact of trying to make a living, because there is more and more private firms, and they are taking our work away from us. And they don't. And the only way that they know how to get from A to B is by using a sat nav. They haven't got the knowledge what a London driver's got.
if the patient is aware of what is going on, it causes huge emotional impact. Yes, it is terrifying. It is like heart attack. It's a brain attack.
Derek is waiting for the results of his wife Peggy's brain scan. Despite Peggy's symptoms, her scan is inconclusive. There's no sign of dark patches, which would suggest bleeding on her brain.
So we took her off for a CT of her head. There's no obvious blood or anything on the CT, which I was suspecting in the first instance. I can't see any areas of obvious infarct on there. But the fact is she's still within a sort of 3-hour period at the moment. Have you guys felt anything should be done?
No.
No.
If it is clear-cut 3 seizures and CT doesn't show anything major.
Tim?
Yeah.
Just had a chat with the stroke guys. They don't want to do anything, so I think we should wake her up.
Okay, yeah, let's see.
And see how we go. I'm going to have a quick chat with her husband as well and explain to him what's going on here.
Yeah, go for it.
Go from there. Hi, Mr. Pearce. My name is Dr. Tunnicliffe. I'm one of the consultants here.
Yeah.
As you know, we popped a tube in her just to keep her sedated and sort her breathing out while we did a scan.
Yeah.
And the results of the scan are quite pleasing.
Mm-hmm.
Okay. There's no obvious major bleeding there, which we were concerned about. And there's no obvious treatable stroke there that we can see. Sometimes we can treat strokes by giving a medication. But there's nothing there that obviously needs treating at the moment. Now, that doesn't mean to say she's not had a stroke. She may still have had a stroke.
Yes.
Okay. But what we're now going to do, we're now going to wake her up, okay, get her nice and awake again, and then we can reassess her again with her nice and awake and see what we need to do.
You've got any chest pain at the moment?
Peggy?
You know to let us know if it comes
Peggy?
back.
Are you all right? Open your eyes for us. Peggy? Peggy? Peggy, can you squeeze my fingers for me? Squeeze them tightly. What we're going to do is take this tube out of your mouth. We're going to replace it with an oxygen mask. Your husband's outside. Sorry, there you go.
She's woken up.
Oh, wow. She's going to pop an oxygen mask on your face, Peggy. Grippy. Is she? Good. It's not, I mean, it's not really strong, but she's certainly grippy. She's got a life pack out here.
I need to move this man back on the bed. He's really quite heavy.
Right, just lay down for us for 2 seconds.
Right. Ready, steady. Right, sit yourself up, Patrick.
That would be that cannula.
Try and move yourself back. That's it. You're doing really well.
Oh, yeah.
You are. That's it. Just move back a little bit.
After 4 hours in resus, Peggy's stable but still hasn't come round.
She's had a bit of trouble with this before, but Peggy's always been cured, shall we say, and come out for another year of being fit again. Yeah, it's always hard, but of course you never know what's going to happen. You're in the lap of the gods to know what's going to happen next.
That's two.
Quick.
Yeah. I thought you was longer than that, Dan.
Charlie Brown's also had a brain scan to find out the source of his confusion.
That was quick.
Yeah.
Did they say anything when they'd done it?
The doctor's going to come back and
Is this his dad?
explain all the reports to me.
Hello there, my name is Tian, A&E S01 in Kings. Can I discuss the patient with you, please? It's Charlie Brown, a 60-year-old gentleman who's a cab driver traveling 20-30 miles an hour. Hit a railing, bullseye to the windscreen. On head CT, he's got a bleed on his right. Looks like subdural. Do you want the hospital number to have a look at the CT?
You got a key, sir?
Yeah, thank you very much for seeing him. Okay, thank you.
Blimey, that's massive, huh? Huh? He's walking around like that?
Yeah, he doesn't know yet.
Pretty impressive, huh? I mean, that he hasn't shown stronger symptoms than...
He has got very strong symptoms.
Yeah, but he's walking, isn't he?
Did a show. Oh gosh.
Images to X-ray, please. Thank you.
Wow.
Yeah.
Gosh, that's not well. At least you know. Does the family know yet?
No, I'm told.
Okay. Do you want to just tell them because they've been kind of looking at the scans over your shoulder?
I could see it from where we was. The left side was just black. And that's when you just know that there's a problem. It should all be grey, not black and grey.
We had a look at your scan, and you've got an area that's slightly abnormal on the right-hand side,
Right.
in your brain. We're not quite sure what it is at the moment.
Right.
We need one of the radiologists to have a look at it.
Right.
But initially, it looks like that you've got some loss of brain there. The cause of which is slightly uncertain at the moment. But I just thought I'd come and tell you what's happened so far. Okay.
But what sort of things put problems like that back together again?
In other words, how can you fix it?
How can you fix it?
We can't, depending on, the problem is we're not quite sure what it is at the moment. So once we know, we'll discuss with the relevant doctors regarding how we can help you. Yeah, so we're sorry about the lack of
That's not a problem.
clarity at the moment, but we'll try and sort things out and come and talk to you as soon as we know.
Lovely.
Okay?
Yeah.
I'll be around.
You all right, Charlie?
Yeah, I'm fine.
Pat, will you just watch over me? Hello?
Zena phones Charlie's wife Patsy to update her.
Right, his brain scan's back. On his right side of his brain, there's something severely abnormal. They don't know. The way that the doctors just described it to us is that there's a part of it missing. Yeah.
This was the first time Charlie had ever been ill. Nothing had ever happened to Charlie other than an ulcer. And Charlie always said he was invincible. Nothing was ever going to happen to Charlie.
I just want you to focus on you for now, right? I know it's hard, but please just focus on you. All right, I don't need you fucking going down and all.
I got this cancer, keratosis, and Bowen's disease. Charlie's accident was on the 26th. On the 25th, I got told, this is terminal.
You just stay there, and I'll ring you as soon as I know anything.
Zena was with me on that Monday when I got that news. And it was a lot for that kid to take on. And I think Zena absorbed it more than I did.
But love ya. Bye. 1 minute, everything's fine. Family's all running smoothly. And then bang. You get told that the most precious people in a family, there's something wrong with the pair of them.
My leg. It's hurting, brother, man. Hope everything's all right.
Why do you support Liverpool, cuz? Nah, do you know what, yeah? Because I'm a guy, I don't know shit about football. I fucking hate football. I hate the amount of money they're making. I hate football, cuz. But obviously, yeah, you know, like when everyone's back in the days going, yeah, I support Man U, rare tear tear. And when I went to school, bare people wanted to support Arsenal because they were sponsored by Nike. I was just like, fuck that. I'm gonna be versatile. I'm gonna just do whatever, do the opposite of what everyone's doing. If everyone's supporting,
then you pick the rubbishest team.
Fam, I was with Liverpool from day, fam.
I'm with Manchester United from day.
Glory hunter, fam.
You me?
Yeah.
How can I be a glory hunter? That's the only team I've ever supported.
Told man, Liverpool's the one.
Liverpool's rubbish, bro. Where are they now? Third from the bottom.
I don't know what bottoms, fam. I just know because I support Liverpool. Though you can't tell me about what players play. All I know is Matt Manneman. That is He's been playing for Liverpool for years.
Sally Cullen, please.
Oh, that's me. Thanks. Is it all right if my friend comes? Of course. Thanks.
How did you do it?
I was getting a rubber stopper out of a Kilner jar, and I was like, you know, you build up quite an amount of pressure trying to get something out, and then as it came out, it cut through my knuckle.
Okay.
And also I've been frightened to bend it in case blood squirts out of it.
Okay. Well, have a seat on this blue chair here. Have a look. Okay. All right.
Yeah, I'm just a bit squeamish, sorry.
As long as you're moving a finger
Yeah, that's a good sign, isn't it?
and you can feel me touching the
Yes,
end of
and
your
I can.
finger,
Yeah, I can.
then we're happy, really.
Oh, right, good. That's reassuring.
What happened to you and Ben in the end? Why did it not last?
I don't know. You'll have to ask him. He dumped me. No. He did dump me, but rightly so, because we were very young and he wanted to just go off and experience a bit of the world. Other women. Dr. Magic with his magic liquid. And he doesn't need to stitch me up, he's just going to give it a magic kiss better. Well, this has ruined my plans for becoming a hand model.
I've got another one.
Thank you so much.
Pleasure.
Gorgeous! Oh my God, he was amazingly sexy.
Auntie Pat's going to give it a shot. Mummy needs to make some phone calls. When I spoke to Patsy's sister, and that was when it hit home that it was real, that something was seriously wrong and what was going to happen to us all. Right, he's had a CT scan. His right side of the brain, he's got a part missing. And that's what the doctor's just told us. He's got a bit of his right side of his brain missing. Fuck knows. And I keep laughing in shock. I don't know. Poor Pat, she's laughing with me. Pat, what does it mean?
What's happened to Grandad?
Pat, where's it gone?
Well, I don't know where he's lost it. One of the passengers
I
just took
don't
it.
know then. And we're waiting for brain
Grandad.
surgeons to assess his thing. I don't. I just keep thinking, what if I do next? If resource, I took him straight back through to resource. And that's where they want him. Fucking machines keep going off, it's horrible. Just to see him laying there. And the way he keeps talking. Guess what? I hurt. As you'll know, doctor, they call it when a patient bullseyes, and he's talking so posh, and then 1 minute he's talking like that, the next minute he turns around to me and he goes, "You all right, cock?" You know, I know this sounds really horrible, but I just keep thinking, how am I going to cope with her having treatment, him being like this, looking after a baby? I can't do it all, Anne. But I don't want to let him down. But I can't let him down for everything they've done for me. I can't.
Oh, my leg. Oh, money me, cuz.
Yeah, let me put you in this, John.
Right, got a views, mate, because the brakes are on.
Yeah, thank you, boss.
All right.
Let's go down there and see what go.
Slow down,
right,
look.
boss, yeah? You okay, yeah? Nice.
Begging it, fam. Are you still begging it like blam? Blam. 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 Blam.
I had a check with you, see?
Hey, mate.
Doctor said.
Hey, no, not yet. Not yet, mate.
2.5 hours after arriving in resus, Charlie and his family are waiting for a diagnosis.
You try to think that they're just going to come in and tell you that everything's all right and that they've made a mistake. You don't think that they're going to come in and tell you bad news.
The CT hedge, as you probably have got up already, shows an area of right-sided low attenuation, which is not there on Tuesday. I've spoken to the neurosurgeon, Mr. Koch.
Hello, Mabel. Rosy red cheeks.
She's been screaming.
Oh, not them TVs again, is it? What do you think? This little piggy go market. This little piggy stay at home. This little piggy run all the way home. Wee, wee, wee. Yeah?
Okay, thank you very much. Bye. You want to come have a word with me? Mr. Brown, so we have discussed your results with various specialists.
Right.
And we think you've had a stroke on the right-hand side.
A what?
A stroke.
Yeah.
Do you know what a stroke is?
His wife's had 15.
Yeah, 15 of them. So what fixes it?
Actually, the damage has already occurred, so we wouldn't do anything acutely.
So he's going to have to stay in. You're in the best place.
It's a pretty bit of a shock to you. So do you have any questions at this moment?
Is that going to stop me continuing my career?
Symptoms will improve with time as your brain adjusts to what's happened.
Fine.
Okay.
Yeah.
Sorry. Is that, you know when you've done this with your hands, is
Yeah.
that why he didn't pick this one up?
Yeah, that's why.
You'll be all right.
But when they say stroke, is it as bad as it sounds it is?
Strokes affect different people in different ways. It's a broad spectrum of things.
Right.
While he's answering questions, you're all right with him, yeah?
As you say, some people are affected where they come from one side.
Doctor's just been round. He's had a stroke. Yeah.
Thanks very much, and thanks for all what you've done.
Okay, thank you, sir. I wish you the best.
Oh, nice to meet you.
And you, sir.
I was relieved that I was alive. I couldn't face dying because I always think, if I'm not here, what are they going to do without me? Little old Charlie Brown.
Charlie's wife, Patsy, comes to see him in resus.
Whatever job Charlie's had, he's took to heart. He wants to take the world on. If something's not right, Charlie thinks he can fix it. And you can't get through to Charlie that you can't fix it. That's Charlie. Listen to me now, right? It's too dangerous for you to drive at the moment. Charlie, I know what I'm talking about, mate. You could get in that cab and it could happen to you again, and this time you won't come out of it.
But you've got to do what they say.
Look what's happened to me, Charlie. Do you think I like what's happened to me? But I've got to accept it. We've got to get our heads round it, mate.
It don't matter how many knocks you get. We can all get over it because we're all together. So we're all as one. And what more can I say?
What, mate?
What did I say to you?
What floor? Dunno.
Top floor, penthouse.
Yeah, you get a penthouse suite, yeah, mate.
No good penthouse this weather.
Get a telly, get a phone.
Sunset.
Oh, don't tell him that. He'll be on the phone in 5 minutes. Arseholes to you and all.
The only thing that harms me is me not being able to go to bloody work. Everybody's been saying to me, why don't I get a T-bar? And if I could put it on the rank where the drivers that I've been brought up with work, there couldn't be no better thing for me. And at the moment, it ain't hard to make a cup of tea. I can still do that, and a cup of coffee. And I might even throw in a cake.
I wanna be the big dudes. So.
Yeah, it looks like you've actually got a little crack on the bone in your leg.
Is it?
Yeah. Very small. It hasn't caused any of the fragments to move.
Yeah.
So it will heal very well with no deformity.
Yeah.
So don't walk on it for now because
Yeah.
you need to put cast on and then you need to use crutches.
Yeah.
Put any weight
Right,
on it.
thank you. Cuz man's got a crack in my leg. How about that?
Oh, these bitches. Oh,
Sonny, did you hear what my man said? Did you hear what my man said?
Something about a crack.
I got a crack in my leg up here, cuz. Madness, I'm upset for that. I'm upset for that. It's my right leg, you know. This is what I play football in that. Cuz I got a crack in my leg. Like, my leg feels a little bit pain, but it don't feel too... This one's hurting more than this one, bruv.
Baby.
At the side of the pram, at the side of the bed.
Oh, yeah. Oh, I've left it. He's going away with the doctor.
Oh, you've left the baby. Pat's come out and left the baby in fucking resus.
Oh, you pulled the baby out.
Oh, God.
She was a wonderful lady. She brought up 2 wonderful daughters. She knew what she was doing. She had a habit of losing things now and again, but apart from that, to me anyway, she was perfection. You do miss her very much, but I suppose that's the way life is. It happens to us all in the end. We've all got to go, and that's inevitable, especially when we're getting on a bit now.
Trauma red phone 6 minutes. Trauma red phone 6 minutes.
Used to be Saturday night's all right for fighting. It's obviously Thursday night's all right for stabbing.
Colin is in hospital and someone broke into the house and stabbed him. He's saying to me, basically, if I carry on cleaning my ears, I can kill myself because I'm pushing the infection into my brain, yeah?
So if I can just get you to pop your T-shirt off underneath there. Was he here when you took it off?
Yeah.
When you took your T-shirt off?
Yeah.
I'm going to end up hitting him.
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Try to call them a bit, 20 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Good morning, King's A&E.
Every day, 60,000 people in the UK visit A&E.
No, this one was stretched nice.
Right.
Terribly wrong.
I'll try my best to sort of just bring it together and close it up.
350 of them are treated here at King's.
You think they'd see me pretty quick, wouldn't you? Because obviously every time I move my eye, it's scratching a little bit more. It's more like it's not painful, it's more like irritating.
Yeah, like you are.
Do we have a portal, please, to near CT? Thank you.
Up to 140 staff work 24 hours a day. They're prepared for anything.
Just to test whether the battery was working. And so
the gun was loaded?
Yes.
And you didn't realise that the gun was loaded?
Yeah, there you go.
People coming in with their coughs, colds, a cut on their end of their finger, to the extreme of people being thrown out of cars in the ambulance bay who've been shot.
Man with nail in hands.
It's not a fetish having injured people coming through the door. Well, for whatever reason, you still get a buzz from hearing the words gunshot wound. It just sounds sexy.
Just take some deep breaths for me. Say 99 for me.
99.
And again.
45.
And again.
99.
All those people that have chopped off limbs, digits, the people that have fallen over and dislocated their shoulders, I salute you. Thank you so much for making my job enjoyable.
Have you got glass in there?
Probably. That's coming through a lot more. I wasn't there about a minute ago.
I thought, oh my God, my son's going to lose his hand, or he's going to bleed to death, or things you put me through. God, he put me through earlier with the police, and then this. I mean, what are you trying to do?
All right, well, the police thing's kind of died out.
Yeah, no, I know. But
you know when my 5 months are done, my record's clean again. It gets wiped off. The yacht people told me that.
You've got lovely ears.
I do.
Hasn't he? He has. He's got really nice ears. No, he hasn't. You've got real... That's you.
That's about time.
19-year-old Alex Ford is being seen in minors, where non-life-threatening injuries are treated.
All right, my name's Kim. I'm one of the emergency nurse practitioners. So, what happened today?
I just got a bit angry and put my hand through double glazing.
I'll just stand over here, mind my own beeswax.
Oh, good one.
Special. Oh, no, I can look at it.
That we're going to have to stitch.
Yeah.
Tess?
Do you like that one, Mum?
No.
That one was Hollywood for you, yeah?
No.
Do you know what it looks like, Mum? Do you know when the zombie bites into your hand?
Yeah, it's all right, yeah. Oh, God.
What I'm going to do, I'm going to send you round to X-ray.
Yeah.
We'll have a look, see if there's any glass in it, and that one up here is going to be stitched.
Yeah. It felt quite good, actually. Now, that sounds bad, but when I did it, it was like an achievement. Like, I've just broke a window. Yes, with my hand. It's double glazing. Wow.
I think I might be stuck in the suture room for about 2 weeks trying to sew this bloke's hand up. Nice great big laceration on the hypothenar, on the thenar eminence, right down here.
Lovely.
That's what you get when you lose your temper at 17 and put your hand through a glass door.
Yep, right.
They think that we can just put them back together brand new and that they're invincible. Can't be doing that too often, I hope. That we've got spare parts in the drawer. And we just, you know, a bit like Meccano set.
I was going to stay. I was just going to stay at home in bed with the curtains drawn and just sleep it off. But obviously, I ain't going to sleep off a bit of metal stuck in my eye, am I?
Could Dr. Robbie contact him on 2405?
I know my eye hurts, but do you get feeling in your eye? Has it got nerves like your fingers?
No, I don't think it has.
Like there, do you know what I mean? It's not really, you can feel it, but not really.
No, but when they pop your eye out and it's hanging down, yeah.
Shut up.
So that's what they do, seriously.
Yeah.
It makes your legs go like that, straight away, like that. That's why they put you in a chair, you're clamped in, they pop it out with like a silver spoon thing, and it's hanging here on a bit of tissue, yeah? Like that. And then they fiddle with it and do whatever they need to.
No.
Yes, they do.
Not my eye, they're not.
Well, what we see.
So when they take your eye out, what is behind it? What's behind your eye?
It's a lot of nerve things, isn't it? I don't know, 3 tendons, isn't it?
Yeah, but what is that bit there? What is behind it? Is it like skin?
No, it's just hard, isn't it? It's flesh. When they pop that out.
Disgusting, man.
What have you done? Click the wrong patient off.
Yeah. Yeah, the patient I'm about to see. And it's me. Guess what I've done? I've just discharged a patient I've not seen yet. Yeah, it will, won't it? Thanks a lot. Bye. Ah, you see, this is what happens when you make me get up in the morning to come to work.
What do you want to be?
What do I want to be? A legend.
No, what do you want to
That's
be?
it. I just want to be remembered. Is that a problem? You're not listening. It's the easiest. It's a job. Without no one really, I want to be remembered. Like
Jesus.
no. Yeah, but I want to be remembered. Like I don't want to be a nobody. I want to be a somebody. Like Achilles.
My little baby. My little baby. Your mummy's baby. Don't grow up.
I have to.
Don't grow up. Be mummy's baby forever.
Sorry, Mum.
Oh, that's all right.
I ain't
Just got to calm down. My little boy's growing up too fast. Does your mum and dad?
Do you know what you can get me for Christmas? Do you know what you can get me for Christmas? A punching bag. Because you know that'll be the best thing for me when I get angry. Just go and work it out. Because
I was going to get you something really nice for Christmas.
What a punching bag will do.
Don't be silly.
Anyone. Just tell anyone in the family. Get Alex a little small punching bag.
He's always had what he wanted, this one.
I have. I'll give them that.
If he wanted a flat screen telly, he got one.
Think about it back in the day.
A console, he got it.
Right, OK. I'm going to give it a good irrigation, a good clean out. We have to develop relationships very quickly because we're about to do some horrible things to you. We're about to hurt you, basically, and it's legal.
Can I hold my hand?
Yeah.
He puts his hand through a glass window, then he needs somebody to hold his hand while he has an injection. Sorry, darling. Sorry.
I've just got a vision of Drogba scoring against Arsenal for some reason, and that really hurts.
You're doing well. You've certainly done a good job on this, Alex.
I know. I probably won't ever hit anything ever again.
It might be a good idea, actually.
I'm just going to be some peacemaker now.
Yeah.
I'm going to go around the streets of Brixton preaching. Sorry.
It's very, very deep. This may be a bit too much for us to do. We may have to send you...
I didn't even hit it that hard. I swear to God I didn't.
Well, sometimes you don't. It's just the way you hit it, isn't it?
It was the angle, yeah.
Yeah, it was definitely.
It's like I did a martial arts move.
Sorry, Alex. I'm sorry. I know that I'm hurting them, but I need to do it, and I'm always saying, I'm sorry, and I'm sure they don't believe me, and they're probably right not to.
I can remember being 17, 18 and thinking that I could do absolutely anything and nothing would happen to me. You know, that's just being a kid.
Right, we're going to have to hand you over to the orthopaedic doctors.
Oh, I used to take risks, do stupid things like walk the other side of bridges and just ridiculous behaviour. Drive my car really fast. I had my Mini up on 2 wheels, round a roundabout. Oh, fucking crazy.
I'm such a moron. I won't be smashing anything ever again, though, because anytime I get angry and I just look at it and, yeah. There's been times since where I've got angry and you know what the reminder is? I can't even clench my fist. That's the reminder. Like, I can't even, it hurts doing that, so I just, yeah. And I know the reason is that, the reason why I can't clench my fist is because I got angry in the first place, so yeah.
Hello, King's A&E.
The red phone.
Yeah.
A direct line from the ambulance service to the emergency department. When it rings, it signals the imminent arrival of a seriously ill patient.
All right, thank you. Bye. Oh, how many minutes did they say? It's about 5 or 6 minutes. Adult red phone in 5 minutes.
Adult trauma red phone 3 minutes.
Of the 100 patients brought here by ambulance each day, on average, 10 of them are victims of road accidents.
Good morning, everybody. This
This is Brendan. Brendan is 31 years old and a motorcyclist. He's ridden head-on into a motor car. He's bullseyed the windscreen, has gone into the tank of his motorcycle complaining of groin pain. His injuries seem to be isolated to bilateral fractures of the wrists, and he has an injury to his right testicle. His scrotum is discoloured. He complains more pain in the right testicle than the left testicle. Nothing else for you. Thank you very much.
They're in a completely alien environment. One minute they're riding their motorbike or something, the next minute there they are strapped down to a bed, lying stark naked with about 8 people around them with some strange man putting their finger up their bottom.
Brendan, we need to put a drip in, but because you've broken both your wrists, or you might have, I'm going to put one in your ankle, so it's going to be quite uncomfortable, okay? Just to let you know.
Okay.
All right. No one mind just holding his ankle for a minute? This is going to really hurt. Sorry.
You know, and they're in pain and they've got no idea what's happening. All they can see is the ceiling. You know, they've got no idea what's going on, and it must be petrifying.
I'm from the waterworks side. Okay. Down below. The important Certainly, don't mind all this other stuff. We'll all fix, yeah. Right? Yeah. The consultant told me that you have an injury down below. How does it feel? It just felt like I've been heavily booted in the nuts. But I think it's just the right testicle was giving me a bit of Have you ever had any problems with your testicles before? No, not to my knowledge. Your fella's alright. Thanks. Thanks a lot, mate. No, you're welcome. It looked like a purple carrot, I can tell you that much. I thought it was touch and go at one stage, because a couple of days when I was on the ward, going to the toilet thinking, lifeless. There's not a lot going on down there, and not even the nurses can help me out in that respect, and it's lifeless. I'm like, okay, well, hopefully when I get back home, might see some signs of improvement. But it was black and blue for a couple of weeks. Food trolley. I do have.
Alice has brought her sister Pat into A&E after a fall on a shopping trip.
Cheese and pickle there, egg and cress, savoury cheese. Savoury cheese is quite nice.
Give it a try.
You wanna give it a try? And you're entitled to have a drink and a crisp with it for $3.49 as a meal deal.
He had them on that trolley.
Did they sandwiches?
Yeah, he did. He said sandwiches.
Well, I see biscuits, I never see it.
No, the sandwiches I think were on the top. He did say sandwiches. Yeah, he did say it.
Food trolley.
But you don't know when they were made. They could have been last week's. I was looking forward to me fish and chips. But there you go.
I didn't know what to have today. I'm going to have a sandwich. I bet it's 1 o'clock, isn't it?
I don't know, I ain't got a watch.
Time here
is 1:15, nearly
1:15.
1:10. Thank you.
Mine just then he said, would you want to have that money? It's too much. She went, you wouldn't live to spend it. She went, if I won $1 million there, that would see me through.
Yeah, but they've both got families, don't they, that they can leave it to?
Yeah.
That's the good part.
Yeah,
and they
but
could go fast just like that.
Why should I have to leave it to them?
I mean, look at Gordon Ramsay. He's gone skint nearly. He's relied on Peter Jones for
He's
help.
only going to Peter Jones.
Yeah, that's what I say, with all his money.
Oh,
so
yes,
you can
ma'am.
go bust.
I wouldn't stick with him. I mean, this horrible man, effing all the time. Every word is there.
Patricia Powell. You're right.
Can I come
Can you
in
hold
with
that bag for me?
Yeah. What you got in here? Bomb?
Dr. Aisha, come to me, just please. Can Dr. Aisha come to me, just?
Have you been a smoker in the past?
Yes, up until yesterday last time.
Up until yesterday, okay. Have you been smoking for a long time?
Oh, say really that long. That late 70s.
Okay, and how many a day?
Well, John keeps it down to 20.
It drives me nuts that people don't look after their health. There's only so much that we can do as doctors. We're not magicians.
Do you smoke quite a lot then? Breathe in and out through your mouth for me. That's it. Can you do it again? Good, and keep going. What are you playing?
Sonic. I wanted brain training, but Leanne took it out and I can't find it.
This is the 35th time Lynn Brackley's been to hospital this year. Today, she's been brought in by her son Lee after collapsing with stomach pains.
Do you want a drink?
Linda Brackley. Hi. How are you feeling? Are you in a lot of pain? Do you need something for the pain?
Mm-hmm.
Okay.
I've been asking for ages.
Sure. Can you tell me a bit about the pain? I'll assess your pain and I'll write something.
I was in 5 weeks ago.
Right.
Yeah, Mr. Patel took out my gallbladder.
Right.
I'll be truthful with you, I've had enough of being in pain.
Right.
Do you know what I mean? I've had enough.
Okay. I'm sorry about that, but we'll try and do something for you today.
Thank you.
Okay. And how are you coping at home?
I'm not. At the weekend, the pain was that bad that I really felt like doing something stupid. I did, because I've had...
Like what?
I haven't got to say it, have I?
Yeah.
I haven't got to say it, it's just...
No, I just want to know...
What, how I'm feeling?
No. If you thought of something...
Yeah, I did think... Yeah, I did. Yeah, I did, because I've had enough.
Right. Okay.
Do you know what I mean? I thought that once the gallbladder come out, after having the gastric bypass, my life would be different, but it isn't. It is, because I've lost the weight, but it just seems to have opened up a can of worms, and I'm not dealing with the situation that good at the moment.
Have you had this thought before, or this is the first time you had
No,
it?
I've had it before. I have had it before.
And have you ever sort of...
Yes, I have done it before.
What have you done?
I have took an overdose before.
Okay. Just remind me why you had the bypass again?
Why? Because I was fat.
Okay, that's fine.
And I couldn't lose.
How fat were you?
I was 29 stone.
Okay, and now?
I am 15 stone 13.
So you're getting more and more thoughts of harming yourself recently, is that right?
Yeah, because of the pain.
Okay.
When you're fat, everything gets put down to your size. Yeah? And people don't actually look into the situation. It's, oh, there's nothing wrong with you. It's your size that's causing the problem. Like, big people have rights as well, you know.
Yeah, they surely do.
You know, but because you're big, they just discard that. But they can't do that no more, because I'm still big, yeah, but I'm not as big as what I was.
Yeah.
So they can't do that to me no more.
Sure.
So I'm not going to take that.
Okay, fine. I'm just tell me if it hurts a lot, I'll be gentle.
Fat people have rights as well. We have feelings just as much as skinny people or anything else. Do you know what I mean? If anything, fat people might have more feelings than skinny people, to be quite honest with you, because I think that fat people are more loving.
OK, what I'm going to do, I'm going to put an injection in your wrist here. That's going to numb it, and then I'm going to pull it and we're going to put a plaster on. Right. So I'll get one of my colleagues. It goes from here to here.
Oh, right.
X-rays show that 78-year-old Pat has broken her arm.
Nance, do you want somebody to help me pull?
Would you mind getting the plaster trolley for me?
I will.
If you're going to be my glamorous assistant. I have to batter her up.
Take that last time, please. Take that last time, thank you.
One of these days this is going to fall apart. I can see it's going to be on me.
I think she's all herself.
Yeah, she's not bothered.
Talking about me again?
No, darling, no. We can't die ever.
All right.
Yes, I'm trying to tell her some good news. Hang on. Tiger Woods.
Yeah.
Here's another one paid too much.
Dirty
dirty sausage, I mean. She likes Johnny Depp.
I love Johnny Depp.
I've got a photo of him just above my oven, so
when I'm
only the oven. I have. No, it's on my tie.
He is absolutely gorgeous, isn't he?
So that when I'm cooking, I've got a full eye view of him there.
Oh, you're going to get burnt one day looking at it.
I really don't care.
You're going to get all splash, come on.
I don't care. Men's going to look.
If he was in here now, she'd go through torture. She'd just look at
Oh dear, what you got to do is when I'm doing this, you've got to think of Johnny Depp.
I'd let him pull it without doing the needle.
Oh,
Love him.
He is gorgeous, isn't he?
How come I'm doing this, by the way?
Show him a glamorous assistant. Get on with it.
It's going up my nose and everywhere.
Think of yourself as Angelina Jolie.
That's right.
Oh, she's nice, Angelina.
No. I've gone off Angelina. No, since she stole Brad from Jennifer.
I'm not into Brad Pitt either.
Right. Claire, would you both like a cup of tea?
Oh, lovely. Could you? Have there any sandwiches in here?
Oh, I was going to get you a sandwich, wasn't I? I will get you a sandwich as soon as I've done this, I promise you. I will get you a sandwich. Yeah.
Oh,
yes,
yeah.
once we've done this.
I guess he's doing about 20-30, the car's doing about 20-30, and we hit each other head on pretty much. So I think he's just quite lucky that he's been thrown from the bike. And when he's thrown, he's just sort of thrown and landed. Yeah, and it's probably the best thing though. If he hadn't done that, he would have impacted the car and he would have a lot worse injuries.
It's 3 hours since Brendan Fox was first admitted. It's clear his injuries are non-life-threatening.
Does your job make you more aware of your own mortality and think about your own death and those that you love?
I think there's days where it does. There's definitely days where it does. Yeah.
I could be brown red, so it don't really matter about 2 broken wrists. That'll heal. No, all in. Yeah, you're thank lucky stars. Because had something been coming down the bus lane, i.e. a bus, could have been interesting.
Now that I'm married and I've got a baby on the way, I'm even more aware of it. And I'm even more aware of, actually, I might be dead in 10 years, let alone 40 years.
Very scary, was it? No, but I just think it's somebody trying to tell me something that there's only so many lives you've got.
How many have you used up?
Well, today, I reckon I've used a bloody good chunk of them, because, quite easily have been dead, so... Wasn't my time. So.
every day when you go out on the bike, there's always a nearly. You nearly got me. Got away with that one. And eventually, your luck runs out. You know, the odds are at some point you're going to get it, but how you escape or how you get away with it is it's all down to luck at the end of the day. Thank you very much, everybody, for your help. You've been out.
I'm coming, you haven't got rid of me yet.
Yeah.
Bye, thanks.
King's A&E. Hello. 2 minutes. Lovely. Cheers, bye. Red phone, 2 minutes. Red phone, 2 minutes.
Hello, Kings.
Adult trauma, red phone, 3 minutes.
This is George. Called us today with a bit of difficulty in breathing.
I love resus. It can be a bit stressful if we've got more than the 5 patients in there because we've only got 5 trolleys.
Okay, and how long? What? Head injury.
But it's a buzz. The adrenaline's amazing.
This is Alan. He's 50 years of age. Fell down about 7 carpeted stairs onto a carpeted floor.
I've never ever had a problem with the sight of blood. The crunch of bones when I'm putting fractures back to place, I think that's great. Even seeing someone's chest being opened in resus. It's not ideal, but it doesn't faze me. Great for me personally, not for them.
No, he can go. He can sit here.
That's what I was thinking.
This one's gonna go to X-ray. That he can move there, and then.
Yeah.
Yeah. If we get another trauma in the next 20 minutes, I'll be upset.
Absolute carnage. Right, how many red phones is this now? Because this is nearly getting close to my 15 in a bloody shift.
15, you reckon?
Yeah. I only did 11 the other day.
56-year-old Michael Brown crashed his van on the way home from work.
His chest on the steering wheel. He's got Parkinson's.
Okay.
His left side tremor is normal for him.
Yeah.
He says this is quite bad. It gets bad when he's stressed, which obviously he is.
stressed.
He's calmed down quite a lot, but it's just got bad again.
Okay. Michael, have you got any pain in your legs? Can you lift this leg up for me? Lift it up all the way. Cool. And this one? Lovely. Michael, my name's Firas. I'm one of the A&E consultants here. Okay. How are you doing?
I'm all right.
Yeah. You feeling quite anxious?
It's just my Parkinson's kicking.
I know. It's very easy for me to say try and relax, okay? But do try and relax as much as you can.
Yeah.
I'm not worried about you, let me put it that way, okay? Just because of what's happened and what symptoms you've got, I think we just need to be a little bit more cautious.
Yeah.
But I'm hoping that we'll get you up and out by this evening's end.
Okay, that's good. Thank you.
Well, I just thought I could have lost them. Could have been a lot different. That was basically the main thing that went through my head, you know. I could have lost them and he could have been a lot more seriously hurt. He's always been the strong one. He's always been there for me. It was just horrendous to see him like that. And I hope I never see him like that again.
Yeah. Look at him, is he crying? So why are you upsetting him, huh? Huh? Look at him, he's smiling. Please don't upset him, he's been doing fine. He was so brave until you guys came along. I'm not worried about him. It looks scary and freaky, okay? If I was worried, I would tell you. What we're gonna do, we're gonna x-ray there, we're gonna x-ray there and there and down there. If those x-rays are fine, we can give him back to you.
Well, good.
Is that a deal?
Yeah.
Okay.
to meet you.
How are we doing?
There.
Okay?
There.
That's it. What's the opposite, sir? Really well there, sir.
81-year-old George Rumsey lives with his great-nephew Jay.
Things a little bit, isn't it?
That's the oldest one I've ever read.
George has been brought to A&E with breathing difficulties.
Okay, that's all done, sir.
I'm going home now. Yeah, we have paperwork.
Thanks for coming up here.
Oh, that's all right. Don't let yourself get into a situation like that again. You know, you need to breathe to live. All right.
Well, it's about the fourth time I've been up here like this.
Right, they sort you out. Yeah, we'll do it.
Thanks very much. Thank you. Thank you, anyhow.
All right.
Funny, all the time I was sitting down, it was all right.
Yeah. He's just really down-to-earth bloke, really lovely, heart of gold. He'd do anything for you. 12. 5 to 12, yeah. Well, he treated me as his own son and always looked after me. We just used to go to banger racing and go down to the Donkey Man and just used to go on the donkeys and stroke them and things like that. Well, if anything, if you're here overnight, I'll bring something up for you tomorrow.
How do you want the bottom of the
Whenever I needed someone to talk to, he was always there, and I could go into him any time, really, night or day.
King's A&E. Okay. Thank you. 80-year-old cardiac arrest. Can I have a porter to resus with a striker trolley, and can I have an A&E doctor to resus immediately? Thank you. Okay, number 2, please. Number 2.
An elderly man has suffered a heart attack.
Just get some paddles on and see what we've got, okay?
Most patients who have a cardiac arrest away from hospital don't survive.
Anyone felt for a pulse?
Yeah, present. Pulse is present, yeah.
Okay.
We got a pulse.
Yeah, we've got sinus rhythm. I think we've lost rhythm.
I'm going to start CPR again.
Yeah. Sorry, where's the family?
If I ever get to the age of 85 and have a cardiac arrest, I do not want to be dragged to an emergency department with people pouncing on my chest, people putting tubes down my throats.
Right, okay. Somebody else do a pulse check, because I'm not going to be reliable.
What's the point? If a person dies in that circumstance, it's not dignified. I just want to die at home in peace.
After several attempts to resuscitate the patient, he is pronounced dead.
When you get older, maybe you do spend a lot of time contemplating things and thinking about what has happened and maybe he could have done something better. I don't know. I don't know. I've never asked anybody. Maybe it'll make me, I don't know, a bit too emotional. Maybe I don't want to know those answers.
Feeling better?
Yeah.
Basically, they just kept him in. And then the next day I come up, see him, and he seemed fine. So I get a phone call the following morning saying he's had 2 heart attacks. And then they've had to shock him twice. So I've come up here. I can't remember if it was that night or the day after he passed away. He had another heart attack and passed away. It just probably was his time.
You've got to remember who to be nice to. You've got to still care about the people that actually deserve it. Like that little old man last night. Little 89-year-old who had fallen down his stairs, and he had like multiple rib fractures, contusions, bilateral brain contusions, pneumothorax one side, pneumothorax the other side. I mean, he was in a sorry old state, and it just broke. And the vicar came and did the last rites. Well, me and the anaesthetist were nearly in tears outside here. Because he was just, you know how lovely he obviously was, and his daughter, he lived with his daughter and his son-in-law, and they just couldn't, you know, he always kept the place tidy and did the washing up and had just, you know. As soon as they die, they've gone. The person, they're just a shell. They don't look like they did. And it's funny, because even if you've only known that person, been with that person for 5 minutes, when they're dead, they don't look what they looked like when they first came in. Right, well, let's get him kind of somewhat reasonably reasonable. I might take...
Could I have a pause x-ray, please? That's
what makes your features in your face and everything else just goes.
If I roll him to me.
Yeah. Good lad. Oh. Good guy. I mean, I must admit, I do talk to the bodies, though, when I'm laying them out. Well, I think they could be watching. I'd hate for anyone to think that I was treating them horribly. Do you know what I mean? I think it's just... I don't know whether it's a... Maybe it's a getting over it mechanism, coping mechanism, maybe. I don't know, but I've always done it. I've always spoken to the bodies. Sorry, mate. Oh, that wasn't great, was it? Managed to make a mess of that side now. They can sometimes ooze from their back passage. They're, you know, come out there, they can wee, and sometimes when you turn them, it can all come out of their mouth as well. It depends. Sometimes you don't have any, and sometimes you have a lot, and sometimes they moan when you turn them over, but that's just because there's a lot of air in the lungs. They go, like that. The first time I heard it, I did run out of the room, but I was only 22. I was a baby. Oh, you've got some suction. Let me just suck out what's come out. Don't be making a mess like that with your family, all right? Because that won't be nice, will it? That's better, isn't it? It looks much more comfortable. There we go. There we go. All right, mate? There. It does affect me, because I realise how amazing life is. I realise that I don't ever want it to end, and I hope to God that I end up as fit as a flea for very many years. But I don't think it... I do have a really black and white view on death. You know, people die, it's upsetting, it's horrible, but it is a fact of life.
Right, anything you don't eat on your sandwiches?
She likes cheese.
Yeah.
Cheese or ham, love.
Cheese or ham. Cheese or ham.
Can you remember where to go?
All right, I'll see what I can get.
very tempting to move. Just keep it still just for a few minutes longer.
I ring him a lot more during the day to check on him and that. And I do get up and cook him his breakfast some mornings. Just basically, you know, like, don't take him so much for granted, you know? It makes you think that you should take that extra time because you never know what the outcome of the day is going to be.
Right, should we start in one and work our way down? Oh.
No.
It is. A&E Kings.
What do you think?
Oh, brilliant. Thanks so much. And bye. Red phone, 8 minutes, please. Yeah. 62-year-old male with chest tightness.
Red phone, 8 minutes.
For last hour.
Hello, King's A&E.
Got some bad news for you, man. Kofi got knocked over today.
2, 3. We have another trauma call coming in with a stab wound.
There's a guy over there with a knife sticking out of his head.
Yeah. This gentleman has just walked into reception. He's been shot in the face.
Yeah, it's Wild West tonight.
It's the stuff of movies, but we get it sometimes at work.
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Maybe 15 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Camino. Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Oh, that's the red phone. Do you want to answer?
Do. Hello, King's A&E staff nurse. Yeah, hi. Yeah. Okay, all right then, lovely. Thanks, bye. Oh, lovely. Fall, 4 to 5 stairs, landed on back of head, nil loss of consciousness, intoxicated, left arm numbness and paralysis. Red phone, 20 to 25 minutes. Red phone, 20 to 25 minutes. They said he's very intoxicated.
alcohol is one of the biggest causes of injury seen by the emergency department. On an average weekend, about a quarter of the patients are drunk.
It drives me nuts that people drink as much as they do. It drives me nuts that people take drugs and then come to us half an hour later saying that they feel funny. Well, what did you expect? If you weren't feeling funny, then you bought the wrong drug.
This gentleman, his name is Sean, he's 39. Basically, he's fallen down about 4 or 5 steps on the landing. He's been drinking since 10 o'clock this morning due to a family bereavement yesterday. He's saying he's got pain and tenderness to the back of his neck. Okay. He's had a hell of a lot to drink, no drugs apparently.
Yeah, no.
Okay. Might be.
Yeah.
Do you want a second cannula or do you just want blood?
He'll need bloods. What's he got? Yeah, just his bloods is great. Yeah.
John, I'm Marie. I'm just going to take some blood on this side, okay? Did he have opiates?
No.
What's he had? I didn't hear.
Oh, drunk.
Drunk?
He's been drinking all day.
Right.
Yeah.
Oh, grand.
Come on, please.
What's the matter, my friend?
Please, yeah?
What?
I need my mum.
Oh, maybe she's coming in, I'm not sure. Sean, if you need to be sick at any stage...
Oh, speak to my mum, yeah?
Well, we'll get her in a moment.
Can you take this fucking thing off my head, please?
Well, not just yet, just because we're worried about your neck, that's all. But as soon as we can, we will.
I need to speak to my mum.
I don't know if she's here yet, Sean, but just wait one moment.
Yes, come with me in the ambulance.
Yes, Sean? Can you bring her in? Is that all right? Thanks a lot. We're going to bring her in now, OK?
Oh,
all right.
Well.
Thanks. Hey there. How you going? I think he really is pretty keen to see you anyway. Do you want to pop up the end here?
16.
Oh, really? OK. My name is Graham anyway. I'm one of the consultants here.
Mum?
Is there a reason you don't want to go at the top end of the bed?
Mum?
OK. Has he been abusive towards you tonight?
Mum?
Just talking, wait.
Just say hello if you want.
Who are you?
I'm here.
I can't look at you, right? I think I've got a problem with my leg.
Yeah, I've heard. I'm just talking to the doctor about it. Just hold on, please. Hold on. I'm here.
I came in, I went upstairs, and the first thing I did was laugh, because the way I see him, he looked like the Hunchback of Notre Dame. And I just laughed. And then Linda said, oh, let's get a camera. And she took a photo of him. She said, me and you will have a laugh about this tomorrow, Sean.
What would be his favourite for the next guy?
I don't know, Sean, nothing yet.
Hello, Lisa. Yes. Thank you.
So, we'll just have to work out exactly what the situation is with the neck, and then we'll go from there.
Bed phone, 10 minutes. That's bed phone, 10 minutes.
Oh, this is a trauma call.
Has everyone got...
He fell down about 8 or 9 stairs at the embankment with a lost consciousness for about a minute.
A second red phone. A second patient who's fallen down the stairs drunk.
A drunk fell down is a big one. I think what happens is they're on the inside where it's nice and light and they've got a skinful, and then they open the door and it's all dark out there, and half of their senses are already shattered from all the alcohol they drunk, and then they lose their vision, and over they go, they fall over. Who have we got? No one. Okay, mate. Is that you that fell down the stairs?
Yeah.
Really?
Yeah.
Should we sort you out?
I just want a bit of fag, mate.
We got a whole team in there waiting for you.
Yeah, man.
How long are you gonna be? Where's your fag?
Right, no, it's sort of.
Oh, well.
Come over here, I've got to go. Sorry.
Well, yeah, there's a whole trauma team waiting for you in there because we thought you might have been unwell. He's out there having a fag. He's going, no, I really need a fag, mate. He's just standing there like with his hoodie on. And...
So are you going to see him?
Well, he's out there. He's obviously in control of his faculties, so if he wants to stay out in there and have a fag, he'll have a fag. That's all right. That's all right. Well, tell you what, you can help us out.
She's with me, all right?
Just take your gear off there. We'll have a look at you.
Interestingly, actually, I was on one occasion I kind of had too much to drink, and I fell down the stairs, and I ended up as a casualty in A&E, which was mortifying for me, obviously, for a number of reasons.
You've been drinking some, obviously, huh?
Yeah.
Yeah? How much have you had to drink?
I can't tell you.
Just turn away from me again.
My head is fucked, mate, seriously. Like, I've had a lot of fights in my life, mate, yeah? I've had a lot of tear-ups and this and that.
Take a nice big deep breath. Deep breath. And out. Go on.
Don't get me wrong, bruv, yeah? I've fallen over drunk before, yeah?
Yeah.
And I've done this and I've done that, yeah, but this is hardcore.
Okay.
Right?
Let's have a little look.
See, back of my head is killing, mate.
It's a fair old bump you got. When you get a bang on the head, what we're concerned about is not just the cut and the bump on the outside, it's the chance of a bruise or a bleed inside where the brain is, yeah? There's no signs of that going on at the minute, but we've always got to think ahead, you know, what chances are you developing that,
Like
yeah?
I say, I've had some tear-ups in my life. I've
Yes.
never had that.
Okay. Well, I'll just
I've never
put this
had a
round.
lump like that, mate. Do you know what I mean?
We'll put a drip in so we can take some blood, yeah?
No, mate, no, I'm not having no drips.
Are you sure?
Don't have needles, mate.
Is that right?
Yeah.
I think we need to watch you for a while. It's probably going to be an overnight stay, to be honest.
My real birthday, mate.
She can't.
Oh, I've got to go then.
Well, she might be able to sit in a chair next to you.
That's all right.
Well, that sounds fair on
She
her.
can touch me out when you're not looking.
She might want to sleep.
You know what I'm saying? She wants to touch me out.
If there's anyone in the department who speaks Spanish, could they come to the front reception, please? Anyone who speaks Spanish?
Anybody who speaks Spanish? Yeah. Ayala.
I was feeling drunk like maybe 3 hours ago, but now I could do anything right now, speak to anyone and do anything, and I don't feel drunk. I'm not drunk. I don't feel like I did yesterday. No. Because I sobered up.
I feel quite
Because of
weird,
what
like.
happened. Do you want some water?
No. Here, I'm just.
Do like a sobriety test. Make him walk on a line.
Draw a line into. Say vamos to him. That means let's go. He's shaking
No,
his
he
head
needs
straight.
to. He needs to stand up. He's in hospital. Come on now, I'm not having this.
Go to that nurse.
Oh, flipping out.
Go to the nurse.
I do feel like Mrs. Mop sometimes. You know, it's like they've been too drunk to get to their bedroom, so they just stopped off in A&E, and, you know, so I'm there to look after them, mop their brows so they wake up, and then, you know, kind of feed the hangover with a couple of packets of crisps and a can of Coke and some coffee. Oh, I'll have to keep him up here. He's in a real state, isn't he? Oh, for goodness sake, come on now. Right, we might as well walk him into a cubicle now, after all this kerfuffle. It'll have to be number 11. We might as well just keep the drunks together. Goodness me. You've had a good night, haven't you? Did you go out? Have a drink? Did you have a good night? Did you dance? Woohoo! I like it. Brilliant. You had a little boogie. Now, one question. Is that hair real? Oh, look. All my boyfriends. All lined up. Keep them done. No, I just don't know which one to choose. I think it would have to be number 10. My little William.
A couple of years ago, this very posh boy came in and he'd had a bottle of whiskey. We'd go to take his blood pressure and he'd be like, "Oh, girls, come and get me." And I'm, "Oh, Jesus, now how much of this can we actually take?" And he was saying, "Where's my girlfriend? Where's my girlfriend?" So we're like, "Oh, she's up there in that trolley there. That's not my girlfriend. That's the girl you were kissing when you got out of the ambulance.
Warm as a fruit bat.
Some people expect McDonald's treatment
Fuck's sake.
to be in, not wait and go.
Oi!
They don't understand that, like, you know, you have to collate blood results, x-rays, get things organised. Like, you know, it's not like or you don't walk through the door and the doors scan you and you have all results available to you.
No, can you come here? Oi!
They don't get that.
Don't walk away.
Excuse me, sir. Can you call properly? We're in the hospital, sir. Okay?
Yeah?
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 Speak pissed off. I know you got...
You're treating me like I'm an idiot, yeah?
Shall I call your mum and ask her to tell you
Listen,
what's going on while we try...
Listen,
Yes?
take this thing off my neck, yeah? We'll see who's the last time, yeah?
We can't do it.
Exactly.
Yes.
You know what's going to happen to you.
Yeah, and you know what's going to happen to you as well. Do you know that?
No,
Yeah?
right here, right
Yeah,
now.
well, he's talking to the doctor right now.
Yeah?
Can you
She
hear?
take me for a fag, can't she?
We can't.
No,
You
my mum
already
can.
told you.
My mum can.
He has actually broken a bone in his neck. The good news is that he's alive and his blood pressure and his pulse and you know, he's got both movement in his leg, both his legs have normal movement. There's only damage to the nerves that are into the arm, and there's a possibility that, you know, with intervention that might improve as well.
Did you hear what he said?
What did he
said
say?
If he's got broken his neck, he's going to kill himself.
I'll tell you what.
I don't want to hear it. I just.
Yeah.
Has he quietened down?
He's quietened down a little bit.
Hello? Hello?
Sean, the doctor's just talking to your mum right now, okay?
No, can you come here? Oi! Don't walk away. Fucking ignorant bastard.
I had one too many maybe, and tripped over the closels, went down the stairs head first, broke my neck.
Hello? Right. Can you get my mum, please?
I'm going to find her.
I see everything that's happened in my life flashed in front of me, and I was just sitting there thinking, when's the light going to come then? That's normally what happens, isn't it? Well, that's what I've been told normally happens. Your life flashes in front of you, and then you see the tunnel with the light at the end of it. But it never came.
I broke my hip now. I hope you're happy, yeah? Stay still.
Why have we got to be happy? We're not
Hopefully,
happy.
I hope you're happy. You might keep still, but...
It's nice to know. We're going to go home and we'll be back tomorrow.
Don't worry about me, babe.
I ain't talking to you when you're like this, Sean.
There we go.
Sean's been through a hell of a lot in his life, through beatings and everything else. He's following in his dad's footsteps because his dad was an alcoholic.
What about me? I'll be alright.
I do worry about you, I love you.
What about me?
I feel responsible for a lot of it because I think I've not brought them up right. To be honest, I've had 4 kids put in care, so I don't feel as if I've been a proper mother to my children. Sorry.
I hope you give up with me.
I didn't give up with you, I'm here. I came with you, didn't I?
No.
I just don't like hearing the way you talk. When you abuse people.
Don't worry about me, mate. Take this thing off. Take this fucking thing off of me and I'll get out of this fucking hospital right now. Right? I'll fucking show you what you can do.
Sean, stop. Put that back on your finger. Sean. Sean, stop.
People come straight in to you from an experience, so they've had an accident or they've been assaulted. They may shout, they may cry. It's because they're frightened or, they haven't had the chance to talk about it or understand what's happened to them. So you face people when they're at their most raw.
Which one's the best, you think? That one? Or? That's quite cool. When was the blood pouring out, though?
Well, when you were just sitting down outside the park where all those people were helping you.
Oh, yeah.
And it really was just pouring down your face.
He claims to have been assaulted. He says he lives on the streets and a passerby assaulted him and he's got a bit of a hematoma, but apparently no loss of consciousness. He's going to knock out any doctor that goes to see him and he's going to kick off when he gets to the cells. I don't know what he's going to do to the nurses that assess him.
Cute police officer though, so it's okay.
All right, we'll leave.
Quite sweet.
We'll let you sort him out.
Yeah, they do. He seems he's got a sweet face, isn't he? Hello, Majors.
A man that can't handle his drink is just horrible. You can see the most loveliest man, comes into A&E, you can see that he's taken such pride in his appearance before he went out, and then he's just awful.
Babe, I'm so sorry. Yeah, I can't find my phone. I think they took my phone. I don't know where it's gone. It might be in my pocket. Look in my pocket.
26-year-old Andrew has been arrested after a day of heavy drinking.
Who took the fucking phone? You stop. You let go of me, and you let go of me.
Andrew,
let the fuck go of me.
Andrew, listen to me, okay?
They're pissing me off.
Listen to me.
Because I ain't been arrested.
Right, that's it.
I've been arrested for... You want? Yeah, go. Well, you bend me over. You like it that way, do you? Fucking knob. Go. I fucking can't.
To be honest with you, I can't remember too much about it. Well, you're talking mega consumption of pints, spirits, and whatever else,
Ah!
We may as well put him in the van.
Ow!
Yeah.
You're fucking me up! Andrew! What are you doing? Yeah, well, fucking let go of me then.
Andrew!
Fucking let go of me!
No, stop falling over. Stand up. Stand up. Stand up. Stop being ridiculous.
Yeah, the van hasn't been cleaned, so you may as well put him in the van. All right, we'll go.
I remember putting my hand through a window, not intentionally, but yeah, that was the way it happened.
Andrew!
The police come, I start getting a little bit rude to him, he start getting a little bit rude back, and I ended up spitting on the floor, and that's what he arrested me for. He was going to take me straight to the station because of my hand was in such a bad way. That's why I had to come in here first.
Fuck off! Fuck off! Fuck off! Fuck off! I'm just stepping on my fucking throat too for. Fuck off!
They took me back to the station. I felt horrid. Not a good feeling. Flashbacks, and I was like, oh, what did I do? Oh my God. Yeah. I'm genuinely sorry about what happened that night. If I could take it all back, I would, definitely, 100,000%.
Head down. Do you want me to faint as well?
I almost want to go to sleep.
Put your head if you're getting dizzy.
No, sleep.
No, don't.
Oh dear. I fucking hate hospitals.
Everyone hates hospitals. It's fine.
Ben. Ben. G'day, mate. Sorry to bother you. We've got a bed for you in a sec. Hey, have you got any allergies? Ben. Are you allergic to anything, mate? Ben, come on, mate. Are you allergic to anything? Squeeze my hand. Squeeze my hand, mate. Ben! Squeeze my hand. Squeeze. Ben, come on, wake up.
Fuck off.
Well, you need to cooperate, mate. This is going to happen a few times overnight, so be prepared. Ben, squeeze my hand. Ben, squeeze my hand, mate. Just squeeze it. Ben! Wake up and...
Don't talk to me like I'm a fucking mug, all right?
Well, wake up and cooperate. Squeeze my hand, mate.
If I talk to you like that, well, I'll be sitting here right now.
Listen, if you talk to me like that, I'll kick you out on the street, right? It's easy as that.
Don't talk to you like I'm a mug then.
Well, cooperate with me. It's simple as that.
Fucking hell, mate, all right?
Just cooperate with me. It's as simple as that, yeah? If you cooperate with me, then I walk away and sit down again. Squeeze my hand. Good man. Now listen, are you allergic to anything?
I have asthma.
So you can't have pills that affect your asthma. You allergic to anything else? No. Give people warnings, and if they're not going to toe the line, then we don't. We're not punching bags for them. That piece of work over there is for CDU.
There's nothing you're worried about, is there?
No. No. A bit worried he might survive.
That's fine.
Hello, Major Staff Nurse. I mean, you can call the out-of-hours service for the GP. It might be better to do that, and then they'll figure out whether you need to come to A&E or not. You'll go to triage. You'll be assessed. They'll decide which bit of A&E to go to. You'll probably have a long wait, and then the doctor will see you. All right. Okay. Bye. Have you ever in your life phoned A&E for advice? Hello, I was wondering if you could help me. I think I've got tonsillitis.
Just do your temperature quickly on under your mouth, please. Right, thank you. Close your mouth. That's it.
Whilst drunk patients can prove difficult for staff, drunk and abusive mental health patients can be far more challenging.
I think she's called saying she's taken an overdose of 3/4 of a bottle of vodka or a bottle of vodka, and apparently 10, 15, 20, maybe 50 paracetamols. They're her words.
About trying to grab a girl.
She has got mental health issues. She's on medication. I've known her for quite a few years and dealt with situations like this all the time. I don't believe... Okay, I'm not a medical person. I know nothing about the overdose thing. I don't believe she's taken that many tablets. She's attention-seeking.
Don't start about trying to grab a girl.
Having brought the patient to King's, the police are now keen to leave her there.
No, I'm going to toilet.
Truth of the matter is, I'm not willing to stay here with her all night on a Saturday night when I've got people. I know it sounds really, and I know your face is looking, well, it's our job. But what
but she's also a danger to herself and other people, the way she's behaving. She's unmanageable here.
What are you doing? Why are you a man grabbing a girl?
We've had occasions where the person has been brought in, decuffed and they've gone, and they've literally, I remember a guy, he went absolutely crazy and it was frightening. I was petrified. There was minimal staff in the department at that time because it was a night shift, so it had quietened down a bit, and he'd picked up the big metal bins and he was throwing them around the department, and it was really frightening.
No, I'm going to go piss, yeah? And my man, yeah. Oh, fuck, that's what you say, silly.
She will calm down. She normally does. She doesn't like the blokes, which doesn't help. How come I've got lumbered here? My only other issue is I have no way of getting back because I was the only driver and I didn't leave my car here.
My concern is that I've got 1,000,001 other patients here. I have to ensure staff and patient safety, and the way she is at the moment, she's quite unmanageable. She's quite at risk of going off and hurting herself. There are sharps everywhere. There are cannulas everywhere. She's being aggressive with you guys. She's at risk of hurting herself.
Sorry, excuse me.
No, it's okay.
She's refusing treatment at the moment and just being a total nightmare.
Excuse me. Hi. Can I have a quick word?
Claire, number 6 under surgeons now.
Yeah. They've just looked up. She's a risk to hurting other people as well. It's such a risky place. I've got so many vulnerable people here. I can't afford to be hit. I can't afford other patients to be hit and other members of staff. She is very volatile.
The way I've been trained, right, as a police officer...
Our security won't stop her walking out.
OK, I'm just saying from our side, from the police side, the way we've been trained...
She's not manageable in this situation, and so...
security over here that can deal with that.
When she walks out of here, I will call the police. It's fine. We're going to get nowhere. I will take it up with Graham, our police officer, our head officer. Can I take your numbers as well?
Yeah, it's hers 861.
You feel kind of helpless in a way that if they're going to leave this patient here, no matter what you say, how on earth are you going to cope with this patient who is clearly needs to be in a place of safety? You know, plus all the other drunken patients and the other patients with mental health problems. It is really, really makes you feel quite helpless. Hi, she's left the department, so we'll have to call the police again, won't we? What are we going to do? This is ridiculous. It's so frustrating. Kevin, I had CT on the phone. They said you brought somebody to neuro CT that should have gone to general CT. So we've got somebody here that needs to go to neuro CT. So when you take them to neuro CT, you transfer the other one back to general CT. Yeah. Thank you, Kevin. Are you free, Nikki? Okay.
Let's just get you untangled, shall we?
Hello? Hello, anybody? Hello?
It's White, Sean.
Since I've turned 18, a lot of the injuries that I've suffered, have been drink-related. I've been run over about 4 or 5 times. I've been smacked across the head 5 times with a claw hammer. Been smacked in the head with a machete. Had my jaw broken 3 places. My nose has been broke about 40 times.
Mate, I'll take the fucking thing off.
Sean, don't try to do that.
You're not thinking about yourself and your future right now.
Listen, mate, I ain't sitting here staring at the fucking 2 lights all night, just to do you a favour, because you're doing your job, You ain't thinking of me at all,
When I left Philippines, I felt very shocked about what I have seen and the amount of alcohol that people are consume and the effects that they normally goes with it.
Can't sleep on my back anyway,
So,
right?
listen to us.
Staring at the 2 lights, ain't doing me no favours, is it? All you're thinking about is you and your career, mate, not me at all.
Do you know you've broken your neck?
Yeah, I do know I've broken
okay,
my neck,
so if you...
But I can't sleep on my back,
Okay.
And I ain't going to start trying to sleep on my back, just do you a favour.
No, it's to do you...
and your job,
It's nightmare. Like you got 4 people in the front of you, they're all drunk. And you need to keep an eye on all of them because they need to be monitored. Maybe the other mode need to be more awake. You have to come them every 15 minutes or every half an hour, just make sure they're still breathing or something. They're like the worst patients you're gonna have.
Listen, like, my leg, is for life,
Yeah.
Your job is just a career.
So you're concerned about your neck, are you? That's why you need to keep still, otherwise you can lose all sensation from here downwards. Be on a breath. You know, like Superman. You know the guy that played Superman. You could be him.
Yeah.
I've turned the lights off, so it's a bit better now.
And I still can't sleep on my back. What part of that can't you get? Hey, listen to me now. Listen to me now. Get my clothes. I'm going home.
You've got to fill this up, can you?
Listen, mate. Right? I don't care what I can do and what I can't do. You're not fucking gonna make me, fall asleep on my back, staring at all these fucking lights, You're not gonna make me do that, You can't make me do that, What? Yeah?
If you start walking,
Watch
you could become paralysed.
Watch them.
You probably never
Watch
will go
them.
home
You're going to
now.
have to sit there and watch me all night. Yeah? Because every time I get...
Hey, Sean, no one's going to make you do anything. So if you try to get up and remove all this, no one's going to stop you, okay? Because you're your own boss. But if you do that, there's every chance you might paralyse yourself from the neck down. So you just need to understand we're trying to do this for your future, all right?
No, I don't think you are trying to do that, yeah?
Well, you've got a broken neck, my friend.
Yeah, I've broke my neck.
Yeah?
Right? Yeah. But I ain't going to sit here staring at all the lights in the hallway, yeah?
But there's very little I can do about that right now, but there is a bed upstairs that's getting ready for you, all right?
Come then, let's go.
That's not that easy, Sean. Maybe it'll be an hour or more, and then you go upstairs. So right now I'm going to walk away and I'm not coming back again because I've got another patient coming in.
Can you turn me over then?
No, you've got a broken neck, mate. See you later. See ya.
Oi! Right. Okay.
Hey, Sean.
Listen, mate.
Sean, you've got a broken neck.
Wait one way or the other.
You've got a broken neck, Sean. If you roll over, paralysed from the neck down. Do you understand?
You leave me here, yeah? Staring up at the ceiling, yeah? There's a light there, there's a light there. So how am I supposed to go sleep?
Maybe I'll give you a little something in your vein to help you sleep. How about that?
Go on, then.
A little something, it'll just calm you down a little bit.
That one?
Right. Should we get some lorazepam? Just calm down and try to cooperate with us because we're trying to help you, that's all.
I am trying to cooperate.
All right, well, stay calm.
Wobbly. W-O-B-B-L-Y.
If anybody can speak Russian, please come to Majors. If anybody in the department can speak Russian, please come to Majors.
Hello, David.
Yeah?
Nice to meet you. My name's Ndab. I'm one of the doctors working here today.
Yeah.
Okay.
I was just walking up. I was at church.
Okay.
I went and got myself a cigar, to cheer myself up. I was just about to smoke it, and I suddenly felt strange, all cold and everything. And then I just collapsed on the floor, just fell down and bashed my head. There was nothing to grab hold of.
How long were you on the floor for, do you think?
About a minute.
About a minute?
Yeah.
56-year-old David collapsed in the street. This is the third time he's been to A&E after blacking out.
Well, I'll clean it out first, and
Is it nothing, isn't it?
It is fairly deep, actually.
Yeah.
Quite often in A&E, the presenting complaint is just one factor in a lot of factors that have brought the patient in, and so usually sometimes you have to dig beneath the surface to get down to the real problem.
I had stopped drinking for a month, 2 months actually, and I started to have one to see what it was like, and then I regretted it afterwards. I was sick.
How long ago was that when you had the drink?
Oh, yesterday.
I'll pop this on for the moment. Yesterday you had
Yeah.
it? All right.
But I didn't have anything today. I've not touched anything. I don't want to. I've got the money to, but I don't want to.
My name's David Long. I'm an alcoholic. I could drink a bottle of brandy in the morning and a bottle of brandy in the evening. That's what I used to drink.
So what time would you get up and start drinking brandy?
Oh, first thing in the morning. Anytime from 7 o'clock onwards. I need to have a drink sometimes at 5 o'clock in the morning.
Okay, can you bend that knee for me?
No, it's broken, that one.
When did that happen?
1956, this one. Just,
How did you do that?
Plane crash. We took off from Kano Airport, hit a tropical storm, so we hit a tree just short of the runway, and one of the engines caught fire. We crashed. And most people were killed, including my mother.
Sorry to hear that.
Yeah.
At the age of 2, I survived an airplane crash in which my mother was killed. That may have started it, I don't know.
Do you have any questions for me?
No, I was just saying when I get out. and have a pint. No, I won't have a pint. They do actually, just to celebrate.
Well, I'll
ridiculous situation. I've kept off drink for months, and then this happens. I had to have one pint. Ooh. If I'd been on the piss, I wouldn't mind it. That's what annoys me even more.
Fine. We'll have a chat about that once we've got all the information together.
Right, yeah.
All right, I'll see you shortly.
Yeah.
Do you drink to forget, David?
Yes. And for pressure of work and things like that. My way of coping with life. I see other people getting on and I'm not. My father wanted me to be better because he was a self-educated person and he wanted me to excel at things, which I didn't do.
Did you feel loved by your dad?
Not really, no. He thought I was a failure.
Tragic, it really is. It's very difficult when someone's at that point to know what to say. You know, what do you even say to that individual? You know, and it seems almost, you know, kind of futile to kind of give him that bit of treatment that, you know, isn't really kind of touching what needs to be dealt with.
Egg, bacon and sausage tomorrow morning, man, in the cafe before I go home. Might even treat myself to a can of beer. It's supposed to be good, you know, it helps you sleep.
Hello.
Yes, Sean, what is it?
Can you help me out, please?
Well, you can't. I will try to explain it to you, do we? You not get up from there. You have to keep it like that until we're gonna take you up to the ward.
Yeah, when?
Well,
when I'm fucking too scared to sleep.
Right. They're a bit busy right now, and then we're trying to call them up in 20 minutes, 30 minutes.
Too busy doing fuck all, you
Maybe what you need to do, you have to close your eyes, think about what happened to you and what's gonna happen to you in the future.
No, you're supposed to be sorting out an injection for me, yeah?
Yeah.
But no, he's too busy to do that, isn't
Just to calm down a bit, yeah?
he? Too busy to do that, isn't he? He's all full of shit. Oh. Hello?
Yes.
I didn't mean to slag any of you off, right? Yeah? But he told me he's going to get me an injection to help me sleep.
Yeah, that's why I'm trying to prepare now.
Sorry, son. I really don't mean to give it to you, you know that, yeah? I know you're only doing your job right, yeah? Yeah?
Yeah.
Much obliged to you, yeah? I don't blame you for it.
Just close your eyes so maybe you can go to sleep.
Sean underwent 3 hours of surgery to repair his broken neck.
My GP said to me that I was very, very, very lucky. And I said to her, why is that then? And she said to me, because you was within an inch of being paralysed from the neck down. Scary, isn't it, really? Since I've come out of hospital, I have maybe 1 or 2 cans, that's it. And that's not like every day, that's like when I can be bothered to go to the shop and buy them. Most of the time I just sit in my bedroom now, watching telly. Can't hurt myself in there laying on my bed, can I?
Alcohol's so readily available. You know, I've seen what it can do. I've seen the long-term damage. And I've seen where a glass of wine at dinner can end up killing somebody. I've looked after somebody that has drunk so much, he actually bled to death in front of me. And, you know, it goes from having this nice bottle of wine at dinner to losing your life because of alcohol. It must be so awful to have to get up every day, and the only way you can face reality is to drink.
Well, once this is done, you should be able to go.
That does break my heart. It really, really does. I think it's, you know, no one wants to drink and be like that. No one wants to smell of alcohol and shake every day. No one wants to have a life that they have to blot out, that's so serious they have to blot it out. You know, it's not a life at all. Alcoholism is an illness. Alcohol addiction is an illness.
I still occasionally binge drink, but I'm trying. As it's Lent, I'm trying to give it up.
OK, we're all done.
Booze has ruined my life. I've basically wasted my life.
Will it kill you?
Eventually it will, yes, because of the cirrhosis of the liver.
Doesn't that worry you?
No, I'll be joining my mother.
You know, in A&E, it generally is a patch-up, put a plaster on it, because I think that's all we are able to do. You know, we'll fix the physical side of things, you know, the shakes, the fits, and we'll replenish what they've lost through alcohol, but I think in the long term we try and guide people to the right services. But I think usually in A&E it's a plaster.
Everybody can be saved.
Hi guys. His right side of the brain, he's got a part missing. And I keep laughing in shock.
I need to move this man back on the bed. He's really quite heavy.
We give it a good go, but we can't always help everybody.
King's A&E.
Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now.
hold him a bit, 20 minutes, 30 minutes.
Kings is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Camino.
Everyone should walk through an emergency room at least once in their life, because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love. And the fact that 1 minute they might be there and 1 minute they might be gone.
It's just my luck to, like, get hit by a ball on my head. Oh, we're not very good for injuries in our team, are we?
Every year, 3 million of us end up in A&E after accidents that happen during recreational activities, mostly at weekends.
Why didn't I duck? Oh, that's me.
Well, I think majority of people work Monday to Friday, and at the weekends it's time to forget about your stress and enjoy yourself. Unfortunately, I think people enjoy themselves a bit too much sometimes.
Still paying score 8 out of 10.
Look at that, we're cooking with gas. This is how it should be. And we've been busy now.
Scott has worked at King's for 10 years.
I came into nursing reasonably late. I didn't start my training till I was about 22. But, you know, in my career, I've seen absolutely everything. I remember when we used to have just the big whiteboard here and you used to write everything on it.
Yeah.
Yeah. Piles.
Can I have a portrait and X-ray, please?
Carrot in anus.
Carrot in anus. I had ping pong balls in anus the other day at Triage. Yeah, it was a bit embarrassing. Because I was sat there and, like, you know when you really want to laugh? And then I was trying to be serious and asking the questions. I couldn't do it. I couldn't do any obs. I was like, I can't do it.
So what was, sorry, male or female?
Male. And they'd been playing with, they had 4, and he noticed they only had 3 left.
Fair enough.
How are you more comfortable?
Standing.
Okay. Right. Can I get you... I know these gowns are not flattering at all. If we get your top off now, just because it's going to make it a lot quicker when they come to examine you.
Hello.
Hello, sir. Have a seat for me, please. I'm fine, thank you. Well, how can I help you?
I just got hit in the face with the ball.
What was it?
A hockey ball?
Hockey ball.
Yeah.
Any vomiting?
No.
A loss of consciousness?
No.
So you had it smack in the eye, yeah? Okay.
Pain here?
Yeah.
Okay. Anything here?
Yeah.
Okay, we'll do an X-ray. I don't think there's anything broken. More than likely, you've probably torn that ligament a little bit.
Football is the sport responsible for the most casualties in A&E, closely followed by rugby.
Is
It doesn't hurt.
It doesn't hurt.
No, it hurt at the time, but it's fine now. My teeth feel weird, but that's it. It's not, yeah, it's fine up there. Okay, yeah, that hurts.
Yeah.
There we go. Clean knee. Why am I washing your knee? You're quite capable of washing your own knee. Wipe it.
Thank you.
What am I doing?
It's clean.
All the rugby players put mud everywhere, look. See the mud trail.
He thinks it's poo. He thinks it's poo. Why would you put tissue on it and then sweep it up? What is he doing? Ah, here he comes. He's going to make another mess.
Jesus.
What?
Jesus.
I didn't know he played rugby.
Saturday. As evening approaches, sporting injuries make way for another recreational pastime.
Before you come on shift, you know it's going to be busy, pretty much. Days can be full of football injuries and nights can be full of drunken injuries. You know, unfortunately, alcohol does funny things to people.
I don't need that chair. I don't need that chair.
I'd follow your friend. I would.
A party has ended prematurely for a group of university students.
What can you say, yeah?
Two have hurt themselves after falling from a bar they were dancing on.
Well, things looked like it was a good fancy dress party, though, wasn't it?
Yeah, it was.
Everything just went Pete Tong.
18-year-old Fleur has hit her head. And Jessica, also 18, has hit her head and knee.
You look an old woman. Babe, you look an old woman. Babe, what the fuck are you doing?
What the fuck happened there? We were just dancing on the bar, then what?
All I heard was a scream and everyone...
Are you kidding?
Yeah, and everyone just looked at the bar and where you two had been was gone. And it was funny, but then it was horrible because you didn't get up for like 20 seconds. I mean, you've hurt yourselves, but I thought you'd really hurt yourselves.
I thought it was really God, for a minute I thought. Please don't. I don't want to think about it. That's what I think, you know, like, I have like, babe, rest your head back. Shh. I got, babe, stop it first.
Rest your head back. Rest your head back. Rest your head back.
But then when I start to fall asleep, I feel really drunk, like really drunk.
It's because you are really drunk.
It's true, babe, it's true. I'm not going to react because what I want you to do is the toilet and to sleep because you've been knocked out in the head. I'm in the hospital because of it, okay? Shh, shush, okay? It's fine. No, you're fine. Just talk about you, okay? You're fine, okay?
I'm fine. I'm absolutely fine.
Okay, shush.
Okay.
Head down. You're fine. Shush. Shh. It's fine.
It's fine. Go ahead. It shouldn't be long. Half an hour, hopefully. Half an hour?
Like your wishful thinking. My name's Colin Sykes-Wilkinson, I'm 32 and I work in construction.
You've got an air of Robert De Niro about you, mate, I've got to tell you. There it is.
Yeah, what's wrong with you? Get it. How come? What happened?
Little cut on it. Didn't move out of the way quick enough. I was out
with mates having a drink in the area and that, and I was coming home from the petrol station. Two people have approached us. So they've asked us the time. I've said, no, I don't know the time. And then they've tried to lunge for my phone that I had in my hand. So obviously I've tried to fend one of them off. The other one's tried to throw a punch. And well, next minute I knew there was a knife in the air and one of us cut us with a knife.
I Spy my little eye, something beginning with M. Alice is worried about her friends. We're playing I Spy My Little Eye.
Okay, what are we missing?
Okay, cool, that's fine then, that's fine.
Beginning with what?
M.
M?
She wants to talk to you.
Mobile.
Not many people can say they've had a knife pulled on them. What were you thinking when the knife got pulled out?
Well, to be fair, it ain't the first time I've had a knife pulled on us, but yeah, of course you get scared, you see that coming at you, you know, you don't know what's going to happen.
Your turn. Mister?
Who's my turn?
Yeah, your turn.
Oh, blimey. I've been stabbed about 3 times, and I've lost count the amount of times someone has actually pulled a knife out on me. It happens so many times where I'm from, so, you know, you tend to get used to it. Do I actually have to say I Spy as well? Something beginning with, J.
J. Jumper. Babe, this is so hardcore.
You bonded.
Colin?
I'm fine, don't worry. Well done, Colin. Good luck. Woo, enjoy it.
What happened today then?
Someone tried to mug us in it or something.
Hit you with what?
Knife, machete, sword, whatever.
Okay. When was this?
About 10 o'clock.
Oh, sounds pretty bad.
Well, it's not
Did you
too
get any
bad.
other injuries apart from that?
A little scuffle in there, but no, that was it. That's the main one. Well, for me being a kid up to it is now, it's just got worse and worse and worse and worse.
Did you hit your head?
Huh?
Did you hit your head, sir?
No, I hit his head.
You hit his head?
Yeah,
Okay.
his nose.
Okay.
So if someone comes in with a broken nose, it was him.
Okay, well, I'll keep an eye out, sir.
My opinion, they ain't got the bottle to stand up and have a straight in a one-on-one, so they use knives.
Okay, let's have a look. Yeah, bring it towards me a little bit.
Ruined me tattoo, innit? Yeah, I've seen worse than that. I've seen people get hurt worse than that. I've seen too many things, so that wasn't nothing. Is my finger supposed to be numb?
Let's just have a look at your fingers. Okay. Give my hand a squeeze as hard as you can. Okay, is it? You can't squeeze as hard because of the pain, is it?
Yeah.
Okay.
It's just tight.
So relax for me again. Can you feel that?
It's numb. It's tingling.
Okay.
Yeah, it's proper numb.
So this is numb here, is it?
Yeah.
About down here?
No, that's all right.
Okay. Yeah.
These two here. It's like pins and needles.
Yeah. Okay, just bear with me for a sec. Let's get one of my other doctors to have a look at that. Femin, do you mind having a look at the wound for me?
Okay, no, seriously, it really hurts, but like.
I feel so old right now.
Oh, I'm so upset because you look so fit. Oh no, you're so fit as well.
Oh, feel that. Be serious from now on, okay? Let's be serious. Stop giving him leaflets. It's so bad. What are you doing?
Darren has collapsed at a party. His friends Ian and David are keeping him company.
I'm going for a cig. Just go on your own. No. I'd rather just go on my own. I just need time. It's fine. Okay, no, I need to know. Okay, oh, for God's sake, I'm just outside, baby girl. It's fine. You stay here, you can see me. Just... Hello. Yeah, I'm fine.
Oh, you fagging.
Bad time, me time. Okay.
You're gonna let her go out and do that? Like, no, Dave, seriously. Dave, bad move.
Jen is one of the most experienced nurses at King's A&E.
I'm tired now. Do you know what I fancy?
You've done all kinds of nursing, haven't you? You've been a nightclub nurse.
Yeah, a rave nurse, yeah. I'd walk around the club all the time, making sure people were all right and making sure no one was sleeping.
Like doing a dance walk?
Having a little bit of dance, yeah. Jen the Dancing Medic, that was my name.
46-year-old chap, GI bleeding, vomited blood times once a night, smells of alcohol, probably a anaerobic tear, nothing on his bloods.
I spent many years, like 8 years I spent at Heaven. It was good. It was good. Crazy, but good.
The House of Commons were on the RAS last night. We had a few on our money come in. Anyway, she came in, she got picked up by a pre-booked cab, which was a Bentley, wherever she had been drinking. The poor driver, she vomited all over his beautiful Bentley and pissed herself all over his Bentley.
I think I've seen pretty much everything. What used to shock me 10 years ago, I've seen it. I've seen things up people's bottoms. I've seen people, you know, come in, you know, both of them locked together having sex. I've seen all sorts of things so things don't particularly shock me.
Locked together having sex?
Yeah.
What do you mean?
Well, I don't know if you've ever seen the ER episode when a couple come in and they've been shagging and basically, I don't know how quite it happens, but the woman's pelvis kind of like locks, so they can't actually become uncoupled.
We had a little chat and I said, look, just have these fluids, get yourself sober, and if you still want to talk to someone about how rotten you're feeling, about the fact that you can. Yeah.
But at the end of the day, it doesn't matter who comes in and why they've come in, they still need our services and our care and attention.
Gonna be okay. Relax, honey.
We're just going to try and roll over on her front and over.
Unfortunately, some nights you can have more drunk people than actually genuinely medically sick people. In my past, I've gone out and enjoyed myself till whatever time in the morning and never needed to go to A&E with any of my friends or myself. I find it a bit unbelievable that people do end up with us.
A&E Kings. 2. With 2. Right, yep.
A birthday party has gone horribly wrong.
Right.
The ambulance service are en route with 2 patients from the same event.
Yep, go on then.
I think it's going to get a bit busy in here in a wee while.
It's going to get busy.
Yeah, just
lots of people coming.
Yeah.
Okay, thanks.
Saturday night, yeah.
2 HEMS trauma calls, 10 minutes. 2 HEMS trauma call, 10 minutes.
Oh, way.
Yeah, way.
There's been a violent assault at a birthday party. Reports suggest a samurai sword was used in the attack.
Ah! We have 2 from the same incident coming. One a 50-year-old male, head injury, LOC on scene, now GCS 15, that's as far as we got. The second one from the same incident is a 20-year-old male who's been stabbed in the neck and the back. Father and son, so I think they're keeping the family together.
Morning, guys. This is a stab and the next one's a head injury. Okay. Okay, guys, this is Jamie. He's 22 years old. Approximately 50 minutes ago, he was in a brawl with several people. He's got a small hematoma over the side of his head, a stab wound just below his left ear. 2 stab wounds over his left scapula and a stab wound to his left abdomen.
Any idea what he was stabbed with?
A policeman said a samurai sword was seen.
Saturday night, South London, you do see some interesting things, you know, standard party, but instead of the fight with the girlfriend, you end up with loads of people coming in stabbed.
Okay, ready, steady, lift. That's it.
Okay guys, this is Mo, he's 51 years of age, found about 50 yards away from his son had been stabbed. Witness loss of consciousness for probably 10 minutes, moving all 4 limbs. Injuries, he's got blood from his mouth, some swelling on the right side of his face, no other injuries identified so far.
We were celebrating our daughter's 18th. The boys, her brothers, had gone all out and hired really fantastic lighting and smoke machines and everything else. It's quite an exciting thing for the family. We had a nice mixture of family and friends. It was a really, really lovely party.
Jamie, I'm just going to shine a light in your eyes. Sorry about this, mate.
There were some boys that said they wanted to come to the party, and I said that the party had ended, that they hadn't been invited, and one of them, who was very tall, came down in my face and was very menacing and said, "Don't push me," in quite a scary way. One of them punched my son in his face, and with that, all hell broke loose.
So, how many times was stabbed?
I don't know. The doctors know that. I'll ask in a couple of minutes, all right? You've a wound there, yeah, just underneath your stomach area.
Stabbed 4 times. Stabbed in my stomach, back twice, and my neck. I can remember falling to the ground and seeing everything around me disappear. It was really frightening there.
Maisie's fine. Maisie's fine, Kate's fine, Lee, Mark and Alt were all fine. Okay, but what you have to do now is be really strong for me. I thought he would die. That is what I thought.
Is your tummy hurting there?
Just try to relax.
Jamie, are you in a lot of pain or not really? Just when we're poking that thing over there. Oh, yeah. Okay.
Superficial?
No. It's disappearing off into the depths there, so... Okay, so... I'm just going to have a look at the other one as well to see what's what body. Can I... Thanks.
Jamie's dad, Morris, is also of concern to staff. He was hit across the head repeatedly in the same attack and is lying in the next bay.
Do you remember what exactly happened? Do you remember anything? What's the last thing you can remember? Where were you? Were you in the street? Were you at home? Were you elsewhere?
The fact that you prepared to turn getting turned away from a party into a reason for a knife fight, it's terrifying. Chest X-ray for him, chest and CT scan for him. For us, it's your Saturday night on call, and you know you've got a few stories to tell afterwards. But the effects on families is profound. How do you remember that? How does that go down in family history? It's not really talked about. How that small snapshot is affecting people for the rest of their lives.
It's quite a deep cut.
No.
You're right.
Hi, my name's Shameen. I'm one of the other doctors.
2 hours ago, Colin was also attacked with a knife.
I'm just going to have a real good look, yeah? I just need to see how deep this goes, yeah? I'll be as gentle as I can. Tell me if it gets too much, yeah?
Doctors think he may have suffered some nerve damage.
No, I'm just going to go a little deeper. Tell me if it gets too much. Tell me if you get any pins and needles anywhere.
Just that baby finger there's the one.
You getting pins and needles in there now?
It's been there constantly.
Okay. I know the numbness has been there.
Yeah, that hurt.
Tell me if that pins and needles gets worse.
That hurts.
Sorry. You got fascia exposed, yeah? Just the surface of your muscle, alright? So I need to flip the skin back a little. Try and bear with me, yeah? Okay. Alright, this bit is pretty superficial. This bit extends down below towards the arm. I think you need to speak to plastics, yeah?
I was due to start a job the following day. You know, I work hard for what I get, so, you know.
So if I don't get stitched up, will it just heal naturally?
No. You will get infected. So what sort of work do you do?
Bricklayer.
You won't be able to lay brick with that, sir, I'm afraid.
No, I'm trying to say. I've got 4 kids, you know what I'm trying to say. I need to work.
You can't work with that, mate.
I had to work my socks off to buy what I buy. Instead of them going out and trying to earn that money, the legitimate way, they'll just try and take it the easy way.
You do have a legitimate reason to take time off work, so there's no... They can't do anything, they can't, you know, can't fire you for not taking off work, so you need surgical help.
Okay, cushy. Thanks a lot, yeah?
Okay. Obviously, I couldn't go into work on a building site with that room there, you know, just dust and all, infection and all that, so I couldn't actually go to work.
How are you doing, Colin?
Content, but I'm gonna have to wake up. Look, it is as well. It's gonna break my heart to take it, but I've got to go.
You know, life's too short. So you just got to make the best of it and just crack on with life.
Sit up slowly.
Sorry.
Colin's just going to take his jacket.
All the best. Yeah. Right, right.
Why am I the only one in a gown? What happened there? Did I miss a trick? Why am I the only one in a gown? What happened? Why have I been victimised like this?
Like, my mum, when she worked at A&E, she's like, it's awful. Like, she's a qualified doctor. The amount she had to work, like, day and night.
It takes so long.
No, it's awful. Think people come in, they've just inflicted it upon themselves. If that were me, I would have no sympathy whatsoever.
What happened tonight? Catherine, try and answer me.
You have to answer the guy's questions.
Yeah, spit it out. Spit it out if you have to.
Catherine is 21 today. She was out with friends when she began to feel unwell and then started to lose consciousness.
Okay. Catherine.
Catalina.
Catherine.
Kiki.
Catherine. Catherine.
Catalina, your doctor. Come on up.
Charlotte, Nikki, can you give me a hand here, please? Please get out of the way, please.
Yeah.
Catherine.
Kiki.
Stop breathing there for a minute. What about apneic? Yeah.
Warning.
She's all right now.
Relax. I got you.
I don't know. Their friends are all right. Like, it's just they're querying maybe ecstasy or something, but I don't know because everyone else is all right.
Wake up for me. Catherine, wake up and sit up. Come on. Okay, stop worrying your friends. Sit yourself up for me and wake up a little bit. No. Come on, open your eyes.
Yeah, spit it out. Spit it out if you have to. This is Jen. Yeah, beautiful. Thanks, mate. Thanks. Bye.
Jen is the senior sister on duty.
A&E Kings. Hello.
She's responsible for coordinating all medical care in the department.
You know, all my staff are out in CT and I'm the only one in resus. Yep, go on. What's wrong? Brilliant. Okay, thanks. Bye. Yeah, can I have an adult trauma call, A&E resus, please? Yep, thanks. Bye. HEMS, trauma, 5 minutes. HEMS, trauma, red phone, 5 minutes. Hey, Darren, it's Jen. Is there any free nurses that could give me a hand, seeing as I'm the only person in resource and I've got another trauma call? No. Sure, thanks. Cheers, mate. Bye.
Just keep breathing. Just keep breathing. Come on. Come on. Yeah. Yeah. Good girl.
Did she say she took drugs tonight?
I don't know, it's a possibility.
Yeah. Yeah.
Possibility.
Yeah, no, got it all over you. This way. Relax.
Sorry, she's been asleep quite a long time.
That's all right.
3 hours after falling off a bar, Jessica's knee and head are about to be assessed.
Okay. Okay. Take a seat on there.
She's fine. It seems like she's really disorientated, but she's just tired.
Okay, so the longer we keep you awake, the easier it'll be. Okay. Do you want to tell me what's been happening?
Yeah.
What happened?
Well, tonight, I think I got very sleepy, and I think I fell asleep.
No, as in with your knee.
Oh. Well, I think I got very tired.
Shall we tell you what happened?
And I think... Okay. No, I know. I'm not stupid. No, I know. No, I know.
Do you know where you are?
Yes, I do. I know. I'm in a hospital, in an A&E hospital.
I just need to ask you a few questions. They might seem a bit silly, but it's important, especially if you hit your head. What day is it today?
It's Friday. Must be the 21st today.
Okay. Today is... I would accept it Saturday or Sunday.
I'm sorry.
That's all right.
But I know it's 22nd. I know. I'm sorry.
And do you know the name of the Prime Minister?
Yes. No, it's not Tony Blair. It's Gordon Brown.
Sorry.
Sorry.
And now she's sleeping on my hand, and there's nothing I can do.
Following her arrival 2 hours ago, Catherine has caused some concern.
Catherine. Hiya. Catherine.
Kiki.
Wake up for me.
Kiki. Kiki.
Doctors still don't know why she collapsed.
Okay. Catherine, come on, darling. Wake up for me. All right. Turn around for me. Let me have a little look at you, okay?
Mum, you have to be on your back.
Wake up, sweetie. I love the eyelashes, by the way. Come on, sweetheart. Up you come. Come on. For me, sweetheart. Up you come.
There we are.
Sorry, it sounds like we're being forceful with you, and I know it's horrible.
She'd sort of said to us that she'd wanted to go out and maybe take something,
Right.
and
She was talking about
she talked. I'd get the coffee away just, and she said that she had taken something, but she wasn't alone at all to take anything. There was she didn't have any drugs on her at the house.
Right.
There's no one in the house that takes
We don't know if
drugs, that
someone's
has
actually
drugs.
given- So we don't know if she has taken it, first of all. We don't know
I
where
don't
she's
think
got
so.
it.
To be honest, she can be given to exaggerate sometimes, and I think that, and I've just dismissed it as her exaggerating that she'd taken something. So, Kiki, if you have taken anything tonight, you need to tell the doctor.
Okay. If not, we do need to do some blood tests. Okay. Okay.
To be honest, knowing Kiki, that's probably actually your best bet.
I think you should do a blood test.
We see the extremes. We see the people that have too much of a good time. You know, there's still probably 2 million others that don't actually go to A&E at all, and that's what you've got to remember, you know. The minority of people that go out end up with us.
Kiki, if you did take something tonight, you desperately need to tell us.
They had me away like that.
minutes. 5 minutes. I will just because I said, do you not think you could have gone somewhere else? Not being funny, but you know you've just brought 2 traumas. All my nurses are in CT. We're just round the corner. There we go.
It is that time of the morning, isn't it?
So, guys, this is an unknown adult male, approximately 1 hour ago, was found collapsed in the street, unconscious with a head injury. He was GCS 7 with us. He's had an RSI for his decreased GCS, pank time at 3:52. He's had a total of 3 milligrams of morphine.
An hour and a half after being stabbed at his sister's birthday party, Jamie has returned from his scan to find a much busier resus room.
Okay, guys, you happy with this ventilation, John?
He hasn't seen his dad since they were both attacked.
Thanks.
You back from CT with him? Thanks very much.
Oh, no. Well, I tried to have a word last time. You need to go down there, mate, please.
That's my dad.
No, it's not.
That's my dad.
It's not. It's another patient. Honestly, he's down in Bay 5. Do you want to go and have a look?
Okay.
It's another patient, darling. I've just told you. Your brother's in there and your dad's in 5, yeah?
Can I ask you a quick question?
Yeah. What?
Do you want us to CDU2, so we've got 1 patient in?
Yeah.
But there's people coming up 3.
It's standing up on the trolley, peering over into cubicle 2. Do you want to sit down now, please?
How's he doing? Is that my dad next door?
No, it's not your dad. Your dad is in Bay 5, and I told you could go and see your dad.
No, thanks.
Sit down now.
No, thanks. Can you not be mad? Can you
Sit
not
down.
be rude, please?
Listen, mate, I've got 5 patients that are really sick in here, including your brother and your father, and I've told you where your dad
understand the
is.
situation I've gone through tonight, yeah? I don't want to be rude
Right,
or
come
anything
here.
like that.
Put that bottle down. Listen, and don't be peering over the top, mate. This bloke's really not very well.
I know in the hospital at one point, Jamie had got quite stressed because he wanted to know where his dad was. He was very worried that something worse had happened and people was hiding it from them.
It's not. I thought we done. And I told him that it's not your dad.
And everybody was very, very stressed. So, yeah, it was a difficult night, that one. It was difficult to manage. When you've got a massively busy department, I think you have to show an exterior that you're a little bit hard.
Can you blame me? No, don't you
sit down. No, I'll take your piss pot.
You know, if you don't mind, let's have a bit of privacy. Get back in your cubicle.
Yeah. Thank you.
It's all looking quite busy suddenly here.
With so many patients in resus, there are no senior doctors available to the rest of A&E, leaving the less seriously ill patients with a wait.
Got some gloves? Why are you taking them? I won't put them on.
Because, all right, are we allowed to do this?
What are you going to do? Take them back? Why have they put us in here unadvised? There's so many things to play with.
Oh my god. If I could take a picture, like. Oh my god, it actually fucking hurts. It says, how are we doing? You're doing shit.
They're not doing shit, they're trying their hardest. Someone pissed in the seat.
Oh my god. I don't. Oh, it's so bad. Fucking hell.
Okay, hang on. I'll get back to you. Okay.
You've got 2 patients in minors that want to know what's going on, apparently.
I've already told everyone down in minors that no one's...
No worries, no. I mean, we're down on staff and I've got 5 patients now, going to be 6 in here, so I'm really not going to spare a member of staff out of majors to go in there.
This is ridiculous.
There's no point, like, let's just go.
The girls from the fancy dress party are still waiting to be seen. They've been joined by a university friend.
Is there any doctor free after seeing anyone else? A doctor who can literally just look at the car and be like, it's not made up, she can go home and see tomorrow morning.
It's as simple as that, because she's been seen already by the specific doctor.
Been seen already.
She hasn't been seen.
No, but she hasn't been seen.
She's been, what?
She hasn't been seen by anyone.
It's fine.
Literally, no one's seen me. Let's leave.
No one has seen her.
Yeah, the doctor already started writing you.
What, saying what?
She hasn't written anything. So she's going to see you. Sorry.
In what,
She
like
said she'd go to see me in
hours?
half an hour and I've been sitting there for like
ridiculous.
Well, it's up to you. If you cannot wait, I'll just let you sign a, you know.
Well, at the end of the day,
Okay,
fine. It could be your fault.
It's not about signing a release form or anything like that.
What we're concerned is the head injury. That's the thing. So it needs to be seen by
But she's
the doctor.
quite evidently not concussed at the
But
moment,
still,
so
the
I don't
doctor
understand why
has to
she's not
see
being
her.
seen.
The doctor has to decide.
Is there any other doctors free or not at the moment? At all? Any doctors at all? What, you have what? Every doctor is
Have
in?
you seen any doctor here?
No, we
One
haven't
there.
seen-
That's
over
what I'm
there.
saying. Well, that's Max Fox. It's not any doctor.
So he can't literally look at a cut and be like, that's
She just needs a tiny bit of glue.
So there's no one actually qualified to do this right now. Okay.
I've never had to wait for anything.
Nothing, my dad. Just go and stick my hand up, done, out again.
Exactly the same thing. I've never had to wait for anything, but you know, you've got to like.
I can bring my dad up. I can bring him up.
I think actually we might move these two next to each other. And then everybody's happy, yeah? I told your brother that he was in Bay 5 and peering over with someone who's intubated and not... I know, but it's not, you know, come on. I would never lie to anybody where their dad is, would I?
I think we went through something together that night. It happened so quickly and it was so serious. There's just a massive reality that, you know, this could be it. This so quickly, in a matter of seconds, you know, 2 members of our family could have just been taken away.
It's difficult because you've been drinking as well to know what the amnesia is due to, if it was due to the alcohol or to the head injury. But I'll come clean that up and we'll just glue that. There's 4 traumas in the stroke, like all in the last, like, I don't know, they all came in when I was doing this place. Really crazy. Everyone's everywhere.
I think everybody deserves to be looked after and loved and cared for. Some of the things that we see, some of the things that we do, that can make you a little bit, you know, what's the world coming to? Why does it have to be like this?
Thank you. Thank you so much. Thank you.
You know, I do feel sad sometimes that people aren't always what I would like them to be. But I have to think that it's not everybody's like that. You know, there is good and bad in everybody. And then you save someone's life, and it's absolutely amazing. There's no better feeling.
Catherine, the 21-year-old birthday girl, has had a dramatic change in condition. After 3 hours in A&E, she's woken up and got dressed.
Yeah, she's just sitting down in there. She went to the toilet by herself.
Okay.
She wants to go home. She doesn't want to stay here any longer because they need to talk to you just quickly, and they can't talk to you out here.
My face.
I've got moisturiser here.
I don't know what's wrong with my face. It burns a lot. Get it off, get it off. No, it burns bad. It burns bad.
I'm just gonna get some toilet paper, just 2 seconds, okay?
He's basically been crushed between a cherry picker and a parked car, and he's managed to have his chest and his abdo and his pelvis all kind of crushed in this single motion.
You'll still find people that think, well, I'm only just nipping up the ladder, so yeah, I'll hold a cup of tea, a drill and something round my neck with one sock on and a flip-flop.
You were cleaning the window?
Yeah, cracked a glass and went through.
Oh dear. What happened here?
If you're a carpenter and you've got all your fingers, you're not a good one.
They slip on the flip-flop, they spill the tea that scalds them, the drill goes through the head and they break a leg when they fall. They really think, oh, I shouldn't have really done that, should I?
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Maybe 20 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Camino.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Okay, we're going to go on the R of roll, okay? Come on, to be ready, brace and roll. We can have a bucket for him to be sick in as well. Ready, brace, roll.
The resus room is central to all emergency departments. It's where the most seriously ill patients are treated.
Hello, Kings.
What are you scared of? My patients becoming ill or more ill or dying. You know, if a patient does die, you just go through it in your head, you know, have I done the right thing? Have I done something wrong? It's terrifying.
Adult trauma call in 15 minutes.
Right, this is Tom,
Yeah.
77-year-old man who is up a ladder
Right.
over the stairs in his house painting. He fell off the ladder head first, right down, it looks about 10
So,
feet.
yeah,
He's knocked unconscious. We were on scene quite quick, so probably maximum 3 minutes.
Right,
He then came to, confused, grabbing out.
Malcolm is the lead trauma consultant on duty. Today, he's responsible for every major trauma case that arrives.
So we're happy with airway? So airway is patent, trachea central. Does he feel sick at all?
He was up a ladder over a stairwell painting and has fallen approximately 10 foot onto his head.
77-year-old Tom Gibbs is one of 14 people who will arrive in resus today.
Things any?
Yep.
All with just a few minutes warning.
Okay, lovely. Thanks very much. Bye. Code Reds from HEMS.
HEMS red phone, 5 minutes.
Sorry.
HEMS have just done a pre-alert for code red blood, but they've given us no patient details, so we're just getting code red blood now. We're waiting for the phone to go again to then start the trauma call. So
Do we know anything about the trauma call as well?
Nothing.
Let me just phone the control desk first of all, because I want to know more about this.
No, and basically we're getting 6 of blood up here now.
Yeah.
And FFP as soon as we get them.
Wonderful. I've got a HEMS called Code Red coming in. Yeah, hi, it's Malcolm Tunnicliffe, the trauma consultant at King's College Hospital here. I've had a call saying HEMS have declared a Code Red. They're still on scene. Are you able to give me any more info at the moment? Okay. Lovely. That's fine. That's really helpful. Thank you very much. Excuse me.
HEMS, or helicopter emergency medics, handle only the most serious cases.
HEMS are just loading this patient now. There's a guy who's been hit by a bus. He's sick. All right. Can we just pre-alert theatres that we may, if they could keep a theatre free now? We've got quite a juicy one coming in a minute.
Fear of making a mistake makes you not cut corners.
Hello, King's College Hospital. Hello, it's Malcolm Tunnicliffe, the trauma consultant here. Hi.
Bankers, lawyers, so on. Yeah, of course they've got an important job to do. But I tell you what, I'd rather face the fear of losing £1 million on the stock exchange than of a patient of mine coming to any harm. That's pressure.
OK, can we put a trauma call out now? They're 6 minutes away, but put it out for now. He's got chest, abdo and pelvic injuries. He's been entrapped by the bus.
Is it hands?
Yeah. OK, Katie, can I have 2 units of blood run through now, please?
You splash paint all up Jane's settee.
What?
You had the paintbrush in your hand. And then you fell, it was all on the floor when you fell onto the paintbrush.
Really other damage?
No, only where you tried to get up and hold on a radiator. There was blood all down the radiator because she was absolutely covered in it. All on the floor where it was pouring out your nose, out your mouth. You know who we are, don't you? Sorry?
He
didn't hear you. Do you know who we are, I said?
I know who you are.
Yeah.
I know who you are. Oh, right, done all the awkward bits.
Sorry?
So we've done all the awkward bits.
Oh, remember, you've done all the awkward bits, he said. Yeah. Are you hungry? You hungry?
HEMS have requested code red blood. All we know is the patient's extremely sick. They've been run over by a bus.
Juicy one. Juicy one, come in. Big guy been run over by a bus, actually run over. Blood's being teed. I'm going in number 1, Jackie, but I'd like the surgical consultant as well, if possible.
The trauma team have 5 minutes to prepare for the arrival of a man run over by a bus.
Yeah, it's quite a sick guy coming in. Jackie, what we'll probably need as well, I would guess he's been thoracostomised. So if we get 32 French chest drains straight in, if possible, as well after your initial assessment, yeah? One either side.
Hi, switchboard. I need to speak to Mr. Halal, the surgical consultant on call.
We had one guy that was riding his motorbike. I remember this is the first big, horrid trauma call that came in when I was a junior nurse. There was a guy on a motorbike, was riding it too fast, and he came off his bike and he was thrown quite far, and he hit the divider down the middle of the road. It used to be like giant corrugated iron,
like a bendy piece of metal. The impact, basically he amputated his leg from just above the knee, clean off, no leathers on. And he just hosed out over the floor and arrested in the road from massive hemorrhage. And he was resuscitated for ages and ages and ages, but he'd lost so much blood that he died. And I remember having to put him in the body bag and his leg went in the bag separately. And that was my first kind of realisation of major trauma.
Helena, we've got a young man coming in who has been run over by a bus and entrapped. He's intubated and ventilated. He has chest, abdominal and pelvic injuries and is cardiovascularly unstable.
Thanks. Right, Malcolm.
Yeah?
I've left him a voicemail.
So Savas who's on, so Helena's just going to try and go there. We just speak to that. Jean-Luc probably on the end of that. Just so we can have an extension for him and we can get hold of him. Yeah.
Just as a phone call.
Resource sister.
Make sure there's nothing there. And straight in.
Hello. Hang on a sec. Is everyone here for the team?
Betadine on. Yes, thank you, Leanne.
Yes, thanks. Bye.
Okay.
Someone else is doing that, yeah?
Yeah.
Where did Sharon go? Here we go.
Straight in here, please.
Sharon, are you scribing?
Okay,
Me too, are you scribing?
Right, we'll have to keep you another trolley in.
Okay, blood on the left arm, okay? Peter.
Cross ready.
Okay, far away.
Guys, everyone listen. This guy is approximately 30 years of age. He was hit by a bus going approximately 15 miles an hour. It bullseyed the windscreen and then was trapped, folded in half under the front of the bus. GCS 13 at sea, losing one for eyes, one for voice, moving all four limbs. Injuries, he's got head injuries with a right periorbital hematoma. He's got a right side flail chest with surgical emphysema. Definite pelvis, degloving of the left anterior shin and foot, and an abrasion to the right shin. He's had a rapid sequence induction with a pank time of 14:45, had 2 of morphine, 2 of midazolam. He has had 50 of ketamine. Immediate needs, blood, more IV access, and possible surgical control of bleeding.
Lovely, thank you very much. Okay, Peter, happy with the tube?
No, not yet.
No. Okay, Jackie, talk to me.
Right, heart rate is 154.
Thank you.
Jesus Christ.
Peter, happy? Okay.
You just take that on and then I'll relieve you.
Everything Malcolm does in the next 15 minutes will be solely to keep the patient alive, so he can be scanned and have his injuries assessed.
Outside that door, there's some folding screens. Can you just put
minimum
one more across them doors so
Okay,
people can't see straight in?
put tubes in both sides. Yeah.
On the right.
Gareth, just put your finger in there, just see if he's up that
I'm
side
not getting
as well.
blood pressure.
We've got a drain coming.
Some things are irreparable. Some people come in and through the door and, we try. I could do that.
Ramilla, we just fast scan, just see if you can compartmentalise where the bleeding is. If there's nothing in his belly, we'll go to angio. If not, we'll go to theatre if there's a lot of blood in his belly.
I think it makes you see how fragile life is, definitely. 1 minute you're walking down the street or you're going around Sainsbury's with your trolley, next minute you're in the back of an ambulance. It can happen just like that.
Squeeze that. And can I have another 32 French drain?
Thank you.
You can connect.
Need to cut. Just cut. Yeah, thank you. And another underwater seal, please.
Do you want it now? Me to give it?
Yeah. Got that better,
Lovely.
Can you pass me that other tube?
Right. Malcolm, shove that in. Oh, you got his tubes in.
Got tranexamic acid. Yeah.
Can I have a pair of scissors? They've all got scissors.
Okay, left drain is swinging there. Can we just ring 5620? CT should be ready. And angio. It's got no obvious blood in his belly. So we'd like to go up head to toe with possible angio, okay? Okay, good.
Can you put a three-way tap
Yeah, please.
on that line?
Guys, we're happy he's got a tube in. We're happy both drains are swinging. Okay, we've got access, we've got blood.
the end of this line.
Okay, what I would like to do ASAP is go up to angio, okay?
Don't squirt that in my face, please. You've done your code red visits?
Yeah. Yeah, we haven't got any bloods off him yet
Is
anyway.
that monitor
Just
over for
got
me?
code
Get on
red.
here. He's dropped his blood pressure
Yeah,
now.
I know he has. Yeah, go.
What do you think he's...
Go.
You coming with us?
Yeah.
Got 2 units.
What's that?
Sounded like you were saying see you later there. I was just like, what?
Should be no sharps in there.
Come on, Jack.
No, we're just going to go through this way.
Well, we're going to we're looking at CT first.
Got it. Sorry.
Another housekeeper, Sabrina, toss with the yellow mop bucket, please.
Yeah, just keep squeezing the blood. He's going to need all of it.
I can't walk. I'm in here. He's hit by a bus.
Right, one Jack. Thank you.
Anyone bleed surgeons? No, thank you. Yeah, there was blood on the floor and that bin will need emptying, please.
Sharon, the FFP's gone up to first floor CT. They're sending another 2 units when it's defrosted.
Okay.
What's that on my back?
Turn round, darling. Oh, I don't know. You look like you've been run over.
Oh, no, I feel like it. There's nothing new there, though.
Yeah,
See what's happening there.
He's got a nasty fractured pelvis. It just gone.
Yeah.
Which is good.
Is that 20 minutes?
Yeah, not even that, was it?
Still waiting for all your things to come up. Still waiting for all the x-rays and things to come back, what you had done.
It's been 2 hours since Tom Gibbs fell from a ladder while decorating his daughter's home.
Oh. Oh. Very busy in here. It's very busy in here. After he retired, he used to drive me crackers because he just didn't know what to do with himself during the day. We used to do the decorating between us. if I hadn't done it first. It's painting, he doesn't like painting. He's not very good with painting. And that's what he was doing when he fell down the stairs. We had to stop and start with you, bringing you here. Was it 3 times? Yeah, 3 times. We had to stop the ambulance in the road for them to come and see to you. Because you were sick. And they turned you over and you wanted to get up and they said, no, you can't. If you hadn't been tied up like this, he'd have sat up like he did. I mean, we had to fight to keep you on the floor in chains. You wanted to keep getting up. So I held you down. Got my own back on you.
You should let me get up.
No.
I'm not very good with heights. So we arranged for him to come over that day and to help me to paint up the stairwell. And fortunately, he didn't have the ladder completely positioned on the stairs properly. And I went to say to him, don't move. And as he turned around to look at me, the ladder spun, wedged across the stairs and threw Dad over the top. And down he went, head first. Completely silent, not a sound came from him. And he hit the bottom and that was it. He just completely knocked out for about 3 minutes. And I thought he was dead on it. Yeah, I thought he was dead actually. He hit the floor and he just didn't move.
All right. What's up? What's hurting?
My ribs.
Hey?
My ribs.
Your ribs?
Yeah, I think they might be cracked, Dad.
Is that the first time you've had to think about it?
Yeah, I think it is, yeah. Dads are not supposed to fall down the stairs or have accidents or ever die. They're supposed to be there for you forever. That's the way it should be. And we know that the life cycle says, you know, obviously your parents are going to go at some time, but we're not ready for that. We don't want to think about that. We just think they're going to be there forever.
Tom, what this scan shows that where you've hit your head, you have a tiny bleed just inside the skull. to be staying in for the next 24 hours because we need to...
You've got to stay in, yeah, you've got to stay in for the next 24 hours, just to make sure that you're okay.
We like fussing.
They like people to practice on. Look, you mucked up all their things you have bleeding all over them.
Take that for your sleep.
Hello, King's ED.
Guys, absolutely brilliant effort, okay? Really, really well done. Okay, we know what his source of hemorrhage is now. It's really good.
Which is? What is it?
This is pelvis, this is the bony injury.
Scans reveal the man run over by a bus has suffered massive internal bleeding.
Okay, so that's fine. Yeah. That's absolutely fine.
In the short time he's been at King's, he's had his entire blood volume replaced.
Oh, that's his flower segment. Oh!
When someone does die on your watch, how do you deal with that?
Do you know, it varies. When a patient has been in hospital for a while, you can prepare the family that the worst is going to happen. But the vast majority of people we see who die, it's completely unexpected. One thing I think you have to be in every case, you have to be brutally honest when speaking to relatives once you know who they are.
Thank you. Bye.
You've got to say to them, your husband, your wife, your child, your mother is dead.
Adult red phone in 6 minutes. That's adult red phone in 6 minutes.
Jackie, if I give you some money, you wouldn't give me a sandwich, would you? If you're...
I'll get you one over there.
Do you mind?
Next
Oh, that's good, idea. Just an egg one or something. Hello, darling, only me. We're having absolutely fun and games with trauma. I'll fill you in a little while, bye.
We need to give him some IV absmount because he's got a really nasty compound degloving on that side.
Yeah, okay.
Should we wrap this up with something
In
then?
fact, can we put a thing on it not to be removed until reviewed by ortho consultant?
Right, let's strip him off and sort him out.
Hello, Dan. Yeah. In a way, it's sort of good you've gone to your mum and dad's because I had fun and games with trauma and I won't be leaving for another hour. We've just had a 30-year-old guy brought in by Hems about an hour ago. Been hit by a bus in Elephant and Castle, folded double, conscious while he was folded double, extricated. Well, if I say to you his pelvis is like a jigsaw puzzle, you can imagine what it's like.
The next arrival in resus is a cyclist.
That means we're getting to number 4.
He was found alone and unconscious in the road.
Look, I'm gonna have to go. I'll give you a bell in a little while, okay? All right, bye. Okay then, guys, let's have a listen to Roger.
Okay, this is a 40-year-old male, mechanism injury, fell from bike, apparently isolated head injury, combative, moving all 4 limbs with a blood sugar of 5.2.
Okay, thank you. Okay, can I have a listen? Helen, can you have a gentle feel of his pelvis and look at his scrotum and external meatus as well? Thank you, Nola. I haven't bloody eaten all day.
Oh, hello, my name's Ed. I'm one of the nurses at King's College Hospital Accident Emergency Department. I've had a patient brought in after a bike accident. We found this number in his mobile telephone, and I was wondering whether you could give me some details of his next of kin.
He's got no significant injury to his brain, but he's got very complex fractures to his face. He's got collapsed lungs both sides, which have been treated.
Staff are also beginning to piece together the identity of the man run over by a bus. His name is Theodore.
He's got, quite honestly, the worst pelvic fracture I've ever seen. It is in bits. So he's reasonably stable at present, but still life-threatening, and he'll be life-threatening for days.
Okay, fair enough.
But we've done everything we can for him.
He's not coming up when we're talking to him.
No, he's not
talking
to you. So just to keep you...
Yeah.
Does he have any relatives, do you know?
We're just in the process of finding out. He's a student at London School of Economics.
Right.
I'm doing checks at the moment with them to see if we've got next kin details and an address for him.
Where's he from? He's got an unusual...
He's Greek.
He's Greek? Okay.
Yeah, he's Greek national. He's got a Greek ID card, a Greek driver's licence with him.
OK. And how old do we reckon he is?
97% day birthday, 33.
So he's only 33. OK, that's brilliant. Superb. Thank you very much.
Theodore's family are 1,500 miles away in Greece.
My mother called me and told me the bad news. I asked her if he's going to live, and she responded me at the moment, yes, he's alive. But I didn't like that word at the moment. So I knew that it was a very serious accident. Theodore is the most important person in my life. He's not just my brother, he's my buddy and my friend. First of all, I was worried that maybe I couldn't see him alive, but I just want to avoid that thought. That's why I keep telling to myself all over that flight, 3 hours, that he's going to be okay. I didn't want to think that I will stop to have a brother. I didn't want to think that.
You're right. It's William. Does he like to be known as William or Bill? Yeah, or Will.
Will?
Yeah.
Hello.
4 hours after falling from his bike, William has yet to wake up fully.
Can you squeeze my hand for me? Squeeze it tight. Squeeze it tight. Okay. Do you know what day it is, Will?
It's past 12.
12:30. Okay. Do you know where you are at the moment? Will? Do you know where you are at the moment? Yeah, where are you? Tell me. What place is this? All right, darling. Don't worry. He was extubated quite a while ago.
Yeah.
And they were making his GCS13, but he's not obeying commands at all now. Won't squeeze my hand, stick out his tongue, nothing like that.
Not very good.
No.
Let's have a look, shall we?
Thank you very much.
Clemens Paul, I'm one of the consultants here. All right. Hi. I'll just have a examine him. May look a little bit cruel because I just will need to stimulate him a little bit to really, to really see what he's able to do. I mean, if you don't want to see it, maybe excuse me 5 minutes. It's just, I just, go and poke him a little bit deliberately so that I can see how far he wakes up. Is that all right? William? William?
Yeah.
All right. How are you? All right? Okay. Any headache at all? No headache? No. William, I was told you don't know where you are. Do you know where you are at the moment? Where's that? What's that?
Translate.
What day is it today?
Tuesday.
No, not quite. Which year?
What year are we in?
2006.
All right.
I'm going to let that all kick in. Okay?
Can't even remember falling. Normally you think, oh shit, like, I've never even done that.
You can't remember because you've got concussion. That's why you can't remember.
You won't remember, say in a day or
When
two.
you hit your head and you get concussion, you don't usually remember the accident at all. That's why. No, that's why. Don't worry about it. You will do.
Stupid thing. But all her weekend up now, isn't you? Yeah.
No.
Do you want to stop him from climbing up any more ladders?
No, I wouldn't do that. But I'll make sure that I'm there, holding the ladder while he goes up it. Because he's the one and that's it. Did they cut your trousers?
Yeah, they cut the clothes off.
You've lost your...
working trousers.
Yeah, you've cut your working trousers off you.
There, Dad, add them onto your list for Christmas.
Oh, it my jewellery at all?
Yeah.
Yeah.
Side of your face.
Well, not half you didn't. Eh?
What, this side? Yeah, what you've hit is your cheek. It's like...
It's a wonder you didn't break your cheekbone, I tell you.
Yeah.
Yeah.
How long have you been married for?
60 years this year. We've got one problem now, and none of us wants to die first. Leave the other one behind.
What's that 40, 81 and that?
That's measuring probably his heart rate.
Doing all right, is it? Yeah. I try and keep off that subject because I don't like that subject. I don't even think about it. He's going back to a normal colour in his face now. You can't go yet anyway. I want an anniversary card off the Queen for 60 years, be married to you. So you can't go yet.
You know, when the summer comes and we get out in the garden, we'll probably still be getting up trees and cutting the branches off. And probably get a lot of... shouldn't be doing that, but... Where do you draw the line? You know, when do you suddenly say, I'm too old to do that?
Son, I'll give you a full rundown in a second, okay? You happy, Katie?
Yeah.
Peter?
Ready, steady, and down.
Beautiful. Well, I'm now going to clean his face up while we've got a little window.
3 hours after Malcolm should have finished for the day, he finally hands over his patient, Theodore.
So, this is 33-year-old Theodorus. He's a Greek national who's a student at LSE. He was crossing the road at Elephant and Castle when he was hit by a double-decker bus, not sure what speed. But at scene, he was found to be bent double under the front of the bus. His head was touching his toes. He was conscious and extricated.
Yeah, quite often you go home after work and you think of a patient. Have I done the right thing? Have I done? Sometimes I'll go home and I'll ring someone who's at work and say, look, I don't think I've done the right thing here. Can you just check something for me, or can you do this test for me? Or can you just check something out for me? And more often than not, I said, no, it's absolutely fine. Don't worry, but it's just that thought that comes into your head. Have I missed something? Have I missed something?
God.
Really good job done by everyone here. He was in CT in 10 minutes. Katie? Superb.
Oh no, but I've got that bloody...
Superb.
Tomorrow, is she?
Superb.
What?
Brilliant.
What?
Yeah.
We're not going to X-ray, we're doing them here. We've changed their minds.
Thank you. Clem, can you tell his educational supervisor and anaesthetist whoever? Good job.
Did you know today is the 25th birthday, official birthday of Haribo?
No, I'll tell my wife. She likes Haribo sweets.
We're kind of a jack of all trades, really, aren't we? We know a bit about everything. You know, it's the first bit when you come in the door, what needs doing then, and then after that, we pass it on. We pass the rest of the care on to somebody else. We never complete the care, you know. So getting them out of A&E alive is only a small part of it. That's the best bit. Obviously, that is no guarantee that they're still going to live.
You care, and you've got to show you care. And if you didn't care about what you were doing, well, what's the point in doing it? I don't know that fear ever goes. I don't think that fear goes from when your first day as a doctor to your last day as a doctor.
I remember that I asked the doctor, stupidly actually, does he going to walk again? He looked at me and said that at this moment we're fighting for his life. It's not that important if he's going to walk again or not. And then I realized that this is a very serious situation.
It's now 9 hours since William hit his head coming off his bike.
I haven't seen a concussion that good since my brother came off his bike.
Can you wake up, Will? Will, can you wake up for me?
Concussion can leave you quite confused. Your frontal lobe hitting the front of your skull, and that's where all your personality is, and your behaviours come from. Your inhibitions are all in the frontal lobes.
Hey, Will. How you doing? Where are you at the moment?
I'm in room 5.
Okay. What day is it?
Not good.
It's not a good day. You squeeze my finger for me? Good, that's a bit better, isn't it? All right, mate, lie down, that's all right. Have a bit of a kip, yeah?
Yeah, but it's
all right.
It's because I didn't sleep very well, so I can sleep this well and stuff.
Oh, you sleep as long as you want, all right, if you didn't sleep very well.
Oh, I'm actually asleep.
Are you actually asleep? Well, you're actually in the hospital, sweetheart. Both him and his wife were such genuine, lovely people, and it was an accident that came completely out of the blue, which is shocking for everybody who's involved, you know, and I think when it's like that, I feel that I have to step up to the mark and do my best for the patient and the relatives at the time, because it's scary. Your face is a bit bashed up, yeah?
So tell me, was I let me run upstairs?
Don't worry about running upstairs, darling. And do you know what year it is, Will? Can you tell me what year we're in?
2007.
2007. Well, we're getting up there. We're getting there. People that have head injuries, they've had brain shakes. Their brain doesn't work the way it should do. Do you know what I mean? That doesn't mean that there's something horrendous going on there. It just means that they've had a good shake of their brain, and it's just, they just need to go to sleep and recover. But unfortunately, we have to keep waking them up to try and assess what their conscious level is when they are awake.
Will?
Hello? What's happened to you today? Well, hello? Can you tell me where we are?
Will, stay awake. You're in King's College Hospital. You're in the hospital. What do you think my job is? What do you think I do? Well, I'll tell you. It's to get things ready. Yeah? Okay.
It's important to me how I treat people, how I behave. The fact that I can't remember is a concern. Is a weird experience, just not remembering for quite a reasonable period of time. You know, a part of your life which is a very sort of dramatic and important part of your life.
Okay, but once the swelling settles down, you should definitely go back to normal appearance. So the swelling will your face will look the same as it was before. Okay, no big changes. What you need to do is just also be careful with every time you sneeze or you have to blow your nose. You probably have to sneeze by keeping your mouth open, okay, to relieve pressure on your eye. Otherwise, if you sneeze or blow your nose quite heavily, you will definitely have, you know, a big puffy eye. Okay?
He's not going to remember that.
He's not going to remember.
No, he's not in processing the information correctly. Sure you're not. What did the doctor just say?
This doctor.
That doctor?
This one here?
Yeah, what did he just say?
He just said I was staying at King's Cross.
Right, so really, come back tomorrow.
There's something going on there, love. And it's really sore and it's lumpy. Oh, you're going to dig that in? What? What? There is something in there, isn't there?
Have you not got any gardening gloves?
Ow!
Sorry.
I thought he was out.
Remember that time I asked you to do bloods at 9:30? You said don't start till 10 o'clock.
Oh, is that it?
That is it.
Is there more?
See that massive, huge splinter? That, I reckon you're going to have to take a bit of time off work.
I need a thumectomy. Jeez. Well, I knew I was right, seeing my senses.
Give it a wash.
I washed it.
You knew you were right. You said you got bitten by an insect.
Well, I said
It's a
there was
splinter.
I said I was either bitten or there was
one of those. Wound care.
You stop taking the mickey.
A splinter. It was like enormous. It was like it was like a match.
It kept me awake because every time I moved my hand
I'm not joking.
and I hurt.
The smallest splinter I've ever seen in my life. Even my son having that in his little toe wouldn't have moaned.
Listen, but it's just that my pain. I'm quite sensitive. That's all.
How do you actually do it so it goes?
You nearly had my eye out. Don't.
Oh, I see it. Back, book her in again. I think with injuries and illness, things like that, we're not very sympathetic, especially if you work in A&E.
Look, she don't care. She just walks on off.
I remember my little boy, when he was 3, I took him to school, nursery, limping for 3 days when he said his foot hurt. And I was like, you're OK. You know, eventually I took him to A&E. His foot was broken. I took him to school for 3 days.
Yeah, Jen, so this boy comes in yesterday.
Yeah.
Greek guy, student at LSE, crossing the road at Elephant Castle, hit by a bus, folded at his waist. Gareth Davis from Heaven said his head was touching his toes, conscious.
The fork broke on your bike. Do you remember me telling you that?
Oh, yeah, so am I going to survive OK?
Yeah. You just have a little problem with your memory at the moment because you have a concussion. Because you hit your head.
God, that's bad luck, isn't it?
It is bad luck, yeah.
All patients are vulnerable to an extent.
William, I'm just going to shine a light in your eye, OK? So I'm just going to shine the light. No, OK. You look at my... Can you just look at my forehead? No, don't cover your eyes with her because I need to shine the light in there. OK, here we go.
In terms of their care, it is in our hands, and it's in our hands to make sure that it's done efficiently and that people get what they deserve.
Well, I can take a bit of a knock on that one.
You have, yeah.
I think when you're a nurse and a doctor that you have to realise your responsibility to a patient, and the day you lose that is the day you need to reassess your motives and what you're doing. Because it doesn't matter what walk of life somebody comes from, there is a time when we all need somebody to stand up for us.
So am I going to,
Well, we're going to keep you in.
OK?
Yes, you will.
Will I recover as my breakfast or...?
Recover as your breakfast. Does that make sense?
Let's just get this right.
Do you know where you are? What's this place? Didn't I tell you where you were?
I was absolutely fine, and I must have had a fall.
You did. But where did I tell you were? I told you we were at King's College Hospital.
Oh, yeah.
So where are you?
King's College Hospital.
That's right. So I'm going to ask you now in a few minutes again, and we'll see if you still remember that, OK?
I wasn't in a position to make a decision, or probably even conscious or who knows what at the time, so I'm really glad that there was someone who was really connecting to my situation and really making sure that everything was done possible for my well-being, which for me I'm really moved by, and I think that really is fantastic, and I'd like to thank that lady.
William?
Yeah?
Where are you?
Where am I?
Yeah. What's this place?
I'm in hospital.
Right, good. Which hospital?
I'm King's College Hospital.
Very good. We're getting there.
smashed pelvis. Smashed. I'll show you the pictures. He was found by hems folded in half. So, I mean, he's detached the right hemipelvis from his sacrum, hasn't he? It's just, I don't know how they'll put that together at all.
It's a little bit wild to owe your life to someone you don't know who he is. I don't remember nothing from that day.
How long after the accident was it when you were awake and you could understand?
Well, my accident happened on 19th of November. And I remember having, you know, my first thoughts in the middle of December. You know, a whole month was missing for me. I think that in doctors, I own my life. They saved my life.
Somebody upstairs loves you, Theodore.
Yes, I meet him. I went and I come back. So yes, someone is upstairs and he's very kind with me. He was very kind with me. And it still is.
Hello. Yeah, not too bad. After yesterday, trauma. That guy, I thought he was going to die, but he's doing all right, actually.
Is he?
Yeah, I've been seeing him on surgical critical care. He's still intubated, got a pelvic X-fix on, but doing okay, actually.
Saved a lot.
Oh, so you don't often think you made a difference. I think we did. I think we all did yesterday.
You love it, don't you?
Yeah, I do. I don't deny it. Why should I deny it? It's extremely satisfying. It's extremely satisfying. But then it's my job. That's what I'm trained to do.
Bumholes. Hello, King's ED.
I'm such a moron.
I'll try my best to sort of just bring it together and close it up.
They think that we can just put them back together brand new, that we've got spare parts in the drawer.
When they pop your eye out and it's hanging down, yeah, that's what they do, seriously.
He's 31 years old and a motorcyclist. He complains more pain in the right testicle than the left testicle.
Look like a purple carrot. I can tell you that much.
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
one of the busiest A&E departments in the country.
They're a bit busy right now. Try to call them a bit, 15 minutes, 30 minutes.
Kings is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department, in just one 24-hour period.
Camino. Everyone should walk through an emergency room at least once in their life, because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love. And the fact that 1 minute they might be there and 1 minute they might be gone.
Hello, recess.
Red phone trauma call, resus, ETA, 8 minutes.
Yeah. Red phone on recess, 8 minutes.
What's that mean?
ETA, 8 minutes.
There's a resuscitation coming in. Red alert.
What's that mean?
Something very severe.
Shot, stabbed.
Don't know, it could be anything, couldn't it? Could be heart attack.
Pediatric trauma call, 8 minutes. Pediatric trauma call, 8 minutes.
I've one going to FSU, one going to CDU. I just need all hands on deck.
I guess the things that I find difficult to deal with, and I hope it's not a young child. And I think most of us find dealing with critically ill and injured young children a challenge.
Has that neurosurgery read?
Resus, hello.
Yes, hi, it's Chris Lacey, the trauma consultant. Just to give you the heads up that there is a young 11-year-old being brought in by HIMS who's GCS 11 on scene, RTC 30 miles an hour. Lovely, thank you. Bye. No, not yet. 11 years old. The 11-year-old.
Status update. It's now face, chest and tib fib injury.
Okay. Face, head, tib and fib. We have anaesthetics on site. We've alerted neurosurgeons and we've got fluids drawn up. Okay, have you got your kit ready, John? You happy? Yep.
The number of staff called to a trauma depends on the severity of the injury.
Airway doctors, breathing doctor, C team. Okay, everyone knows the history, everyone's happy? Okay.
In this instance, 15 people are waiting to treat the young boy about to be brought in.
So you guys are going to be doing most of the talking to the child if there's any talking to be done. Sounds like they're coming.
An hour ago, 3 friends were racing home. One of them ran out between 2 cars and into the path of an oncoming van.
Okay, day 3, please. Good evening. Okay. Do you have a name for the child?
Kofi.
Kofi, okay.
Are you leaving?
I am, thank you.
I'm Mark.
Hi, I'm Chris.
3, 1, 2, 3.
Okay, listen up.
Okay, guys, this is Kofi. He's 11 years old. Approximately 1 hour ago, he was a pedestrian versus car. Seemed to be thrown approximately 20 feet against a wall with LOC. Injuries top to toe. He's got an obvious head injury, laceration over his forehead with underlying skull fracture, obvious facial injury with a lip laceration and avulsed teeth, a closed left tib fib fracture. He's got a tender right chest wall. His tummy is soft, his pelvis is symmetrical, long bones intact, stable en route. I guess he needs his airway secured and a CT of his head and body.
Yep. Lovely, thank you very much. He's got a good femoral pulse, I can't feel a rate.
Can we get Max?
Fine, okay, I'll talk to Maria. Thank you very much. Maria, can you call Max Fax, please? Thank you. So, from primary survey, priorities, airway? John?
There are sort of loose pieces of teeth and bone in the upper airway with a cleaved upper lip. So basically, I'm not sure, it looked like there might be some teeth in the back of the throat.
Okay, John, are we going to protect the airway? If there's loose tissue there or teeth, can we save it, please? Have we got a sterile pot in case there's loose teeth, please? Yeah.
Hello? Hi, got some bad news for you, man. Got some bad news for you. Yeah, Kofi got knocked over today. It's not in a good way. But I say he's not in a good way physically. So, yeah, he's got broken leg, broken arm, head wound. They're going to check it now to make sure that he hasn't fractured his skull. Yeah. Yeah. When Kofi was born, he was my first boy, and to look down and see I have a son, you know, was amazing. And I always remember the first thing that I did with him, as I took him and I held him up in the air and just said, I counted his toes, I counted his fingers, and looked over him, and then I just held him up in the air, and I said, "Thank you, God."
Kofi, this is important. I want you to open your eyes for me. Kofi, listen to me, Kofi. Kofi, open your eyes.
Anyone got pen torch?
Kofi, can you hear me? Can you hear me? Kofi, this is really important. Come on, good lad. Squeeze my fingers. Can you squeeze my fingers here? Kofi, squeeze my fingers.
Actively doing so?
Squeeze my fingers in your left hand. Can you squeeze my fingers? Kofi.
So not responding verbally. Okay?
It's always difficult to put your own emotions aside. If it was my daughter lying there, I would know how I feel. And being a parent, being a human being, you can't help but empathise.
Okay, so what do we think?
Okay.
Yeah, okay. So he's responding to pain. So he's localising to...
I'd like to say it gets easier with age, but I don't think it does. You're trying to comfort the child who may be distressed and in pain, but most of all you're trying to make sure that the team you've got there is doing the right thing at the right time, in the right sequence.
I've got an 11-year-old boy who I spoke to your colleague about. He's about to be tubed, and we would like a CT head to toe, including C-spine, chest, pelvis. I'm sorry, it's so noisy here. Are you ready to go now?
How far from going to CT are you? Just about ready to go.
OK, we're on hold waiting for radiology to phone back.
Sometimes you know the chances are slim. But I think with a child you never give up.
OK, they're all ready to go.
They just brought him back from the CT scans.
11-year-old Kofi has been severely injured in a road accident.
Because basically the car hit him and knocked him into a railing. So the damage has really come from the railing more than the car.
He's got a right-sided frontal 7 to 8 millimetre subdural hematoma with no swelling, no hydrocephalus, and no midline shift, so stable injury.
I was supposed to be going to church that night. this Wednesday night, I go to church on Wednesdays. For some reason, I was something just came over me not to go to church. And then my daughter phoned me and told me what happened. She was screaming down the phone, "Daddy, can you come quickly? Daddy, can you come quickly?" And I panicked. I was really panicking, Because of how she sounded, I thought the worst. Immediately thought the worst, that, I don't even want to say it, I just thought the worst,
He's got ear, but it's nasty.
That's not a nice place to have a fracture.
It's gone right through here. All the way through, that's nasty. I don't know whether to, I'm going to talk to the parents now, but he's quite seriously unwell. Right, we've just had the CT scan result back. We've only got some of it back at the moment because there's a lot of images to look at. We've now got the neurosurgeon who's just coming to see him, and we've also got the maxillofacial surgeon who's there as well. But he certainly has a fracture of his skull and of the face. And there is signs of some brain injury as well. So there is blood around the brain, on the top of the brain. Now, I'm sure there'll be lots of questions and things that you're thinking about, but just give us a little bit of time to get all the image reporting back, and then we'll come and tell you a little bit more about what's going on. Okay? I've spoken to the relatives, so the father is aware. I haven't been graphic in how nasty the injury, but it is. The fracture goes right from the frontal sinus all the way down to the base of the skull to the clivus, with an extradural as well. There's lots of intracranial air. It's a horrible injury. The facial injury is bleeding. He's got a pH of 7.2. His HB is 9. He's going to need blood next. So could you speak to the lab about getting some cross-matched blood? Okay. Right.
Kofi's head injury is now the main concern. Once they've stabilised him, he may need brain surgery.
He's going to go to Pediatric intensive care. Okay. Spoken to Dad. I've told him a lot of the detail, but he's aware grossly of the injuries, but I haven't told him graphic detail. It's potentially a lethal injury. It's not a nice injury. At the moment he's quite stable, but it's potentially a nasty head injury. Life-changing, if not fatal. Yeah, it's life-threatening. No.
What I felt was it should have happened to me, not him. I was thinking, did this happen to him because of something I did in my life or to someone, It did, I went through probably every emotion that you could go through. I was just thinking, my son, and a hurt went through me. I felt hurt in places I didn't know hurt.
Are you the plastic surgeon?
No.
No.
This is the senior doctor in the A&E, and he's got experience with faces as well.
My name is Nadine, and I'm 16 years of age. I'm a hairdresser. I style, cut, blow dry, whatever. I love appearance. I love making people look beautiful, and it's just my thing. I love it.
Sorry, I'm doing touch. So.
My best feature are my eyes, as you can see. Beautiful eyes. Yeah. I'm I'm not big-headed or nothing, but just I think I'm perfect.
If you're happy, I can do. If not, then you can wait. Up to you.
This is my face, you know.
I know.
Everyone sees it. So please do not mess it up, please, because I won't be happy.
Yeah.
Nadine has been glassed in the face whilst on a night out with friends.
I'm scared. I didn't know that he scarred me until people was like, you're bleeding. And then I looked in the mirror and then I saw my face and I was just thinking, oh no, like look at my face. Look at my face.
That's why you're getting an injection.
Oh, I hate injections, I hate needles.
Okay. Try not to move.
Sorry.
There was like maybe 10 or 11 boys. We was all dancing, they was getting a bit too drunk and they would try like fill up the girls' thighs and the girls' bums and they wanted to try to start with my friend. And then I butted in, which I shouldn't have done, and I said, leave her alone. And he must have come to me now and I said, are you gonna do something? Then he took the bottle and he smashed it in my face. Please don't hurt me, please don't cut my skin, please, I'm begging you, I swear to God, please, please.
You're gonna have to work with us a little bit, okay?
It's gonna hurt.
It is gonna hurt, okay, but you've gotta have it done. So you're gonna have to work with us. That way you can get out of here quickly and we'll get the job done right.
He thinks that we can't defend ourselves, but me, I'm not gonna back down. I'm not that sort of person. So I punched him and he fell to the ground.
It's coming together very nicely. Well done. Well done.
You might have some scar, but very mild, yeah? Yeah. Less than that, it's going to be less than that.
Good. Thank you.
All right.
The man that did it, he thought he could throw in my face, but clearly he never. I don't want people to feel sorry for me, to pity me, because I'm a strong girl and life just goes on. Karma is a B-I-T-C-H. Yeah, it's gonna come around and it's gonna bite him on the butt. Look at all that blood. Look, there's blood everywhere. Oi, oi, oi. There's blood everywhere.
Sorry.
What can I use that will take off the blood quick?
Use water. Not normally need any.
I actually don't want to get called in now until I finish.
Siobhan Claire. Siobhan Claire.
Hold on 1 minute.
Hello, what can we do for you today?
My back.
Triage is basically a quick assessment so that we can prioritise when patients need to be seen.
Any allergies at all?
Not what I know of. We can give her.
I can give you some codeine and paracetamol.
You can be high. Codeine is strong, boy. You're gonna be high.
You're filtering out basically who's very unwell and needs to be seen straight away, who can wait for a bit, who can wait for a long time.
I've had some pains in my chest which have started about 4 weeks ago, but they got quite chronic today. So chronic I cancelled an after-dinner speaking in Birmingham tonight.
It can be quite monotonous because you're probably seeing a patient every 2 to 5 minutes and you're asking the same questions over and over and over again a lot of the time.
You allergic to anything?
Inland revenue.
And then you'll get someone come in that's really sick. you're presented with something you're really not expecting. Without any notice or a moment's notice, and everything changes. The whole atmosphere of the place changes.
A 22-year-old man has come through reception, having been shot in the face.
Are you sure? OK. Oh, my... Right, come through, sir. Are you sure? OK. OK, darling, just come through this way. Right, Sonia, this man's been shot in the face. OK, darling.
It's fine, mate, all right?
OK, darling, we're going to get you on the trolley. Just come on the trolley for me. Let's get this off.
Come and sit on here, babes.
What's the story?
He's just walked in triage saying he's been shot.
What's your name? And do you know where you are?
It's the stuff of movies, but we get it sometimes at work.
You know where you are now?
OK, my love, there's going to be a sharp scratch in your left arm. Keep it nice and still. This gentleman has just walked into reception. He's been shot in the face through a window of a car. So I don't know if that's glass all over his face, yeah. That sort of livened my triage. Oh, my God. Hello, King's A&E.
OK, listen up. We have another trauma call coming in with a stab wound. So if we can hide some of the team to be ready for that. Third trauma call. OK?
The majority of people that we get coming in having been stabbed or shot are under 20 or in their very, very early 20s. In fact, it's extremely unusual to get someone over the age of 25.
Stab wound to the chest, 17-year-old. Stab chest. OK. Down on 5, please. Good. Get them all signed in, please, guys. Stab wound to the chest. OK.
You do find that there are cycles of violence, and you just get a period where, there's lots of retaliation going on, and so you could have a wave of gang activity. Sometimes the police will alert you to that and say, we expect further violence.
Hello, King's ED.
OK, we have another trauma call, a stabbing to the face. If the transfer team can stay intact, I will take what's left. Probably 5.
I think it's incredibly scary that they're so young and that's the way that they deal with their problems, and they've got their whole lives to live ahead of them, and yet they're putting themselves in a position where they could be killed or they could kill someone else, and it's so sad.
Has anyone looked in his eyes?
Not yet.
I think the youngest victim of gun crime that we've had in the department is a 5-year-old child, which is just unbelievably shocking, and it's extremely scary to think that's the way things are going.
Hi, Chris Lacey, one of the consultants. Your registrar is in there now.
Yeah.
Whilst 11-year-old Kofi is fighting for his life in resus.
He's got a nasty skull fracture. I've only just quickly looked at it. He's got an extra...
3 victims of violence have arrived in quick succession.
There's a gunshot wound to the face. We're just waiting for a CT. And then we had a chest stabbing, predominantly superficial. And then there's a knife to the face with the knife in situ. He needs to go to theatre tonight, but he's stable, completely stable, and can wait. It's been a little busy.
There's a guy over there with a knife sticking out of his head.
Yeah.
Hey, are you okay? Right, poor bugger, because we're fine the other side.
Get you to have a seat on there. If you can take your jacket and shirt and all that off.
Don't let me forget that. That's the most expensive brolly you'll ever hold.
Oh, really?
Actually.
Wiggle it from side to side. Brilliant, OK. There is a reason I'm doing this, I promise. I'm just testing the nerves on your face, OK? And you said, what type of... It was a knife, you said?
Do you want to see him?
Oh, brilliant, yeah.
Yeah, I've got...
Well, it's always useful to see what's caused the injury, because then we can...
Yeah, I saw.
Oh, gosh.
Yeah.
Wow. Okay.
73-year-old Roger Jackson has come in complaining of chest pains.
Okay, let's pop your gown on. Where did he put it?
Under another name, I'm quite famous.
Is it under there? What's your other name?
Roger Laverne, you can Google it.
Oh, really? I will later.
Your mother and father might remember my group, the Tornadoes.
Oh, cool. I'll be back in a sec. Ah, Jen, do you know the band Tornadoes? No.
I was in a group called the Tornadoes, and we had a multi-million selling record which still gets played every day, called Telstar. A lot of people say they've never heard of it, and then they hear it and they say, oh, that one.
Knock, knock. Hello.
Hello there.
Roger Jackson.
Yes?
I'm Tony, I'm one of the doctors.
Nice to meet you.
And you, what seems to be the problem?
Well, I seem to have a lump in my chest. I mean, I can't feel a lump, but it feels like especially when I turn sideways as well to the left. Mm-hmm. And when I take a deep breath, I get twinges, and I'm 73, and so many of my friends are dropping dead around me, and it's just worried me a bit.
Okay.
We were first British group to get #1 in the States, and went to #1 in every country of the world where there's a chart. #1 in this country. I can't explain the pleasurable feeling it gives you to be top of the mountain, you know?
Tornadoes.
First British hit in British history to get to #1 in America.
Oh, really?
Telstar. Me.
And you were the pianist?
I was the organist, the main sound, Telstar. I was Billy Furier's pianist. I was Olivia Newton-John's, that was me. I shared a hamburger with Presley. That was on the set of Girls, Girls, Girls in the States. And it was in a lunch break. We had our arms around each other munching hamburgers.
Oh, fantastic.
This came out in October. There we are. There's Roger. You'll see my name, Roger Laverne, there. Roger Laverne is my stage name.
Okay.
The Tornadoes is my group. The advent of rock and roll and everything in the 50s was wonderful, you know. All the coffee bars came up, the lovely espresso coffee bars in London. Presley came up, and Little Richard and people, and it was a wonderful time, you know.
As a teenager in that time, over kind of the 50s and the 60s, what would be the worst thing you'd hear about kids getting up to?
Well, you had the Kosh boys in Clapham, who were dragging people off buses and that. They used to wear drain-pipe trousers and Edwardian jackets with their hair well greased. Teddy boys, that's what they were called in those days. I used to avoid them like the plague. If I saw a group of those coming towards me, I used to cross over the road, you know. But it wasn't in any way like today's problems. I don't recognize this world at all.
Okay.
Is this the guy who's got shot in the face?
Yeah. This is him here.
Yeah, because I just got off the phone with radiology just before I came in here, and he's got 2 pieces of glass in his orbit. But we already knew that.
Yeah.
So the thing is, he walked in, so any shooting-related incident, we phone the police straight away.
Right, okay.
You don't even have to report stabbings.
Right.
But firearms, you have a duty to report it to police.
Right.
And they come down with no response unit.
I see.
And obviously, you know, the last thing you want is you don't want to come in the department finishing the job off.
Yeah.
It has been known to happen.
Yeah.
Happens like Manchester.
Does it?
Yeah. So, yeah, it's Wild West tonight. Midweek madness, we call it.
Kofi's condition isn't improving. The medical team are still trying to get him stable enough for vital brain surgery.
It's chest CT. Are you worried about it?
I'm worried about his CO2, even though we increase his ventilation and his CO2 is not clearing.
Okay. And the tooth that might be missing,
That's the question, isn't it?
Are we worried about that or the chest?
I
ask, is his C-spine clear, the rest of his...
No, his C-spine's not cleared, and they do need to... There's an alveolar fragment with a tooth, and there may well be a tooth missing as well, which is what we're just worrying about with respect to ventilation. He needs probably a unit of blood, but I think as soon as we get into PICU, the better.
It is sometimes quite difficult to deal with situations where you've got multiple patients in resus with conflicting needs or different needs.
Which, sorry?
The guy who was stabbed in his chest.
Where is he?
He's only in his boxes.
You're dealing with a family and then you have to go and deal with a stroppy teenager who's having a bit of a tizzy fit.
That gentleman needs to come back. No, we'd like him back, please.
You do just have to switch between one situation and another and try and manage the room in the best way you can.
Yes, sir. Hi, I'm Dr. Lacey. Do you want to come and talk to me?
Can I talk to both of you? I don't even want the police here. That's how cool it is, Kim. I don't want the police here. All I want is my stuff. Excuse me, what's going on with the CT scan? I want to get out of here.
Okay, CT scan is going to happen, but...
You do have to sometimes just detach yourself and say, I've got 5 patients in here. I'll prioritise the need of one, but I can't completely ignore the needs of the others. Innocent or not, they're both my patient.
So as soon as we've got the scanner free, we'll get you up there. But you just have to be paid. Realistically, half an hour. Half an hour is not long.
Can my cousin come in here, please?
Just because you're injured, if it's not life-threatening or immediately limb-threatening or anything like that, we've got a right to carry out our work in a way where we're not being abused by people. And if you're going to abuse me or any of my colleagues and you're going to act in a manner that's extremely unpleasant, you can go.
I'm trying to comply with you. Do not try psychology on our brain cells. Do not.
Guys.
Do not.
Guys, can I ask for calm, please?
Do not.
Could I ask for calm? There's a very seriously ill
I do apologise.
young child.
I do apologise. She's trying her strategy.
Listen, there's a very seriously young lad.
I'm sorry.
There. It's
I'm
11 years
sorry.
old. I really would like to keep it calm. Thank you.
She doesn't calm down, she's out. I'm not having it in here either. Okay? Yeah.
You take him to CT now.
Fantastic, and then we can get the relatives. Can we not put them with the young lad's relatives?
I hate to say it, but those that come in that didn't bring on the situation themselves, you do actually care that bit more about them and saving their life than you do about someone that's brought it on themselves. You always do your best for the patient, but deep down you care more about those people that you don't feel deserve to be in that situation.
Okay. Now, parents haven't seen Kofi. I wondered if this is a good time to see if they want to come in.
We wait until I turn up there.
Yeah, it just depends how long you're going to be.
15 minutes, max.
Okay, all right, because they've been very patient and very tolerant.
Right.
I was in the hospital when the young man that had been shot in his face came in. And I thought, that's the world that I don't want my sons to be a part of. I admired how he was growing up. Like if he wanted to do stuff that his friends wanted to do, if it was something I disagreed with, if I could sit down and actually have a sensible conversation with him. It wasn't a fight with him. I didn't have to fight with him to get him to listen or to take advice. So I was proud with how he was coming along.
Kofi's parents have been waiting outside resus for 3 hours to see their son.
When I saw Kofi for the first time, it devastated me. If I could have swapped places with him, I would have. I thought, I'm 40 years old, his life is just starting.
In 1982, I realized I was mortal. In Mexico, I had viral hepatitis. I was in a sanatorium for 18 weeks. It was really dangerous, viral hepatitis. Then I had cystitis, chronic cystitis, and salmonella. The thing which knocked me sideways when I was playing in one of the most plush, lovely restaurant bars in Mexico City, and on May the 15th, 1986, my hands, which were all straight, that one's bent now, you can see, they went like that in 15 days. I was like that for 10 years.
And you had them released?
Yeah, I had them over 7 years operations. I was the actual favourite cocktail pianist of the President of Mexico at the time.
Oh, really?
And the Dupuytren's contracture came in 15 days.
Stick your tongue out for me. Okay.
That was the worst nightmare of my life, I think. I was a cripple. That was finished. And then, of course, I got cancer in 2004. And,
so you smoked on and off for 40 years?
Yes.
And how many a day?
Too many, actually. I think 2 packets.
Okay. And what kind of cancer did you have?
Esophageal.
Okay.
And I'm out of. I've done my 5 years remission now. So.
And did you have any chemotherapy or radiotherapy?
Oof! God, did I? It knocked me sideways. You know.
Well, your heart racing is completely normal.
Is it?
There's no evidence of any angina or any heart attack or anything like that happening on here. The way you describe it, it sounds more like a chest problem to me, a lung problem, than a heart problem.
Okay.
I think we need to do a chest X-ray in the first instance and some blood tests to see what's happening with the blood test. Okay.
Okay. Whatever it is, I don't want it. You know. And as I say, a lot of my friends have just dropped dead, younger than me, and that gives me the wobbles. I've got prostate cancer right now, yes, brand new. This is a new thing, you know. And sadly, they caught it late and it spread to all of my body, and they don't think they will ever be able to eradicate it completely. I've told it to sod off. I want to hang on to that. I haven't finished, I'm still ambitious. I had my first Rolls Royce when I was 23. That's because I'm impatient. You can't keep me down.
Would you give up the fame and the fortune for your health?
To have health now? I don't think so, because I'm glad I experienced it.
Trying to get your hair away so there's no hair in. It's a nice big gash you got there.
It is. There's one thing I take pride in, it's my gashes.
Do you remember when I told Dad I was moving to Peckham?
Yeah.
And him and Rob went mental. They were like, "You're gonna get killed, Brian, you're gonna get shot. Look, I printed off a map of all the crime and it all happens in Peckham." It's not that bad. Just finished his notes. He's off the system now. I don't know where they're going to put him. It's going to take me hours to write up all of these. Absolutely hours. Oh, fair enough.
I guess the fear is that in the next 10 years, you know, where we see 15, 16-year-olds being commonly involved and younger 10, 11, 12, 13, you know, not infrequently be involved. You just worry about how low that line is going to go. Are we going to see 8, 9-year-olds commonly involved in 10 years? I hope not. but I guess it's a very real possibility.
So I've got the more to take him details of you. Okay.
Three and a half hours after arriving at King's, Kofi is ready for surgery.
Just to let you know that Kofi's just gone up to theatre now, and as soon as we've got any information back, we'll get one of the team to come and talk to you. He'll be going to the Pediatric intensive care unit after that, so we'll get you up there once he's settled, and we'll take you all up there.
He's going to have what then?
He's going up to theatre now to have that blood clot that's on his brain drained with Mr. Selway, the neurosurgical consultant. And at the same time, they'll have a look at the face and make sure there's nothing else they need to do there.
Okay, thank you.
No problem. I'm Scott, by the way. I'm the nurse in charge tonight. I'm running the place. Wayne. Now, obviously, I'm not a neurosurgeon. I don't know where the clot is or what they need to do. Sometimes they need to take a portion of skull away, lift it off, then they can get at what they need to do. Sometimes they can just drill a hole. They'll keep him asleep in a coma for a few days, I would imagine. Once the swelling's down, they'll start to wake him up. And only then will they be able to assess how well he's recovered.
Brought him out of in the induced coma, because the hospital they weren't sure if he had suffered any brain damage. I set about proving that he wasn't brain damaged.
Little boy, it's your daddy. It's your daddy. A little soldier.
I said to him, your mum's holding your right hand, so if you know your mum's holding your right hand, squeeze her hand. And he squeezed his mum's hand. I made him a promise that I wasn't going to leave him until he came out of hospital. And I stayed with him. He was in hospital for 13 days, and I was with him for those 13 days.
You're still giving his swelling's gone down a lot, hasn't it? You're still giving trouble, little soldier. I think he was dreaming about playing football when he was kicking, innit?
My full name is Kofi Jordan Wayne Cadogan. It was good to wake up and see my dad's face, because I felt more safe, like there's not a better feeling, because my dad is great, I love him.
What's the best thing about surviving something like this?
That it teaches you a lesson. There's no point risking your life on nonsense that you don't really need to waste it on. You should be thinking about the future and what's important in life, like your family.
And football?
Yeah. Football as well.
Do you mind putting that, please, for that request?
I shall have to get a Queen's commendation for you for your services to rock and roll today. I don't like thinking of death and morbid things at all. I still feel that I wanted to go on and on and on and on. And that's what I intend to do. I look in the mirror and I think, yeah, you know, go for it. I still feel like that, you know.
And who's at home with you?
Sorry?
Who's at home with you?
My 8th wife.
8th wife?
And that's another story. My autobiography is coming out.
Okay.
Mary Poppins, it ain't. I'm a bit craggy and crinkled now, but I was pretty dangerous in those days, quietly dangerous. Okay.
Rock and roll.
The rock and roll.
Can you get all the smiles in, because I know I look really cute.
Hello, King's A&E staff nurse. Thanks, bye.
Oh, lovely.
Deep breath. Head out.
It'll have to be number 11. We might as well just keep the drunks together.
Which one's the best, do you think? That one? Or? That's quite cool.
Look, all my boyfriends, all lined up.
Oi!
Just don't know which one to choose. I think it would have to be number 10.
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Try to call them about 20 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Camino. Everyone should walk through an emergency room at least once in their life, because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love. And the fact that 1 minute they might be there and 1 minute they might be gone.
Bruce's Judgeness. Hi, Cathy, it's Scott. We've got a stroke DTA for you.
Da 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 da. A&E Majors, can I help you? I'm the sister in charge of Majors.
Senior Sister Jen has worked at King's A&E for 10 years.
Yeah.
She's in charge of the staff and patients' welfare on tonight's shift.
Yeah. is stressful. It is stressful. Some days I go in there and I just think, Jesus, this is crazy. I don't know how I do this. Joe? Hello? Joe? Hello? Listen, you seem like a reasonable person probably when you're sober, but you've wet yourself, you've vomited all over yourself, and I don't think you'd like to lie in your own pee and vomit, do you? I know you can hear me, and you're choosing to ignore me. You know what I mean?
Joe, come on now, wake up. Come on, you're in hospital. Wake up. You've urinated all over yourself. We're going to put a drip in your arm, OK?
There's a young lady who's just been put into Bay 5. She's been out tonight, had a skinful of alcohol and needs a bit of a clean-up. OK. Strip her clothes off, put her in a gown, do her observations, make sure she has BM. I'll stick a line in her, give her some fluids and she can... Is that all right? Number 5, if both of you do her together, she's vomited all over herself, so she's a delight. Thanks. I mean, I've worked in a few A&Es in London and there's nowhere like King's. We put up with a lot, so I think we try and support each other as much as possible, and that's what I like about King's. We're all, if something happens, if the shit really hits the fan, then we all pull together to make sure it's all right.
What the fuck is going on behind us? Can you see that? Oh shit, fuck it.
Mum, why is it called King's College Hospital?
That's the name of the hospital, and that's about the staff. Because a lot of times they have patients that come in, they're not very nice and they're very rude to the staff and that say aggressive things and they act aggressive.
So he's still currently at that address. What's his telephone number?
He hasn't given us one.
Next to Kim. Sorry.
So what's the problem tonight? What happened?
Nothing.
Nothing?
I was going to my home, I paid my fare, bus said to me, don't take you home.
Okay, but probably because you're...
No. Not properly, No, you're wrong. Properly because I pay my fare, I'm a good citizen. I'm very polite, I'm very educated.
I know, but you're very loud.
No.
Yes.
I'm very loud, I'm very deaf, I'm sorry.
No. And don't try and scare me either, because it doesn't work.
No, I don't try to scare you. I try to tell you the truth.
You were just speaking to me very, very softly, so you can talk quietly.
I'm sorry, I'm half deaf. I cannot speak to you if I speak loudly.
No, you didn't. Don't, all right?
Then does it work?
I probably get shouted at every day. People swear, they shout, they demand. Over the years, I've been called dyke, lesbian, and that used to really get on my nerves, but now, actually, well, I am, so hey-ho. You can't ever be scared coming to work. People know if you're scared. They're like animals, they can smell your fear. And as soon as you're scared, you are the people that they're going to abuse. So what do you want me to do today?
Huh?
What would you like me to do?
I don't need you to do anything for me.
Oh, well, you can leave then.
Yeah, I want to leave.
Do you have an appointment at St. George's?
I don't understand English.
Oh, absolute rubbish. Time to
I
go,
don't understand English.
Let's go.
You understand very good English,
No,
sir.
I don't understand
Yes,
English.
you do.
Okay.
Manager, you
Bye-bye. See ya. I think much of it is manipulative, to be honest.
I'm fine, I don't understand English.
He understands everything.
Can we get a portable chest X-ray to resource 2, please? Portable chest X-ray to resource 2, please. Thank you.
A very strong person will work and stay at King's because it is so stressful, because it is so busy. You have to be strong-willed, determined, maybe a little bit aggressive sometimes, and yeah, but with a bit of a sense of humour and compassion, of course.
In 2010, there were 60,000 recorded assaults against NHS staff in England alone.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
So we'd have a bet on this one. Drink, drugs or crime as to the reason to this trauma. A&E does breed particular nurses, and sometimes you have to be able to make light of what you're doing.
At any time, if you laugh, it makes you feel good. So if you see something pretty gruesome and you have a laugh about it, then it instantly, the stress and that horror, because sometimes it is horrific.
So what do you reckon, Kirsten? Either drink, drugs or crime?
Drink, drugs or crime, drugs.
OK. I'm going to put for drink. Are you going to take crime?
It's going to be MDMA.
I must admit, I've got maybe a bit of a warped sense of humour, so I find things funny. Like that guy who was shot in the penis, I did find that made me laugh for a whole shift. Because he just kept looking down at it, and I thought, yeah, I'm sure you are looking down at it, just thinking.
Really obvious other injuries. His pupils are quite small, but he has been drinking, and we're whether he's taking something else.
So would we drink and drugs then? So you were almost right.
The department works round the clock and has over 200 employees. Behind the scenes, 60 non-medical staff keep things ticking over.
My name is Kevin Hillman, and I'm a porter in A&E. I was actually born in this hospital, and I wanted to work here.
Can I have a portrait and X-ray, please?
Yeah. My job involves taking patients up to the wards, taking them to X-rays, collecting bloods, and occasionally doing removals. A removal is when somebody passes away, and we have to take their body down to the mortuary.
Kevin the porter he calls me his big sister. I think he sees me as a bit of a supporting figure, and I have a bit of a soft spot for him. I do. He's crazy. OK, let me call Resus, all right? Because I know he's probably in there with a trauma call, so... All right, love, no worries. Thanks, bye. Bye.
How are you, sis?
I'm all right, Kev. How are you?
Good to be back.
Are you happy to be back, are you?
Yeah. Sorted out me and grandma's stuff.
But, you know, he works so damn hard, and he will do anything for me, you know. It's not too much trouble to do the blood run every half an hour for Kevin, whereas other people, it'll be every 2 hours, and that'll be at a push, you know?
Porter to majors to collect blood specimens, please.
Parker, wicked. When we have to get flying squad blood, we can't hang around. We just have to go straight down there and pick up the blood and bring it back.
If they're urgent, Kevin, they've got to go. Thank you. Thank you.
We have to get that blood back to the patient as urgently as possible, because the patient could be bleeding to death. He could be. I'm there to save lives, help people. I am.
Can I get a porter? Can I get a porter?
Yeah, give us them. I'll take them. I'm going that way, 'cause I've got to theatres. Right here. 2. What a night, David. What a night.
Been fun.
Adult trauma call, 5 minutes. Adult trauma call, 5 minutes.
That's going to be one from me.
Ex-army chef Kevin hopes to one day be a supervising porter.
Some people say I am the fastest porter at the moment in the hospital, they reckon. So, how's the cylinder looking? Cylinder full. You've got a full cylinder, OK? And it's a valve one.
Cool.
I like to see the action. I've seen stabbings, I've seen shootings. What is it?
Multiple stabbing to leg or
So
legs.
you would want me to hang around for a flying squad blood, just
Yeah,
in
that'd
case?
be useful, yeah.
We actually get a bleep, a trauma bleep. And when that goes off, that means we have to attend it and go there straight away. And we have to stay there, just in case the doctor says to us, can you go down and get the trauma blood? Yeah, I'll hang around just in case you need blood.
Blood pressure's fine at the moment, but you never know what they've stabbed in. It could be an artery and it could be...
Yeah, drops.
I like a bit of trauma. I mean, I must admit, it sounds a bit gory, but I do like a nice shooting or a bit of a stabbing with bowel hanging out.
You all right, yeah.
Yeah. If we run a good trauma, it's fantastic. And if you save someone's life when they've come in that mess, then it's brilliant. Oh, multiple stab wounds to legs.
To legs, yeah, I know. But
well, you never know.
Could be femoral.
Could be. Could bleed out like in a little second, eh?
Penetrating trauma to the chest, which are your stab wounds. King's is one of the busiest hospitals in all of Europe. The areas we serve in London are particularly high crime areas.
Are you able to shimmy on over, my friend?
Sometimes, you know, you're looking at 2 or 3 stabs a day. So the numbers have risen up. It seems that, you know, people's way of fighting has moved on from punching each other to using bats, to using knives, to using guns.
OK, so he's got a trachea that's in midline.
17-year-old Levi was stabbed during a fight on the street.
Entry in the right, normal percussion bilaterally. Sats are... what is that? Sats are just coming up now. Hey, just relax your tummy there for me, yeah? Is there any soreness in the tummy or not really? Good on you. Just take a nice big deep breath. Good man. That's all good, huh? So abdomen's soft and non-tender. So he's got a laceration just medial to the mid part of the scapula. Yeah? He's got another one immediately paraspinally at about the level of 1, 2, 3. About T3, and another one at T4 on the right. He's got no other stab wounds on his legs or around his genitals. He's not completely well, but it's doesn't appear to be life-threatening at the moment, from what we know. But he's going to go for some scans.
Are you going to make any allegations for this? No, you're not going to talk to us? That's fine, yeah, just wanted to know. You might just have to sign a quick signature to say that you don't want us to take any further action for this, all right?
Levi's condition isn't life-threatening, but he needs extensive stitching and he'll be in hospital overnight.
Shoulder scratch.
Fucking hell. They will all go numb, all right? Did you manage to get any punches in?
Yeah.
Good, well done.
I punched him first. Fuck up.
Ah, so you brought it upon yourself, did you?
He tried to swing for me. I dodged it and banged him against the wall.
And he pulled a knife out?
Yeah, the prick.
Do you know who it is?
A lot will come in highly pumped up with adrenaline. But sometimes you can be having to deal with a lot of aggression from the patient.
Levi, your mother is really upset. She really loved to see you. He's one of the other consultants.
She did?
Well, he's taking over, is being in charge of here. So he's just making of all the patients in here. Your mother really wants to see you. She's really upset.
So she should be right.
Well, will you just let her see you? Why? You can't say to your mother that you don't want to see her. She's your mother. She gave birth to you. Come on.
No, she didn't.
She's really upset.
Oh, for... Tell her to come, man. Fucking hell, man.
You know, once it's kicked in how lucky they've been, then sometimes they can be a little bit quiet. Sometimes family members can not even be aware that they're out, and you get a lot of emotion from some of the mums.
I went in and I just wanted to sort of scoop him up, but then, you know, he kept saying, "I'm all right, Mum, I'm all right." And he just looked so small. He looked about 12. You know, once or twice they said, "Well, will you come out?" They were doing blood tests or whatever, they were doing different things. And it just felt so routine to them. And I thought, well, this is my son. This isn't routine. I don't expect this. This is not something I expected.
What used to shock me 10 years ago, I've seen it, so it no longer goes, you know. But I think the fact that we get a lot of violence is shocking. The fact that people don't like each other very much is shocking. But the actual injuries and things don't shock me, because unfortunately I've seen too much.
Approximately half of all penetrative injuries seen at King's are a result of violent assault.
Can you tell me what happened today?
I got punched in the face by a man because he thought that I knocked on his window.
Right, okay. And was it just one punch?
One punch and I fell to the floor.
You fell to the floor. Did you hit anything on the way down?
No, it was on gravel.
It was on gravel. Just look up for me. Oops, that's all. Okay. How wide can you open your mouth for me? Open as wide as you can. Go, 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 go. Wider, 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 wider. Oops. What happened?
It hurts.
Where does it hurt?
It just hurts here.
Just hurts there. Okay.
So, I'm in the hospital. My fat is as fucking... My foot is fat as fuck. Where are you in? Kebab shop? I will stay there. Come up in an hour. Come in an hour. All right, see you soon, babe. All right, bye. We were always going to the club until I fell off the bus. And then I fell off the bus. Oh, don't step on my foot.
Oh yeah, just a bit.
Absolutely
Trolleyed. On free alcohol?
Yeah.
Yeah, I knew it.
It's come out of the House of Commons.
Nice. On our money then?
Oh, yes.
Ah,
Why couldn't you go to
fantastic.
Tommy's then?
Yeah.
Why couldn't you go to Tommy's just across the water?
No, I didn't. Did you hear what I said, Luke?
It's just come out of Commons.
I said he's been drinking in the House of Commons.
You say it's just come out of the Commons.
All right. Okay, sorry. But we picked some up the clothes later.
You didn't say that. You didn't say that.
Don't get arsy with me.
Well,
His camera's here and I don't...
he got that
I'll
off.
still
Got
put
that
one on
off.
you, son.
Past medical history.
How do I know? He wouldn't give me his date of birth. What do you thought I might...
Well, I I thought that was part of your training.
Potty training.
You could do that as well.
Did you say potty training?
I thought that was part of your training. Part. So you start speaking like this.
In it, bruv.
In it, man. Get me.
Get me.
Any obs?
Refused. We've got one more test for you. You have to come and sit back in the chair.
Ah, fantastic. Good.
All right, I'll give you 10 seconds and I'm going to put you in the chair myself.
Gosh. No, I won't do that.
Come on, you're wasting time now.
Hey, God.
You're wasting time. We need to go look after other people.
We're cool. We're okay. I'm going.
In the chair.
No, let's sit down here. We're okay.
Let's go.
My man, don't...
I said to her, I know that you're a very busy person, you've been here all day and you're most probably under a lot of stress. She said no, which was good. And then I went on and said, all I need is an inhaler. I'm asthmatic, I was suffering with it all my life. All I need is an inhaler, I'll be out your way. And she said it doesn't really work like that, but I said to her that my chest is getting really, really tight. I cannot wait for 15 people. There's no sort of leeway in anything that these people do. Everywhere you go, it's queue, bank, queue, shopping, queue. Flipping hell, man. It's a mad system. And they never give you a straight answer. I asked the nurse, do you think that I'm going to be able to get an inhaler? I'm asthmatic. Obviously, I'm going to need it. This said to me, oh, it's highly possible. I don't know, what do you mean it's highly possible? Did I not hear something like, it's because of the A&E why there's more deaths. Because people sometimes need critical attention.
But you know what's wrong here is the fact that you have to wait in there for 3 hours.
I mean, it's ridiculous, 3 hours, you know? I mean, people got things to do.
Everything's to do with 3 hours nowadays.
Yeah, it's always 3
You
hours.
have to sit down for 3 hours.
I mean, the money that they put into the NHS, yeah? This should be a smooth operation.
No, but you know
people
what?
should be coming in and out quickly. It's shocking. All they need to do is give me an inhaler. You need to give me that or I'm gonna die.
Another trauma call, another stabbing. 2 victims from rival gangs have been injured in the same fight.
We've had 2 trauma calls that have not been, they bleed it through, but we've not had any calls.
Okay.
And we've got 2 of them in.
Two at the same time?
Yeah.
If you get one stabbing in and it's gang related, you know, there's a very good chance that you may get another stabbing in. there's a retaliation. And then again, if there's another retaliation, you know, you won't just get your patient in, but you'll get all their friends in as well. And we have had occasions where rival gangs have ended up in the waiting room waiting for their friends, and a fight started out in the waiting room. Then yeah, it can get very, very dramatic very quickly.
It is a dangerous environment. It is. Excuse me, guys. Excuse me. You all right? Who are you looking for?
My boy.
And what's your boy's name?
Through, but we've not had any calls.
Okay.
The 2 stab victims who've been treated in resus have been followed by their friends.
Right, okay, don't use the phone in here, is the first thing.
The 2 groups are from different neighbourhoods.
Yes.
Yeah, there's one here and one in 5, 2 stabbing.
Right, okay, can we just stop for a second? Trauma leader's down now, so I'm afraid you're going to have to go through it all again, okay? And can we just have a recap and let's make a start, okay? Can you just 2 step outside for just for a second? You can come back in. I need the space. You can come straight back in and talk to the police. Okay, you're not going anywhere. Just chat to the police from outside. Okay. Listen to me for a second. Okay. You're potentially quite unwell. I know things are going on, but for the next 10 or 15 minutes, you're just going to let us need to do what we need to do. Okay. You might think you're not as bad as you are, but unless we fully check you out, we don't know how bad things are. Can you do that for us? Okay, you can come back in. I'm not got any problems with that, but you just need to let us do what we need to do, okay? It might hurt, it might not, I don't know, but let's just crack on, okay? Cheers. Now, the other guy that's been stabbed?
No, I don't know.
You don't know?
No.
Okay.
Just wait there for me, yeah? I think it was about a year ago, we had a guy who had been stabbed. The stab victim went round to X-ray, and there was these 3 guys that were running through resus looking for this guy to finish him off. And I basically asked them to leave, to which they said that they were going to do, you know, oh, don't get out of the way, I'm going to stab you up. So I thought, do you know what, maybe I should just get out of the way. Got out of the way, and they tried to find X-ray, but security had been called, so they did a runner.
6, 3, 5.
Yo, guys, hello. It's a hospital.
What?
It's a hospital. You have a problem? No.
Nothing's going on in here. Nothing's going on. Are you got...
Seriously. Who are you with? My other half keeps telling me that I shouldn't get myself into those situations, but I can't stop being who I am. Listen, why are you so scared? What's going on? Because I don't actually want any trouble in here. No, I don't want any trouble. Listen, guys, if you want to... No trouble in here, do you hear me? It's a hospital. Hey, what did you think you're doing?
Yeah, my cousin.
No, listen to me. Right, there's a reason. There is a reason we have a locked door. Do you listen to me?
The boys just fucking stabbed my cousin. You expect me to...
Listen to me. Listen to me. And there's police that can actually help you. Do you think... Listen to me. All right, it's a hospital, for Christ's sake. Do you hear me? All right, and there's a reason I have locked doors, OK? Because I have a lot of people coming in here and causing trouble, so I don't need it. You know, I can't protect you, all right? Yeah, the only people that are going to be able to help you, unfortunately, while you're here, are the old Bill or the security man, OK? Yeah? And Charles is all right as well, yeah? But please, the toilet, no, straight up there, OK? There's... No, I won't let them through. Someone's got to keep an eye on that other lot, because they want to stab them up.
Okay.
Yeah?
All right.
And I'm just going to have a... This lot.
No.
No. I think a bit of respect has gone And I think that is hard because that has changed quite considerably, that there's no respect for what we do and for anybody else that's in the department at the time if they want to get at somebody. Right, they can get through. That's my only problem, you know. I'm just going to lock the assessment room. I'm going to lock the assessment room door because they're trying to get in. We have a little issue. There's a rival gang outside with another guy who's been stabbed in the hand. They've just gone out to make a phone call and basically... Yeah, no, it's fine. No, those are the ones that are actually scared. The two that came running through, I mean, I can honestly say they shit themselves. And they just thought, oh, fuck.
All right, I'm going to make this fair on both people because I'm taking the other guy through there. You're allowed 2 people. You can pick who those 2 people are. Everybody else goes home, OK? I don't care who they are. You pick the 2. That's fine. Same with the other guy, and everybody else leaves this building, OK? Right. Listen to me, OK? I know we've got 2 people through there that have both been stabbed, OK? I don't care what's gone on, but for whatever reason, there's a little bit of needle between you guys and the guys through there. That was fine before you started getting all aggressive with people, OK? I'm not having it here. I'm not trying to be unfair, but we've got an incredibly busy night tonight. It's packed through there anyway. I wouldn't allow more than 2 people. I think that's fair. 2 people. He wants you, and he said you can pick the other person. Is that fair? OK, cheers. The other thing as well is, OK, I don't want to see you two in any other places other than here or the waiting room, OK? All right. The other thing as well is there's a lot of sicky people in here, so just try and keep conversations a bit quieter, OK? Just let you know what I've done. What? He can pick his 2 people to stay with him. The other one picks his 2 people to stay with him. Everybody else has been thrown out. So, and I'll get his guys to stay with him.
Can you get off the side, mate? Thank you. Not for sitting on. And you.
We can find you a chair if you need it.
I don't know whether being unsympathetic to people that are stabbed and things is right, because I'm not. I have sympathy to the fact that they don't have anybody who cares about them. Not their injury, the fact that they sometimes don't have their mum and dad come down to make sure they're all right. Sometimes you ring up their mum and their mum doesn't even want to know. And a lot of people don't have anybody to look after them, to love them. I think that's sad. It is shocking, and I am shocked, and I am upset that, you know, we have 13, 14-year-olds that go to school and come in stabbed. It's bloody awful. It's the hardest thing in the world, but unfortunately, I'm in a job where I have to put them back together. And unfortunately, I'm in a job that I can't, you know, if I came into work and I thought about what we saw every day, I probably wouldn't want to come into work anymore. Because it is constant.
Yeah. They're busy, but they've all got something to do, haven't they? And like little bees. Nothing about
worker bees.
Worker bees.
I'm tired and I want to go home.
I think something hurts.
I got some drunks in there.
No, I don't think so. No, I think he's just in pain.
My name is Brian Wayne Campbell, and I'm a porter at King's. When you work at King's, you see everything. You don't have to watch the television to see what's going on in Britain. Right here at King's, it takes place right before your eyes. I've experienced so much at King's. I've really learned to tolerate just about anything on this job.
In reception, some of the boys from the stabbing incident are waiting for treatment for their minor injuries.
Listen, I know you think you're big and brave, but you do have a problem with your lung. So it'd probably be better off if you didn't jump around, because what you have got is a small pneumothorax and it could be much bigger. All right? Yeah?
Could I have one of the plastic bottles, please, so I can drink water in that tap? Is that possible?
There's a water fountain around there, so there's some cups. Yes.
Is there any food available?
Food? No.
No?
Your guy, idiot boy.
Yeah.
Well, I just said to him, he's prattling around, he goes, oh yeah, and they tried to stab me up, but they ain't done much. And I went to him, come here. So listen, I'm not being funny. I said, you can say whatever you like. I said, but prattling around like that when you've already got a small pneumothorax, it's just going to make things a little bit bigger. So if you want to continue breathing and feeling all right, I suggest you calm yourself down instead of mucking around. And he was just, he's out in the waiting room with all his mates, bigging it up like this. Yeah.
What, the guy from
And stuff.
I don't know about
But they're all, there's a massive gang of them out there. So your one,
and stab each other off again, aren't they?
well, your one needs to leave from a different exit. Physically, you know, I can honestly say, physically, you get home sometimes and everything aches because you have not stopped. And obviously your stress levels are really, really high when it's really, really busy. But then you've got another, God knows how many patients to sort out, so. Listen, you can't go out with all these lines in and everything for a cigarette.
Yeah, I went before with a lot more fucking lines.
Excuse me, there's no need to swear. That's not very polite, is it?
No.
No, it's not. At the end of the day, you have to get on with your job. And if it's at 2 o'clock in the morning, you've still got another 6 hours to go. So you just get on with it until you can get home and have a cry and have a drink.
5 hours to go.
Yay!
It's early morning and shifts are about to end. The team have been on duty for 12 hours.
It was quite a pleasant night, actually. It wasn't too bad. A little mass gang warfare going on in the waiting room and stuff.
It's busy, we saw the entertainment. Yeah.
And then, you know, the opposing gangs, they brought into the same hospital.
2 boys come out the back from recess. And they
Could I have a portrait X-ray, please? That's a portrait X-ray.
So, Sister Jen getting in it. But anyway, so it's all a bit volatile at the moment.
Security are going, I can't believe the police have left.
The old Bill actually needs to come down here and protect us, because at the end of the day, security can only do so much.
Cool. All right, guys. Just so you guys going in the cab, yeah? Super. I'll make sure that when you leave, nobody's seeing you leave.
I'm staying.
Okay, that's fine, because you're likely to be staying in.
I don't want to stay in. How deep is it, boss?
Deep enough that you need to stay in.
Morning, morning, morning.
Welcome to Jamrock, my friend. Pleased to see you.
Busy night?
It has been an eventful night.
Really?
Yes, they didn't stop balling out for our names. They've been trying to kill us. They were trying to kill us. They just kept calling. They never stopped.
Do the shots that
Working at King's, I witness more violence here than I do in Jamaica. Black folks' greatest enemy is themselves. Themselves. When you see a situation in A&E, there's stabbings, the enemy is another black person. Most of the time it is, almost all the time it is. Why?
On tonight's shift, there have been 4 stabbings. Every year, more and more young men come to King's with knife and gunshot wounds.
Two stab wounds to the legs, small one on the left, big one on the right. Was not actively bleeding on scene, but on the way here started. We'll see.
I want to make a special appeal to young black males. There was a time when black folks could blame other people for all of their worries and all of their tribulation and their trials, but not now. Right now, our problem is ourselves, mostly. We're self-inflicting wounds upon ourselves. We're destroying ourselves. And I want to appeal to young black males especially. You can find life. You can find success. I think there's so many opportunities out there for young black people. Opportunities you probably never had 30 years ago. Make use of it. All I'm saying, give yourself a chance.
How much do you drink normally?
I had a brandy, one in the morning and one of the evening.
Seeing as you have got to the grand age of 92, I think if you want a little tipple, we will let you have one.
You know what they're gonna say? And push me out when they're ready.
Yeah. King's College special. Patch up, heat up, 2 tablet, 1 crutch and out the door later.
Oh, boy.
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Give them a 20 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Camino.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love
And the fact that 1 minute they might be there and 1 minute they might be gone.
I'm one of the technicians. We need to take some blood from you, OK? What's your name? Obviously, people are very anxious and nervous and scared when they come into a department like ours, and they don't know what's going on, and it's quite nice to sort of put them at ease, which I think that I do very well. So, sharp scratch. You can open your hand, don't move your arm. Thank you. When I see couples come into the department, it just makes it more real. The emotion is more real because you're dealing with two people and, you know, one person, the patient, is in agony, but also their partners are feeling their pain as well and get quite upset. Sometimes we see people on their own as well, and sometimes that makes you feel a little sad.
Claire? Hi, you check your blood pressure.
Okay.
Just while you're waiting.
All right. Do you want to take this off?
22-year-old Claire has come in alone after being knocked off her bike.
So what happened today?
I was cycling along and then a man on a scooter decided to crash into me. And I sort of went forward I kind of went on my face, so hence the teeth. And yeah, you know, that's it really. It all kind of happened very quickly.
Okay. I'll get you something for the pain, okay?
Dr. Kennedy, please call 2410, thank you.
I remember being in the hospital and kind of seeing lots of couples and sort of thinking about that and kind of how they must be worrying about each other. When you're part of a couple, it's simultaneously this really, really good thing, but it's also a huge gamble in that it could end very, very easily and suddenly.
Got some paracetamol and some the ibuprofen help with the swelling as well in your knee as well. But you don't have to take them all in one go. You can.
My boyfriend, he was killed in a cycling accident. It's been 10 months now. He was on his way to lectures. He was a medical student, and yeah, he died instantly at the scene. So no, I never had to go through the sort of going to hospital. And I don't know. I mean, I'm not sure if I really know how I feel about that. If I'd have rather have had a chance to say goodbye or not. But yeah.
John and his wife Brenda have been together for 29 years. At Brenda's insistence, John recently had a private health screening. The results have sent him straight to King's.
So just to reiterate, I just need to get the story right in my mind. Seen on Friday privately, did an ultrasound scan of your tummy. Take me back in time a bit. Why were you having the ultrasound scan? What were they looking for?
Routine health screen.
Oh, routine health screen.
My name's Jackie Butler. I'm one of the other A&E doctors. Sorry, I'm going to just have a quick look with our ultrasound machine as well. So I'm going to lie down a bit flatter. Is that okay?
Yeah.
People can actually come in and physiologically be quite unwell, but because there's still enough blood pressure to circulate to the brain and the skin and all those sorts of things, they don't necessarily appear sick. Okay, now I'm going going to try not to press too hard.
John's health check revealed an aortic aneurysm, a dramatic swelling of the body's main artery.
Okay, so you're going to feel a big scratch in your arm. It's just going to pop a little needle and take some blood.
So, you know, someone can come in and go, oh, I've got a bit of belly pain. Their numbers can all be basically fine. And then they have this big balloon of a aorta, which at any moment could literally pop. And if it pops, then that can be the end of you. No, that health check was worth having. It was money well spent.
Yeah, sure.
How much did it cost you?
I think it was around 140 quid.
Best £140 you ever spent, I reckon.
Well, you know.
I had a funny feeling that there was something wrong. Didn't know what it was. Couldn't put my finger on it. I mean, I had to persuade him. You know, John's very, oh, I'm all right. But I got him down there, and I mean, they said to him, you are just a walking time bomb.
Did you want to sit up a little bit?
He's got a AAA. He's got an aneurysm. Yeah, he's got an abdominal aortic aneurysm. He's been picked up incidentally on Friday. They've just done a scan, just routine, and they found it. It's about 8 centimetres in diameter. So yeah, it's big.
Vascular registrar Ranjit has been brought in to assess how urgently John needs an operation.
So guys, if you can see, I'm just holding, this aorta normally runs down there, and I actually got my hands around it, so it's that big. And can you see my hands are just being pushed away from each other, kind of a pulse. That's his pulse. So you see, it's that big. You can see it's 10 centimeters, okay? Yours and mine, it would be about that, about 2 centimeters, basically. Okay, so it's quite large. It needs urgent intervention. We're going to get the cardiologist down, as I say. All right, so I'm going to go to the meeting where we're going to discuss you. I'll come and we'll have a talk to you, okay?
I'll deal with you.
Okay.
Dad had some quite colossal accidents. He's competed with bikes all through our lives. But Dad being Dad, he's got up and walked away and come back and done it again.
Wait, you better get going or you'll all get caught up in the traffic.
We're not going anywhere, shut up.
Stop worrying.
We're here until we find out what's happening.
Well, you know what's happening.
No, we don't. Haven't had a meeting yet. He likes talking bikes. He likes to be able to get his say in, which he does tend to sometimes get, I suppose, talked over.
We weren't making a fuss for nothing.
No.
I mean, every time I dragged him up the doctor's, it was like, oh, well, you know, we're checking on him, he's all right. And there you were, threatening to mow the blooming lawn the other night.
That's all right, the lawn takes me round, doesn't it?
Yeah, just what we need at the moment, isn't it?
That could have caused that to go, because, I mean, you might have pushed enough pressure on it.
Not my bad idea, that's quite caused it again.
When I did see couples in the hospital, I was kind of aware that it must be this really intense period of their lives. When I was a child, I used to find it quite fun going to the hospital. And now it's a bit of a scary experience. Having my own accident really kind of put things in perspective. I don't cycle anymore because sort of lost too much to cycling. I don't want to lose anymore. We do forget how vulnerable we are. So I guess, yeah, just to remember that really, and also sort of think about how the risk you're taking are impacting on the people who love you.
What kind of sandwich would you like? What kind of sandwich would you like? Tuna, chicken, ham, cheese?
Cheese sandwich.
Cheese.
You must eat something because it has been.
Cheese with a salad. And we do meal deal for $3.49 with a drink and a crisp. $3.49 with a drink and a crisp. We do meal deal, yeah. It's a hospital kind of thing. Means everybody plays their parts to make sick people to get better. So would you like a drink and a crisp with it?
Yeah, what's
Okay. Something non-fizzy?
Not sweet.
Not sweet. Sugar-free. I wish I could be a doctor, but I'm still thanking God. I'm in a good health, with a good family, and playing the part as a doctor plays to getting people better. Thank you very much. 151.
Antibiotic is the most incredible thing. It's the cure-all. I know, you use it for cleaning and everything.
I told Roly and Leader that, they wouldn't believe me. I said, use it on your surfaces, you won't believe how shiny they'll come up.
Oh, it's been notorious for that for years.
Oh no, it's on, it's oily. I said, no, it's actually a disinfectant. I said, it's terrific stuff. It's the only thing I know that gets my black surfaces shiny and not smearing.
...82-year-old Frida has come to hospital on the advice of her GP.
Hello. Come through. Thank you. Thank you, nurse. Thank you.
Okay. So, I'm Nancy. I'm one of the nurse practitioners.
Yeah.
What's the problem?
This is the ear of mine. The ears seem to be blocked up.
Feels like they're blocked. All
yeah,
right.
there's something in that ear that I don't know what it is.
Okay, I need to have a look. I'll just go and get the right equipment. All right.
Okay, dear.
No, Nance, can you tap?
Can I tap? No, I've never done tap.
Emma's thinking of doing some tap dancing.
Oh.
There's a place on Tuesdays. Listen, I'm a bit heavy-footed. I need a man to dance with. Tap, you dance on your own a bit. Yeah, well, that's no fun.
Jill's done it. Jill's done tap dancing. She did a little exhibition at her.
I want to be in hold, like they do on. I love it, like their hands. How do they do their hands?
I know.
Well, they're all like, and their heads swaying, and they're this way. Oh,
Better find some ballroom dancing classes.
yeah. Alan, do you fancy some ballroom dancing?
Oh, that's sore, isn't it?
Oh.
Sorry, sweetheart.
Oh, that's sore.
Yeah. Oh, dear. You do have an infection in that ear, all right? So I'm going to give you some different antibiotics and some ear drops to put in your ear as well, and hopefully that will settle it down for you.
Okay.
Hello, how are you? I'm good, yeah. Call the blood lady me. If you need anything.
I will. I'll try not to.
All right. I wouldn't do my job if I didn't feel it was important. You know, I want to feel wanted and important. Andrew, I just need to put another cannula in your arm, just so we can give you some more medication, okay? My career is, I'm giving up my life, really. Well, not giving up my life, but I'm dedicating my life to other people. You just keep your arm still there for me, and that gives me a reason, or a good reason, to get up and get out of bed and get to work, because I know that someone needs me. Someone will need me potentially today, tomorrow, and that's a great motivator.
Yeah. I felt absolutely exhausted.
My doctors are here, not doing nothing now. I want some service.
Just come and assess me, please. Get me down to the X-ray quick. Please.
Patrick has been waiting to see a doctor in Miners for 20 minutes.
You know what I mean, babe? I ain't looking to stay in here all day.
People's expectations are that, you know, obviously they are the most important person. They can't think about anyone else. So, you know, they just want to be seen and sorted as quickly as possible.
Excuse me?
Yeah, no problem, baby.
Excuse me? Can you get someone to examine him, please?
All right, then, sweetheart. Yeah. All right, then, I'll ring you back, all right, darling? Yeah, all right, then, baby. All right, take care. Bye-bye.
Hey.
OK, you can look after me now, are you?
Could I ask
I'll ring you back,
one
yeah?
person to stay, please? Otherwise...
I'll ring you back, bruv. I'll ring you back.
Good. What happened?
I don't know, really. I just stepped up a step. You know what I mean? I must have lost my footing somehow.
So it was twisted, basically.
I think I've
nothing
twisted
fell
it.
on it. You didn't stumble and fell on it.
No, I've fallen over on it. Oi! You'll do it.
Ah, you see? As soon as you come outside, real air, man. That fucking recirculated shit going around in there. That's why all the fucking old people catch the old superbug. The old MRSA, RSI, whatever.
You're such a dickhead.
Let me talk to one of our orthopedic surgeons, what they think, okay?
Thank you.
Can they come back in now? They can come back in now, innit?
Yeah, I reckon so. Why not? just sit that so you can examine me. That's it. You know what I mean?
Where are they?
You know what I mean? I feel my thumb on.
92-year-old widow Eileen lives alone. She's been brought to hospital after falling and spending the night on the floor.
Now, Eileen, just as I'm talking to you, different bits and things are going to be happening to you, all right? But just for now, I want to find out what's going on and what's troubling you. Do you understand? Yeah, OK, that's fine. Right, so how old are you, Eileen?
92.
What were you doing when you fell last night?
Sitting in bed.
You were sitting in bed?
Yeah.
What time was it?
After the football, about 10:30.
OK, and did you get up to use the commode?
No.
Why did you fall out of bed then?
I
Did you
don't
roll
know.
over? You don't know?
No, I don't know.
And how do you get out and about? Do you walk with a stick or...?
No, I don't walk with a stick.
OK. Who does your washing, cooking, cleaning?
I take my washing down to a cleaners. They do it while I'm having my hair done.
And you get your hair done once a week then?
Yeah.
Oh, well done. You're a shining example. Do you drink alcohol?
Yeah.
Lots?
Well, it's a lot.
How much do you drink normally?
I had a brandy and
Yes.
milk.
A brandy?
And milk.
And milk?
Yeah, that's
Once
fine.
an evening, or...?
One in the morning and one of the evening.
Seeing as you have got to the grand age of 92, I think if you want a little tipple, we will let you have one. Yeah? OK. Do you get lonely?
Yeah. I never see any of my husband's family or relations.
How long is he dead now?
5 years.
I'm sorry to hear that.
Yeah. And he had Alzheimer's. Horrible looking after somebody like that. I said, because I never knew where he'd be. I always used to find him down the bottom of our road, and he is always down there.
Do you miss him?
Yeah.
How long were you married for?
Something, yes.
Oh, a long time.
Yes.
Now listen, if I could wave a magic wand, I'd make you being 20 and running around again, but I can't wave a magic wand, all right? But I have got a big hospital here. If there's something we could do to make you happy or happier, would there be anything specific that you would ask for?
Another man like my husband.
All right, well, listen, what I will try and do is take your pain away. I suspect, Eileen, having been on the floor all night, you are going to have to come and stay with us for a bit, all right? Right, let's see what we've got to do with you. Now, whoops-a-daisy. Well, no, let's actually just examine her properly first, shall we? I think hands-on and... All right, are there basal crepes?
I'll tell the surgeons, as far as I'm concerned, they should go ahead with it. Now, obviously, the fact that you have got some heart disease will necessarily mean that the operation on the artery in the tummy is higher risk. But leaving it is obviously much higher.
Yeah,
and the reason they're asking me to come and see is there any way we can optimise the heart? I don't think there is.
No.
That's what I'll tell them.
Good on you.
Okay, nice.
Thank you. Not much positive anyway.
No, they're all positive. The only trouble is we're 77 years old.
I'll be honest, to find out something serious is wrong with somebody, having been through it once with my sister, and to go through it again with my dad, I was trying to think about anything else. I was thinking about Dad when he was racing, about Dad mowing the grass, and I was just trying to keep it so that it was normality.
No, you're bleeping again. Oh yeah, according to that, you've got apnea now.
What have I got?
Apnea, you're dead. I'm gonna have to go and move my car.
You know what?
I shall have to move my car in a minute.
What's it? You know I'm here, I'm living.
Yeah, I know you're here, I can see that.
Still be alive at 7 or 8 o'clock.
He's what, Dad? By what?
Probably still be alive at 7 or 8 o'clock tonight.
He says these things almost to tempt fate,
don't
to
worry.
prove him wrong. Where are you going now?
Make yourself ill.
You better pull your kilt down a little bit.
It's the stage where I say like being at home really with bare legs, isn't it?
I know that pain there, man. I know that pain. I know that pain.
I've never had a knee injury before.
I've encountered that before. I have.
I haven't had a knee injury, so it's all new to me, mate.
Yeah, man. I'll tell you what. It's when it rains.
Oh yeah, the coldness.
Yeah, when it rains.
And the coldness.
The change in the atmospheric pressure.
Yeah.
Boom.
So it
That's
starts
when I
burning
feel
your
it.
knees.
Yeah. And so I know. I've got arthritis to look forward to.
Oh yeah. Yeah, I've got it already. To my hands and my elbows.
Rheumatoid arthritis and all them things, yeah. But
you know,
still with it,
I'm
innit?
gonna have it with the knee now.
That's
just to
what it
round
is.
off.
You know? And like the people them I chat their foolishness. It's look like I'm gonna have to go and volunteer down the local old people's home to make sure I can get my spot when time comes.
You have to book early then.
Yeah, that's
book in now.
You have to book early.
Book in now.
Yeah, you have
Pigeon,
to do a couple years volunteering, and then you get your spot in it. That's what them I say.
Yeah.
But
backwards for no reason at all. I hadn't woken up properly, and I fell onto my and I've really damaged my wrist.
Okay, let's see.
I mean, I had just got on the court. We were knocking up, and it was in the first thing, and I just fell over backwards.
Okay.
It's the men. It's always the men. They're all big boys that have never grown up, do all the stupid things, all the dangerous sports. Yeah. they're the ones that aren't dealing with the pain quite so well. It's usually little old men and ladies that are really stoic, and they come in with a broken wrist that they've fallen over a week ago, and you say to them, you know, why didn't you come in sooner? And oh, I thought it would get better, you know, thought I could deal with it, but they don't.
Do you want some paracetamol? He's just had Nurofen this morning. Do you want something else?
I got some. No, I'm fine.
You're okay with that?
It's quite painful, but
Paracetamol to take the edge off?
No, it's okay, all right. But I've got some ibuprofen in my pocket. Just I haven't taken it. It's okay.
You don't want them?
Let's go through all this without it, and then I'll take one.
All right. Just finish. That's right. Just okay it. Okay. And then if ED.
Babe, I'm fucking broken, babe.
It's broken.
I'm broken. I feel really broken.
Your heart?
Yeah.
Eileen, what analgesia has the GP tried you with before?
I've got some pain relief things, but I haven't taken them.
Right, ever? Never taken them before? One. What was it? Do you remember?
No.
Did it make you feel a bit funny, that one, or not?
No.
OK, one moment, sweetheart.
She needs any pain medicine?
Yes, she does.
Can I have a doctor, Teresa?
Hello, X-ray. Sorry to trouble you. It's Liz phoning, the A&E consultant. Hi, X-ray. I've got a 92-year-old lady who's fallen out of bed and been on the floor all night. My suspicion is she's fractured her left hip, all right? But she's tender over the mid-thoracic area and a number of places along her spine.
Lots of times, there's nothing I can do. We are meant to grow old. We are meant to get ill. And we are meant to die. I can fiddle about at the edges of that, but there's no sort of magical response in here, in this hospital, that can change that. And so when people are older, I think what matters most to me is doing what they want sorted.
I don't really want her languishing in the corridor. I think having been on the floor all night is enough, if you see what I mean. Yes, if possible. Thank you. Bye.
Still in there, she needs to be thrown out. 3 is now empty, she's gone to resus, 4's gone to CDU. Dudley folks, the guy.
First time I've ever broken a bone.
See what it is out there then. It's been waiting a long time.
This is horrendous.
This isn't what we got handed
Well, this is
over.
exactly what I just said to you. It was horrible when I came on. It's not nice at all. Last night was nice. This isn't nice.
It's not even that bad out there, really.
OK.
All right. Who's gone out there to help him?
Darren and his girlfriend Alice are waiting to be seen. He's hurt his foot kicking a chair whilst playing a computer game. Sitting beside them is 82-year-old Joyce, who's suffering from a stomach complaint.
Mind you throw yourself over me, you know.
Pardon?
I said, mind you throw yourself over me. Watch it.
Right, do you want to come round? Surname?
Connolly. C-A-N-N-E-L-L-Y.
He was the one that was meant to have had...
Not looking very well now.
Oh, God. I don't know. Yeah. Should we just take him to resus? Let's just go. Oh, God. A minute, yeah. Sorry. Dear. Hi, Charlotte, I'm going to bring someone in that's just gone flat with ambulance. I'm going to have to bring them in. Thanks. I'm going to have to bring them in. I'll get a trolley, yeah, he's just suddenly taken a turn. Let me get a trolley.
Is it passed out?
After being brought in by paramedics, 79-year-old Eddie has suddenly lost consciousness.
Okay, get this stuff. Hello?
Can you get a screen, please? Take out.
Hello, sir? Hello? Right, okay.
Yeah, can we move the child down? Can we use 5, please?
It is, it's all stressful. I've had somebody just literally almost crashed on me and had to rush around to resus. It's just, what was Fiona saying about it being nice? It's absolute living hell.
That's fine. Okay.
Hello? Are you all right? Good. Right, let's check his vehement. It's all right, sir?
I know, I can never find anything.
Yeah, his son-in-law is on the waiting room, but family can speak to him today.
I don't know if he had a faint, I'm not sure. But either way, he didn't look too good.
He didn't, did he?
Surname?
Yeah, but he is conscious now, he knows where he is, and we're just going to check the blood gas now. Okay.
It'd be nice just to make sure that what we're seeing on there that doesn't look like he has P waves, in fact is, I mean, this is perfectly regular actually. That's perfectly regular.
I'm glad you're awake. You had a funny turn on me. Got lovely Charlotte looking after you now.
It does make you afraid to get old sometimes. I do fear getting old sometimes. I fear being vulnerable and not in control.
But trolley's coming in.
He is fine now. He's back, but
I'll go and speak to his son-in-law. Is his daughter here as well?
I don't know. I didn't have a moment to blink.
I'm sure.
But a trolley will come to you first, and then I'll get my one.
Okay.
I'm gonna fuck you tonight.
Hey, can we go for a split? My lazy person.
No, what? A split? No. We'll have a fag, but not a spliff yet. You can wait.
Oh, I'm not sitting here 3 hours without nothing in me, I don't care.
We'll go out for a fag, but we'll have one soon, yeah?
Can we have one now? Please.
Darren, you're just so... We're outside the fucking hospital. Just please, for me. Just leave it, we're going to have one. And when you do have it, it's going to be nice. Yeah?
Yeah, can we go have a cigarette?
Yeah. Don't try and make me change my mind outside, because it's not happening.
Hello, A&E Majors.
Claire, it's Mario here.
Oh, Mario, hi.
Yeah, just give me a rundown. How is the major now?
It's hideous, it's hell. It's horrible.
Right. How many hours?
9 patients waiting, 2-hour wait. Well, just let me get on, Mario, and I'll come talk to you in a minute.
Okay.
Bye.
Right.
I'm just going to go into 6 to assess them.
Yes, please, that's great,
Is there a patient in there?
No, the bed is coming back, and the patient is in the suture room.
Right. And why have they been here 3.5 hours and haven't had an assessment?
Because it's busy, Claire.
Okay.
That's why.
That old lady's rude, man.
Did you hear her? Don't push up yourself on me. That's what he said. He said, don't push up yourself on me. I was like, oh, shut up, man. Come on, gorgeous.
Right, take a seat, I'll get you booked in.
Oh, boy.
A bit of genuine sympathy you just squeezed out of me there, Pete. Genuine bit of sympathy.
Tell you, Bridget. You know what they're gonna say. And push me out when they're ready.
Yeah. You take 1 and 2 tablet anti-inflammatory
That's
and
the
an antibiotic.
Yeah. And we can't do nothing more for
One
you.
crutch. If
And
you
one
get
crutch.
2, you're well unlucky.
Isn't it?
One crutch and out the door, bro.
Isn't it? Yeah.
King's College special. Patch up, heat up, 2 tablet, 1 crutch and out the door later.
A true thing.
On the road again.
It's a true thing. You're not lying at all.
You mean?
It's like we none of us like we don't know what
I come in there, big stab wounds in my face and all sorts. The people, them stitch me up, itch me up, one tablet.
And throw you out the door.
4 o'clock later, yeah. Peace. You know what I mean?
You're just getting a bit weary now. No, mate.
Yeah, for real.
Oh.
You fucking shattered me, man.
Papa.
Shit,
overtiredness.
Yeah. Straight up and down, man. Straight up and down, man.
Papa.
Okay, your body repairs itself better when you're sleeping anyway.
Yep.
Sure.
Right, we're going now.
All right, thank you.
Do you know what ward we're going to? We're going to Cotton Ward. Cotton?
Coffin.
No.
What?
Coffin Ward. Trust you. What was it?
John is being taken to a ward where he'll await major heart surgery.
Do, but everybody else did. I'll check with the matron when I get back. Keep your arm
Hello, it's Claire. You've got somebody, he's a guy with a beard and he's got bandages on his hand or wounds to his hand. Yeah. Can you not let him through to majors or minors? Because he's a nightmare. And he was in this morning abusing everybody, shouting. He may have walked out the department, but he may come back. He's got a beard and he's like, rah, rah, rah. He's Irish gentleman, shouts a lot, quite abusive. Cheers, darling, bye.
I might surprise you and go for a nice wax. Meaning that they wax off your hairs. What, by a woman, yeah?
No.
It's only women that do it.
Swear down there, men.
Swear down, do you really think I'm going to sit there with my legs open and let a man wax me? Are you fucking silly, Dan? Bad enough fucking doing it for you.
I'm not saying a man's doing it. I'm saying all that thing.
Okay. You're not going home tonight, okay?
Oh.
Because we need to observe you overnight, okay? To see how your heart is doing, okay? All right? I'm just going to speak to your son-in-law and explain to him what we've done, okay?
Yeah.
Right. I've just spoken to the cardiologist. As I told you, I just don't like the way the heart is. We're looking at things like a pacemaker. Okay.
That's all right.
Yeah.
Okay.
Should the heart rate go down dramatically tonight,
Yeah.
they will have to do that tonight.
All right.
Okay.
All right. So you think obviously he has got a problem with his heart then?
I don't think, I know.
All right.
He has a problem with his heart, yeah, definitely.
Right. Okay.
Yeah. Right.
You might have to have a pacemaker fitted. But don't worry. Nothing for you to worry about. What matters is that you get well again and you've got to stop falling into the bath and things like that. How many times have you fallen into the bath then? More than once? Well, why didn't you ever tell us before? You never ever told us. Hey? You never mentioned that you can get out of the bath. Don't worry about it.
I want to say something, I don't know what to say.
You've said it all, dear. Said it all. Just do a good job on the next.
He knows.
All I was thinking is, please let this come right. Just let's, let them save him. Because, what else can you do? You're helpless, you can't do anything. But on the other hand, of course, you've got to stay strong for everybody else, haven't you? You can't give in.
He'll be all right.
Just told him, Alida.
Yeah.
Don't do this, you'll set
Come
me
on.
off.
Just trying to be... Sorry.
It's all right, dear. I'll be better.
Get to you. I've been trying to get to you and tell you all the things that I never say.
Don't worry about it. Don't you start. Someone's got a big stand.
Be tough. You're not going to leave me.
I know, all right now.
Now look, you're not loud. No. You know I love you lots and lots,
Yes,
don't you,
yes.
dear?
And I love you too.
Yeah. Don't go and leave me because I can't
No,
manage without you.
God. It just can't be like this because people is people.
I know, and the thing
live
is,
for
we've
so
all been
long.
there, done that.
This is the best place for you at the moment for a couple of days. Find out what's wrong. You can't keep falling over, Eddie. One day you're gonna fall over and, All right then.
Yeah.
Take care. I'll see you later. All right.
Yeah.
All right. Take care then. See you then.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush and the money and the materials and the things. It's the people you love and have around you and the fact that 1 minute they might be there and 1 minute they might be gone. And it doesn't matter how many times you crawl at the ground trying to get someone back, they don't come back. It's so final and it's so shocking, so it makes you appreciate the very simple things of life a lot better.
Hey, sweetheart.
I've scrubbed every commode, filled up everything. Oh my God. How many sickies have you had today? Oh.
All right, sweetheart.
That little one, she's a little madam, she was.
Now, which cubicles don't have blood pressure leads?
Oh my God.
I'm going to write it down because I want them to sort it out today.
Yeah, number 14 looks half and half.
A&E Kings. 2.
Any idea what he was stabbed with?
Policeman said a samurai sword was seen.
At the weekends, it's time to forget about your stress and enjoy yourself. Unfortunately, I think people enjoy themselves a bit too much sometimes.
Just keep breathing. Come on. Come on. Do you not do
Sit down. Sit down now.
Why have they put us in here unadvised? There's so many things to play with.
King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, give them a bit, 50 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Cavino.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
King's College Hospital's A&E department sees on average 350 patients a day, 150 of them in minors.
I remember I got a massive splinter under my nail and I thought, oh, I'll go and get that cut out. And there was a notice that said minimum waiting time and approximately 4.5 hours. And I thought, no, I don't think so.
What did you do then? How did you get the splinter out? Let it go back.
Pulled it out, I think.
Did you?
At the moment, we've got about a 3-hour wait, and you've been here 2 hours, so it shouldn't be too long, because we've got lots of doctors around. Shouldn't be too long now. OK.
Okay, stay sitting up. Stay sitting up. Christian, sit up for a minute, yeah?
You know that old adage, it takes all sorts to make a world? Well, it takes all sorts in an A&E department as well. Right. So what happened to you?
Well, I was drilling a doll.
Yeah.
And because I pushed the whole thing, my drill went into here. I just pushed out the blood and then pushed them together and tried to...
Put the electrical tape on?
Yeah, because this was...
Yeah, no problem.
the closest thing.
You'll still find people that think, well, I'm only just nipping up the ladder, so, yeah, I'll hold a cup of tea, a drill and something round my neck with one sock on and a flip-flop.
Oh, it's stuck back.
Wow. I think you ought to have my job.
I did a really nice job.
What do you do for a living?
I'm a carpenter.
That is brilliant.
I was lucky because I don't hit my bone.
Yeah, yeah. They slip on the flip-flop, they spill the tea that scalds them, the drill goes through the head and they break a leg when they fall. They really think, oh, I shouldn't have really done that, should I? And you can feel all my fingers, you can feel my fingers. Yeah, what happened here?
Benzo.
Oh. Maybe you ought to come in and do my job. You're not doing very good on machinery, are you?
Oh, well, in Hungary, if you're a carpenter and you've got all your fingers, you're not a good one.
Oh, my God. People are stupid, aren't they?
OK.
There was a kid a few months ago and he'd been shot in the leg.
It's absolutely perfect in a minute.
Then it transpired he'd been trying to shoot the label off the back of his trainers or something ridiculous and had shot himself in the leg. What an idiot.
OK.
All right, thank you very much.
Take care of yourself.
Bye.
Bye.
Is there anything you can't handle?
When people trap a finger and you get a blood clot, we have to put a hole through the nail to release the blood. I can't do it without sitting down because my ankles go. Can't do it. Awful.
that thing, isn't it? Hi, King Tony.
Adult red phone, 4 minutes.
In the morning, recess is really calm, the red phone goes, and you think, oh, I hope it's something interesting, which is an awful thing to say, an awful thing for the poor patient. But you do, you think, oh, I hope it's something I could do with something interesting today. Perk the day up a bit, pass an hour or two, make it go by quickly.
A construction worker has been trapped under a cherry picker, breaking his leg in several places and crushing his chest.
William, just take a nice big deep breath. That's pretty sore, is it?
Don't touch me.
Okay, mate, okay, mate. What about there?
No.
Okay.
No.
Not too bad. So it's all on that left side, isn't it? Have you got any pain in the leg here?
Got the whole leg in pain.
Just this whole leg, yeah? Basically, William, we've got to be really careful with you, I think, because
There we go, Brian.
you've had big forces involved. The pain that you've got and the tenderness that you've got in these different areas, we're going to need to basically do a scan of your chest and your tummy and your pelvic area there.
It's just give him some morphine before we...
Yeah, he's got the morphine coming, that's fine.
Say again? What we're going to do is just have a scan of your belly, all right, see if you've got any blood in your belly, all right?
Yeah, 5's good. Yeah, thanks, yep.
They're in a completely alien environment, you know, and they're in pain and they've got no idea what's happening. All they can see is the ceiling. They've got all these people talking around them. They've got, you know, they've got no idea what's going on, and it must be petrifying.
We might get scans all the way down, including his femur. I'll organise those. Is that the trauma radiologist? Hey, it's Graham Fleming here, one of the consultants in trauma and ED. There's a fella down here called William Slegg, who he must be in his 30s. He's basically been crushed this morning between a cherry picker and a parked car. And during the mechanism, he somehow kind of fell, and he's managed to have his chest and his abdo and his pelvis all kind of crushed in this single motion. His whole body basically crushed between him and the back of the car. It sounds kind of odd, doesn't it?
Odd, but it sounds terribly lucky as well. I mean, given the...
What, that he's still with us?
Yes.
Yeah.
One of the saddest cases I ever saw was a man who got home. He smelt gas, so he rang up the gas people as an emergency, and then he hit autopilot. Autopilot for him was leaning against the wall with the phone under his ear, lighting a cigarette. He burnt his entire body except for the soles of his feet. And I recall even to this day the debate we had, because it was a non-survivable injury, but he was completely lucid. And his wife and daughter came to visit, and the question was, should we look him in the eye and tell him that he was going to die in the next 48 hours or so, and that there could be no treatment for him.
Those who are looking for eternal life, for the second coming of Christ, it's not as easy as some people have it. Most Christians, they are not following the commandment of God, and we will be judged by it.
You sure you don't want a flapjack? I'll sit up a bit, yeah? Sit up a bit. Can you put your hand there or not? Can you hold it on your nose?
I'm getting fed up sitting here. We'd be a long while these things take. You know that. You could be here all day doing this.
Do you know how long it will be for him?
Let me check.
check what was the surname again?
Stoked.
Okay.
Thank you.
He's actually the next patient to be called.
Awesome, that's great. Do you want me to wake him up now or just wait till they come out?
Just listen out for his name.
Okay, I will. Thank you very much. Cheers. We went out quite late and someone tried to steal his wallet and his phone and punched him in the face. So we're like, he's got a cut across his nose, which he needs to stitch him. So. He's a good guy as well. I wish, like, it's bad that bad things happen to good people, but it happened. Yeah, I'd do anything for this guy. He's my best friend since we were little. So, yeah, he's a good guy. Oh, is he gonna? Oh. Yeah, it was close, that one.
He said to me, like, you're lucky and unlucky.
Lucky what? That he didn't...
You're lucky that you didn't cut my main artery.
Yeah, and unlucky in what?
But yeah, you still cut it.
Still cut it, yeah.
This morning, 39-year-old Darren was cleaning his windows when he fell through a pane of glass.
There's like a lot of the skin on the arm. It does.
You might have to have a skin graft if it's that bad.
I had to hold the skin back in. You know, it dropped like that and I had to push it in to hold it in.
Yeah.
She said, can you wrap a towel around it? But I thought, how can I with one arm?
Well, you just get a towel and...
She said, get a clean towel, she said.
Wrap around it, yeah.
I just pushed pressure on it like that.
What did you phone, 999?
Yeah. Well, I ain't going to phone you first, am I?
Well, your mum said, why don't you phone us? So, you panic, you phone and...
You have to, don't you, though?
Phone straight away, don't you?
He said, it's a lot of blood, he said.
Let's cut the pints, I think.
You laughed, you didn't see it, did you? It's all up the carpet, it's all up the passage.
All the blood was going everywhere, like, up the wall, on the carpet. Just pumping out, it's like dripping tap.
It's like fingerprints on the walls.
Oh, we'll have to have it redecorating then.
Yeah, like drip, drip, drip. You know, say it's the foot, it goes psh, psh, like that.
William's X-ray results have not yet returned.
William, your girlfriend's here. Do you want us to come in?
But doctors have decided that his injuries are not life-threatening.
We need to keep him strapped down like this. No, he's fine. This is all just precautionary, all right? You sit as you are. Let's get you a chair. Want to come round this side? Come round this side. I lower the bed. All right.
How are you feeling anyway?
Great. It just broke all my ribs and my leg.
So what happened? Basically, you carry some stuff or something?
No. Sorry, I'm grumpy because I'm angry. We have the cherry picker, the big blue machine. You know, the big blue one that can go up to the roof and down.
Yeah.
And the wheels are the same size as tractor wheels. So I had to try and stop the traffic.
Okay.
But at the bottom of the road there was a car there. Where are you at?
Well, I can hear. I can hear. Don't worry.
I thought I was dead. I went underneath and it went all over me.
With the car, I don't get it.
Stop being stupid and listen.
Yeah, listen.
Imagine a tractor is here.
Okay.
A car is here. And I'm standing behind the car in front of the cherry picker so that I can then stop the traffic.
Okay.
The big
Tractor.
Imagine how much weight.
Yeah, I can imagine.
First my leg cracked 3 times. From my ankle to my knee, and I'm shouting, stop!
Shoo, shoo, shoo.
And then my ribs and my body went underneath.
No, you're cool. You're cool. See? You have someone up there who looks after you. You're Superman.
But I heard everything crack as well. 3 cracks in my leg and ankle.
There are some very strange things that happen to people that are not their fault. We had a poor man in where a tyre that he was fixing exploded and unfortunately severely damaged his cervical spine. If you're stuck between 2 huge lumps of metal and those 2 lumps move together and you get away with it, well, that's something to hold on to, isn't it?
I've had a lot of accidents and injuries in my life, but this is the most scariest.
This is serious.
This was the most scariest, because he could...
Typical when everything goes quite well. Something like this happens,
Love you. Love you more. More.
Love you. See you in a bit. I've got to go, Mum. Okay. I'll call you in a second. Okay. Love you too. Bye. Alex, it's time to wake up. Whoa. Come on, man. Let's get up.
Alex has been mugged and punched in the face. His old school friend Patrick is on hand to help.
Doctor's ready. Alex, no swearing, man. There's people around. Don't swear, come on. Oh, shit.
I think it must have been about 12 or 13 when we first met. Yeah, he's a chatty bloke and just wanted to be my friend from the beginning, so...
We've been waiting. We've been here fucking ages. Alex, don't get angry at me. This way, not that way. Come on, this way.
Thought he was a bit of a loser when I first met him, but...
Take my hand. It's good. Sorry.
Wait, shut up. Get.
I'm not on you. Can I come with him? Is that all right? Awesome.
He's one of these guys who's always quite sentimental, if you know what I mean. He likes to... Well, I was going to say show his affection, but that sounds gay as well. But no, he's a top lad. Yeah, he's a nice guy.
Do you want me to push it? He's absolutely massive. Right. I'll push it. It's good. Oh no, honestly, here you go. He's an absolute tank.
I didn't want to go to the hospital straight away, but Pat was like, you need to get it sorted out, because otherwise you're going to be left with a scar. You know, Pat was busy, I'd say, really. He didn't have to go and take me. They could have been a thing, but...
what do you mean he was busy?
Well, he was with some girl that he just met at the club, and he didn't tell you about this, did he? He didn't want me to say anything about it.
Al, you gotta get up, man. What? Alex, no swearing, man. We're in hospital. Would you tell me to shut up? Yeah. You never say that shit to me. We're best mates. You'd be stupid. You swear at me. It's awful. Oh, can I put this somewhere?
Yeah, I'll get you that.
Oh, thanks, man. That's awesome. I'm tired, man. This shit's fine. Mate, you just gotta stay awake for like 15 minutes, just talk to her, yeah? It'll be alright. I've got a feeling this might hurt you a little bit, so...
I do like abscesses. I like draining abscesses and squeezing out all the pus. I know that sounds really horrible, and some of them can be really smelly as well, but it's almost like a sense of achievement. You've got this huge sort of pulsating swelling that's full of bad stuff, and that knife goes in and whoosh, all the pus comes out, and it's just like, I don't know, it's almost like a eureka moment.
When you touch it around here, man.
All right, okay.
You see when I touch it like that?
Is that painful, yeah?
Yes, man, yeah.
Okay,
It's like someone's whacked me with a hammer.
Okay.
It's really hurting me, man.
Okay. I think he's got Achilles rupture, actually. I feel like I thought I felt like a gap.
I don't even know who you're talking about, so...
Sorry. Yes, thank you.
I might have to be on crutches. They said I can't walk on it, man. It's making it worse, huh? So I may have to style it with the crutches, man. All right, just meet me, man. Hurry up, my man. Go on. I want to go home, man.
Right, hopefully that was on what they ordered. I'll get the call from the Hello, Andre. Yep. Lovely. I'll get that. I'll get. Oh, Carol! Oh no!
Head injury, CT. Oh, I've got to go off now. No.
Oh, Carol, sorry. I hit her on the head with the door.
Today, when we go home.
No, you're not gonna go home today. You're gonna stay for a few days, I'm afraid.
No.
Seriously, you have to stay a few days, darling.
Seriously? Why?
Stop being silly.
Can't they just plaster it?
No, you'll fall in love.
How are you doing? Fine. You still got some pain, haven't you? Yeah. So we're going to give you some more intravenous. And if the X-ray confirms the clinical suspicion that you've got a broken leg, the issue will be what needs to be done and when it needs to be done.
They'll be staying here today.
Oh yes. I would say to you, even if you hadn't broken your leg, you need to be with us for pain relief. You've already had 25 milligrams of morphine, which is a good dose. You wouldn't really want to go home with a paracetamol and aspirin, would you?
No way. Am I allowed to drink any water?
I give you again the
We have to
sponge.
wait until we get the films and we see how your leg goes. So we'll get an answer for you hopefully in the next hour or two.
Thank you very much.
I've got Wagamama's face. Wagamama's.
You got what?
Wagamama. Well, I've still got a big Christmas left here from last night. Didn't I? I'm still left here.
So what's this all about then? You've been a hero.
Yeah, genuine.
A genuine hero. Don't see many of those. What happened?
Bit standard for me, though.
Oh, you're one of those, are you?
Modest.
One of the great heroes of our time.
Alex, I love the story. Come on, tell it.
Come on. How did you save a woman's life?
You were on the train station. You were on the platform. What happened?
Fell onto the tracks, smashed back.
Fell onto the tracks? Oh my God, that's really scary.
Freaking out.
Oh my God. So you didn't jump on the tracks, did you?
Someone had to.
Oh my God.
Some people say she's being electrocuted. I was
Come this way a bit, sweetheart. All right, this is going to sting a little bit.
I'm just saying.
I imagine he saw someone in danger, thought, whatever, I'm going to sort this out, and just got in the way and did it. It's impressive. I know a lot of people aren't like that, so that's cool.
So you jumped onto the tracks?
Yeah, and I stopped the train.
You stopped the train? How did you stop the train?
With my bare hands.
Oh no, come on, right, okay, I don't believe that one.
Like Superman or Hancock.
So, yeah, sorry. Go on, keep talking, because I want to distract you from the pain.
Yeah.
The hero story. Well, yeah, I spent a while after that happened telling that story quite a lot, to be honest. You know, to impress the ladies and stuff like that. I think I've ended up exaggerating it so much that I don't even know what's true anymore.
I mean, does she know that you saved her?
No, well,
No.
before she didn't. When we left, she was being brought to an ambulance.
I mean, that is pretty amazing. That is something to tell the grandchildren, isn't it?
Is it painful, Alex?
Not really.
Well, you're a hero, aren't you?
Yeah.
Is that a bit stinging? All right, that's the last one, sweetheart. All right.
I'm not a player like Patrick is, though. He's a bit of a ladies' man these days. He got freezing the other day.
Alex, do you want a photograph or not?
He claims that he didn't even have to do anything. They came onto him. I was like, what the fuck? With that hat on? What the hell?
I hope that's on film.
Did you see my two guys that I had in there? The one that I was suturing his nose, somebody had an epileptic fit on the train station, fell onto the tracks, and he jumped down onto the tracks and saved her. That's amazing, isn't it? What a hero. Yeah.
So what happened to him this time?
Somebody's headbutted him.
Has he been in the store?
my team here for you?
Yes.
Yes. Thank you. Thank you.
Can I have some space, please?
An unidentified man has suffered a life-threatening head injury. Paramedics have given him the name Chris.
OK, if you could have quiet for handover, please.
OK, this is Chris. We think he's 50 years old. He had an unwitnessed fall from an unknown height from a ladder onto concrete. His injuries, he had a large occipital pocket hematoma with active arterial hemorrhage. He's got a traumatic brain injury and a query C-spine injury. He had clinical evidence of right posterior rib fractures.
Do we know how high the ladder was, although we don't
I said an unknown height. It's an unknown height.
No, I understand that, but what I'm getting at is that we don't know where he fell from the ladder, but...
No idea at all. I mean, the ladder was a large ladder to reach the top of the tree, maybe sort of 10 metres.
OK, but I mean, that just says the maximum height could have been 10 metres. OK, that's
Possibly,
all.
Yeah,
Fine.
yeah.
OK. Someone comes in with severe brain injuries and you know there is not going to be a good outcome, and you listen to the tragedy that led to it, and it's not good, but just get on with it. And the priorities are keeping the patient alive, keeping them safe. So the plan is primary survey. If we're happy with him from a cardiorespiratory standpoint, we're going to try and get him in and out of the scanner. Really trying to unlock this phone. Seriously, I want to ring radiology. This is...
Naomi, how do you unlock these things? Look. Where's
It's your mobile.
Do you know how to unlock a Nokia phone? This is my phone to get him into the CT scanner, and...
Shouldn't be the top and the corner. I'll get you these notes.
Do you unlock? Why don't you just use my phone?
Well, no, because I don't know the number.
Oh.
Carol.
Does it come up? Right, let's find someone who can do.
I would say the greatest loss to a person would be their personality and their ability to think and retain information and to talk. So if you gave me the choice between losing 1 or 2 legs and my person being destroyed, then I would give up the legs. Yeah, hi, it's Decotac, trauma consultant. I've got an unconscious gentleman who's intubated, fall from an unknown height onto concrete. He clinically has severe traumatic brain injury. We need to scan him from head to pelvis, please. I don't think... Do we have a name yet?
Chris.
We're just waiting for a number and a name. He's an unknown male, approximately 50 years old.
When Nick first came in, he was, for some reason, known as Chris Unknown. I don't know where the Chris came from, so that was first we heard of it.
I just want to get the ball rolling so we know which scanner we're going to. OK, thanks. Bye.
It's a sort of story you read about the local paper. It happens to other people. That's the classic. It's a paragraph in the local paper, man falls off van, cracks head, goes to hospital, you think, plonker, and you read on.
OK, team, so from the top, Buzz, are you happy?
Yeah, tubes.
That's just for the gentleman down there, don't worry about that right now. We're not concerned about anything in the chest. OK. He's probably fallen onto that, hasn't he? I suspect it could actually be what's going on in his head that's causing that blood pressure.
There was peripheral damage, but clearly the head injury was all they were concerned about and what was very serious. He stressed from the word go that it was a very, very serious case. And you were left in no doubt that when we're talking serious, we're talking life and death. There was no doubt about that.
We need to keep a regular check on his pupils in case he blows one, in which case we need to then obviously hyperventilate him and give him some mannitol or hypertonic. Our aim is, if everything is stable, to get him in and out the scanner as quickly as possible. I've spoken to radiology.
And, you know, one minute you're bouncing around on a Friday morning about to do something else, and the next minute you're in the casualty unit of a major hospital thinking your brother's about to die.
So what did you do about your two?
It's kind of funny. I got to work this morning, sat down on my desk. Yeah, I just pushed my chair back to get up. And I just landed on the floor. You know what I kind of... It wasn't a hard landing. It was, it was just like funny, and everyone was like laughing, you know. And
It's Taylor.
God, I felt this sharp pain. I'm like, my God, hope I haven't slipped a disc or something.
Okay, so you've been in, 2 hours.
Yeah. You still need your paper?
I do. I haven't read it yet, but go on, you need it more than I do.
No. If you haven't done it.
No,
Are you going on the trains today?
It's all right, I'll go and get another one.
Oh, thanks.
Right, my name's Kim.
Right.
I'm one of the emergency nurse practitioners, and I'll be dealing with you today. So what's happened to your finger?
I was preparing a casserole to entertain some people tomorrow, and I was cutting vegetables last night and using what they call, I think, a mandolin cutter. You know those things? You probably have.
Yeah.
And unfortunately, I took a little piece out of my little finger.
Okay.
It's not desperate, but it
Okay, this is
produced
last
a lot
night.
of blood.
Oh, it will.
And this was after 10 o'clock last night, and I thought of coming down, and I thought, no, I'll manage. So in the end, I managed to stop it and bind it so it didn't, and put an oven glove on in bed, really.
Those mandolins are very, very sharp. Very good, but very sharp.
Yes, they're very quick, but I think it was a bit late at night, really, after 10 o'clock, and I was just beginning to think I ought to stop doing this, really.
And then you did.
And I did.
Okay, let me go and get a dressing pack, and we'll soak that and try and get that bit off and see what it's like underneath.
Okay.
All right?
Yep, that's
Give me
great.
2 seconds. Well, more than 2 seconds.
I thought, what a stupid thing to do, really, immediately, you know. How very stupid to allow yourself to do that. It's a very difficult position when you're living by yourself, you know. You've got no one to call upon. I've got used to it over the last 6 years or so, I suppose, but, you know, normally my wife or I would turn to one another and say, can you help me do this, or whatever.
Did you put cotton wool on it last night? I thought so.
Yeah.
But regrettably, she died in 2004.
I'm sorry about all that cotton wool.
That's all right. It's coming off.
Yeah.
I had to care for her for about 6 years. There's a gradual descent into a worse and worse condition until you get to the situation where she could no longer live at home. She had to live in a home, of course, for the last year or so of her life.
Oh, yes, you're adept at it. So I can't go and
All paper
shower
material.
with this.
No, put a glove on and tape it up.
I suppose that's the only answer, isn't it?
Yeah, another marigold.
Another one. Thank you very much indeed.
Take care.
Bye.
Okay, bye.
Caring is quite tough going, especially towards the latter part of it. And you stand by waiting for the next step where things will get worse.
I actually want to go with this gentleman to the scanner because I need to see the images of his head immediately. Because that will... What will happen is... He is, and I strongly suspect that it's going to be not a happy story.
Both my mother and father, I ended up looking after to one degree or another. But this was different again. This was another story. I think my biggest concern was the cabbage option. And there's no doubt there's that scenario where you are better off gone and finished than just in a total mess. I think that's a worse nightmare than being dead. Would be for me, I know that for a fact.
hello.
Hi.
Hi. Can I just eject you from your seat? Thank you very much. I'm Nancy, I'm one of the nurse practitioners. So what's happened?
I slipped to clean the window, and as I slipped, I put my arm through it.
You were cleaning the window?
Yeah, and I
Yeah.
leant forward, and as I leant, I lost my balance on the seat, and my arm went on it, cracked the glass and went through.
Oh dear. Did it completely shatter?
Yeah, there's still
Yeah.
like sharp pieces stuck in the frame of the glass of the window.
Yeah.
That's it.
Oh goodness me. I think probably what I want to do before I look at all of the
Yeah.
rooms is actually send you for an X-ray,
Right.
see if there's any glass. What I do want to do is just remove that little bit of glass off your face because I can see it there.
Okay.
All right, you just close your eyes for me.
Quite honest, I never thought he'd have it in him to go to the phone like that and actually phone 999. He had a bad accident years ago, which was... But to see another one, and then you think to yourself, oh, no, not again, please.
Okay, that's that. Okay, all right, if I show you where to go for your X-ray, all right?
When he was about 14, 15, I believe. It's such a freak accident, it's unbelievable. Basically, this moped come from the other side of the road, and his brake handle thing caught his lapel and went into his lapel and threw him up in the air, and he come down on the back of his head and fractured his skull. Freak accident, really. The bike didn't actually hit him.
All right, and I'll see you when you get back.
Right.
Okay.
I thought at the time he wasn't going to pull through because he was okay in the ambulance, but when he got to the hospital, he passed out. Pretty horrific, pretty frightening.
Like send a vet X-ray. That way, look X-ray. Is it that way?
Through having that brain injury, a lot of brain cells died, and who knows what he could have been today, you don't know. So obviously, I feel a bit aggrieved about that after all these years still, but thankfully he's still here. You know, you have a brain injury or you have a head injury like that, it could have been a lot worse.
After an operation on his brain, Nicholas was brought out of his induced coma. The full extent of his injuries is not yet known.
We're going in favourites. Cricket starts on Wednesday. First test at Brisbane. And we're starting as favourites. Won all the warm-up games. Not sure that's a good thing. Whereas we didn't know whether or not he's hearing anything, you could look at those eyes and know absolutely 100% they weren't seeing anything. Or if they were seeing anything, that they didn't understand anything they were seeing. All right, I think you're better off resting, Sunshine. Yeah. You hear my voice? And again, it invoked the worries of what are we going to end up with here? I mean, we've got a massive problem in the modern world with people living beyond their not just enjoyable life, but their useful life, their meaningful life. I don't know how to... we are keeping alive people that just really are better off not here. OK, mate. I'll see you in a couple of days. A bit more progress. Yep. All right. See you in a couple of days. Good luck.
Having looked at the X-ray, it looks like it's quite a big wound. So until I've actually taken all of the bandages down and seen exactly what I'm dealing with, I can't say exactly what I'm going to be doing with you.
Right.
All right.
I spent half my life in hospitals. If you only knew how many months of the year I've actually spent in hospitals with my kids being younger as well. I just want to get in and out. That's all I want to do. Yeah. So I've had my fair share of hospitals, I can tell you.
So let's take the bandages off and see what we've got.
I'd rather not look.
OK, that's fine. You don't have to look.
And, you know, it'd be just nice not to have to go to them. But unfortunately, that's what they're there for.
Yeah, I mean, there's lots of glass on the surface.
Oh,
right, sorry, sweetheart. Oh, OK, so that is more your hand, isn't it?
That's painful there.
That's lovely. All right, I will need to put some local anaesthetic into the skin there because I really need to have a look deep inside, and I can't do that obviously because it's going to be a little bit too painful for you. That's going to be the worst bit. That's going to be the bit that stings.
Right.
And then after that, you're not going to feel anything.
All right.
All right.
When you say stings, what, bad?
It's not bad. It's, you know, it's bearable.
Yeah.
Yeah. OK, so this is the local anaesthetic.
Oh, not the other way.
All right, the hand will probably be the worst, so if we get that one out of the way first. All right. Sorry, sweetheart. All right, take some nice deep breaths for me. Well done. You're doing really well.
It wasn't that bad as I thought it was.
There you go, you see.
Yeah.
Often it is the expectation that's the worst thing, isn't it?
The thought of it is worse.
Yeah. And what I need to do, I just need to have a good look underneath this flap, all right, and see what's occurring. So there's no tendons visible.
Right.
All right, that's the important thing.
Yeah.
So I'm going to give it a good clean.
Yeah.
And stitch it back up.
Okay.
But there's no major damage done there.
Ooh.
Can you still feel that?
Yeah.
Is that really painful?
A bit, yeah.
Do you want some more anaesthetic in there?
Bit, maybe, yeah.
Yeah?
Yeah, you do worry over these things, you know, you just... if you're worried about it every day of the year, you know, you put yourself in a box, really, worrying about it all, but you have to take life. Life has to go on, doesn't it? You know, whatever accidents you have to sort of move on from that, and otherwise, you know, if you just keep thinking about it all the time, it plays on your mind all the time, it sends you mad as well, so you have to move forward.
Hello. Yeah, 3 cracked ribs, broken my leg in 3 places. How can it be my fault? Yes, they did. Yeah, they did.
Oh, your colour's off. Yay.
Yeah, colour's off.
Bye-bye, take care.
Thank you.
Any worries, come back and see us.
Thank you. Thanks a lot.
I just think it's not very wise to stand on a chair with socks on because you can slip. Should have used a ladder properly, like a step ladder, you know, for more support. So I think it was a bit silly, really.
You play the cards that are dealt you, and you get on with it. You don't run away from it, and you don't feel sorry for yourself, and you just do your best. Had a motto at the time: hope for the best, prepare for the worst, which is what we started doing, and you know, hoping for the best won out.
You just don't think that it's going to happen. If it happens to someone else. The fact that I'm walking, talking, and getting around is fantastic.
Kings, without doubt, gave my brother back to me, and you know, you're just lost in admiration when you walk into that intensive care unit. You just feel stupid.
Has he told you he loves you?
No. No, we're not that close.
Hello, King's Emergency Department. Stuart, I actually think you're having a heart attack as we speak. David, can you stick some oxygen on? What? This.
Oh, it's
Just taking
the pain of it.
I'm going to be blunt and I'm going to say this patient is going to die if he does not get critical care input.
That's the real bottom line, isn't it? Am I going to live or am I going to die?
He's looking at you, kid.
Here's looking at you.